YouTube be on some other stuff. Let me check my phone. Happy Sunday, everyone. Happy Sunday. I hope all is well in your world. I don't even know if I'm streaming right now. This is... You know what? I have a dream that one day, I'm going to be able to do this without having to double and triple check everything. Okay, it looks like I'm streaming. Great. Awesome. Now, let's check if notifications went on. Yes, they did. Okay, I just got it. Perfect. Okay, everything, all is well in the neighborhood. All is well in Romy's neighborhood. All right. Yeah, I hope everyone's been having a great Sunday. I actually, again, was supposed to stream earlier, but I got caught up in something else. Yeah, so I will share it probably in my Discord or later on. But for now, I'm here. Nothing crazy. It's just that, yeah, I had to tend to some things, work-related things, and now I'm back. So, hope that everyone's having a great Sunday. It is, I think, officially fall. Hold up, when is fall? I think fall is officially today. Let's check. Fall. I believe it is officially fall today. When does fall start? 2025. Oh, tomorrow. Tomorrow's officially fall. So, you know, I'm dressed for sweater weather. The weather's already changing. It's really windy outside right now. It's a little chilly. So we're getting ready for fall now. It's pumpkin spice season, y'all. Pumpkin spice season. Hold on. Let me put my comments on. My bad. I didn't even do that. All right. So let's see if anyone will join. If not, that's okay. I'll wait for people to show up. But yeah, it's about to be pumpkin spice season. Y'all already know. So we're getting ready for the pumpkin spice, the pumpkins. Everything's about to come out soon. Yeah, it's going to be wonderful. I really hope so, actually. I love fall. Fall is a beautiful season, I must say. Yeah, so... Let me see. I'm going to make sure, because sometimes my comments be a little weird, y'all. My comments be a little weird. Okay, yeah, you see, hey, Rose Aesthetic. How are you, sis? Hey, Evanescence. How are you? How are you guys doing today? Rose Aesthetic, you said it's raining here. Oh, it's raining? Yeah, it was raining for us. It was raining yesterday. Yesterday, it was raining for us. Today, it's not raining anymore. Thank goodness. Last night, though, it definitely rained last night, I must say. Hold on. Let me see how I can get these comments on. It never fails, y'all. Every time I do this, the same thing. I always have to go to my restream and see the comments. I had a feeling that it wasn't paired up. But yeah, it's going to start raining. We have our rainy season starts in November. So here, yeah, where I live on the West Coast, it doesn't snow, actually. It doesn't snow a lot. Like last year, it only snowed twice, as far as I remember. Yeah, last winter, it only snowed twice. And when I talk about snow, I'm just talking about snow that falls and then it melts the day later. I love that. I love that for us here. But rain, yeah, rain. We do get a lot of rain. We get, well, I would say compared to Vancouver, we don't. But it does rain here compared to other places, yeah. We do get a lot of rain. And it's going to be rainy season soon. But hell, I'll take rain over snow any day. I used to love snow, you know, back in the day. But now I don't love snow anymore. I don't like it anymore. Snow is just when you're a kid, it's, I don't know, maybe some people still love it. I think it has its moments. Like when it's Christmas and, you know, it's snowing outside and you see the flurries, it's beautiful. It's a beautiful thing. But then when you have to shovel the snow and then you have to get rid of the ice on the car. Oh man, y'all, you're taking me back, man. Like, I don't know how I got on this subject of weather, but I remember in Montreal, when I lived in Montreal, oh Lord, I hated it. I had to de-ice my car like every morning. Oh, it was brutal. Thankfully, I had neighbors who were very nice. They used to like use a snowblower, help me kind of clean my car. They were so sweet. but I hated it. I hated it. I hated it. I hated it. So I'm really happy that I no longer have to do that. Hold on, y'all. I'm trying to get my chat box going. Okay, chat box is here. I have to do this every single time. It gets to a point, y'all. It gets to a point. I'm gonna have to figure out how to keep this going all the time so I don't have to keep changing it. All right, let's change this to brown. Then we're gonna move it to the other side. To the other side. But yeah, so let's see here. Okay, we're here. Okay, now my chat should be fine. Hopefully it's embedded. I don't know, y'all. I'm gonna have to figure out what's happening. Let's see if it restarted. It didn't even restart. I can't see y'all. This is so annoying. I can't even see the messages. Am I on the right thing? All right, if I cannot see your messages, that's okay. You know what I'm gonna do? Okay, I think this one should work. If I can't see your messages, I'm gonna try it one more time. If it doesn't work, I'll just check it on my phone, because I don't want to waste time. I don't want to delay time today. We got a lot to cover, y'all. Today's going to be a lengthy day, but it'll be very educational. And it's kind of like similar to yesterday's conversation. We're going to continue having that conversation because I think it is very essential for us to do so. So hold on a second. Let me just delete this. Let's start over. You would think that I would have this like prepared. Like every time. It just never fails. There's always something on my stream that's not proper. I think it's me at this point. I can't even blame this system. I think it's just me. I'm learning as I go. All right, we're going to try it one more time. If this doesn't work, then I'm just going to check comments on my phone. Yeah, but anyways, beautiful Sunday morning. I hope you guys were able to go out if it's nice in your area and enjoy the weather that is going to be fall soon. I can't believe 2025 is going to be over, y'all. This year went by so fast. So much going on, but we're still here. We survived. And for that, we should be happy, y'all. We should feel very blessed. We survived, y'all. We're here. Okay, perfect. I got the comments now. Yay! Hey, the star that fell. Hey, sis. You said that's why you rent and don't drive to get around shoveling snow and cleaning ice off your car, for real. You ain't lying. You know what, dog? Like, we have an underground parking in our apartment. Or if you have a house, you gotta, yeah, that's true, because you gotta do it yourself. You ain't lying. That's true, because when we in our apartment, like they do all the cleaning for us. Yeah, they do all the cleaning. They shovel everything. We don't have to do anything. So yeah, very, 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 very good observation. You're so right. You ain't lying, girl. You are not lying, sis. Hold on, let me change the color again, because I can't. Purple? No, let's just do what we did yesterday. I don't got time for this stuff, y'all. All right. Why isn't it changing? Okay, why is it purple? Hold on a second, y'all. I'm getting distracted now. Wait a minute. Okay. Okay, what did I just do? I'm sorry, I'm just changing the color again. Give me 1 second. I'm going to change it to the color we had yesterday. Yesterday, I could see the comments, so it's just better for me. Okay, we'll just change it to blue today. Okay, here we go. All right, there we go. Kierra said, I love these live streams because I feel like I'm in life class. Oh, thank you. Thank you so much. That's what I want. And that's why, in the beginning, I kind of talked about, I talk about different things. Like, if you guys watched my past live streams, like way back when I started, like when I didn't even know how to do screen sharing, and I was just sharing stories and like, different type of social issues. I love that stuff. I'm very much a person who likes talking about different topics, but especially because everything is connected, y'all. Everything is so connected. And if we talk about relationships, we also have to talk about finances. We also have to talk about health. We also need to talk about child rearing. We also have to talk about parenting, parenthood. We also have to talk about so many different factors. Mental health. I mean, everything is all connected to each other. So that's why it's very important for me to share all of the different correlations that that affect relationships. It's not just, oh, you meet your husband and then, oh my God, everything's going to be great, right? No, there's just so much that goes into it. Religion, I mean, everything, politics, it is all connected, y'all, all connected. So let's get started because, today's live stream is going to be very important. So I actually had something completely different scheduled for today's live stream. However, due to the topic that we were discussing yesterday, I think it's very important for us to continue on talking about health. And another thing that a lot of people don't know, and I'm going to share right now, I think is, might as well share. It's public information anyways, to be quite honest with you, is that I know I told you guys I'm a public servant, but I didn't tell you guys which ministry I work for. I work for the Ministry of Health. And I see a lot of different things that, we do in healthcare. I work for basically, I don't want to get too much into detail because I don't want people doxing me, but I do work for the Ministry of Health. And healthcare is very important to me. We do a lot of things surrounding healthcare. And when I tell you guys things, it's because these are issues that are happening not only just in my country, but also all over the world. Healthcare is extremely important, y'all. Extremely important. And the more that I research and get an understanding of it, the more that I want to share with you all when I can. Obviously not every conversation is going to be about healthcare, but I do want you guys to be aware of the system that we currently have in place. And it doesn't matter which country you're in, it's a global issue. Access to healthcare, access to equitable healthcare is a very known issue, and it's only getting worse as our economic situation worsens, pretty much. And the impacts that it has on us, it will be felt for a few years. I'll be honest with you all. Now, is there hope? Absolutely. There's people like me working behind the scenes trying to get things going. However, I do have to let you know the current state of what's happening. And in order to understand where we're going in the future, you have to understand the past and you have to understand what's currently going on. And a lot of people do not realize how important it is to have your finances in order. This is why I said yesterday, if you caught the live stream, if you didn't, that's okay. You could catch the replay later on when you have time. This is why I said yesterday that long-term planning is very important. And it's something that I know I wasn't taught that. I don't want to say that every Black household wasn't taught that, but just based on my family and my family, cousins, people within my whole structure, my family structure, siblings, we weren't taught that. We were not. And I do believe that it is a community issue because we're not the only family who wasn't taught that, right? Or who weren't taught that. I know many families where long-term planning wasn't advised, and it's we live day by day, just the same thing as paycheck by paycheck, right? And unfortunately, this can have an effect, especially as you age, especially as healthcare becomes more unaffordable, especially in some countries. And even in my country, yes, healthcare is affordable. We do have universal healthcare. However, a lot of us don't have family doctors. I don't have one. Just letting y'all know. I don't have a family doctor. When I moved back to Canada, I'm still on the waiting list, y'all. It's been 2 years. They still have me on the waiting list. Dom found a doctor before me. Imagine. They already got Dom lined up with a doctor, y'all. Imagine. Yep. He has a doctor, y'all. I don't have a family doctor. They haven't matched me with anyone yet. And it's so interesting because Dom was I think it's because the doctor's Asian, because it is an Asian doctor and they just matched him up. But for me, I'm still on the waiting list. And the reason I've been getting all of my medication and all of my healthcare is because I've been using telehealth. That's the wave of the future, y'all. Telehealth. And so I just log in and then I make appointments through there. And that's been saving me, to be honest with you. If that wasn't the case, I would have to literally go to the emergency room if I had an issue. And I did last year, actually. I went to the ER, not last year, it was like 2 years ago. when I had my official wedding after Korea, I wasn't feeling well. I couldn't even go to the family doctor, y'all. All the clinics, it was hard. Like, I kept calling because in the province that I live in BC, you have to go to urgent care. And when you go to urgent care, you have to call early in the morning in order to get your spot, because ever since COVID, they don't let people wait. Remember walk-in clinics? You could actually walk in. There's no longer walk-in clinics like that anymore where I live. You can't just walk into a clinic. You have to call them in advance, get an appointment, and then you could go. Imagine. So I had to call. I was calling urgent line. I kept getting hung up on. By like 10 minutes later, I'm not even exaggerating, y'all. 10 minutes later, I called for like 10 minutes right when they opened. And then they already said, oh, our spots are full. You're going to have to wait. Call back or go to the ER. And so I started having like these weird symptoms, like heart palpitations, all this stuff. And so I was like, okay, I need to go see someone, because it happened for several days. And then I think it was because I was in Korea. I was eating all types of food. I think that I was just not having a good reaction to it. I noticed that whenever I start eating a lot of like heavy, like sodium heavy foods, my heart just starts going crazy. It's high blood pressure symptoms. And I do have a genetic predisposition for it, because my dad's side of the family has high blood pressure. So... and diabetes on top of that. So I kind of was concerned about it, because I didn't know what it was. But anyways, thankfully I went to the ER. But guess what? I had to wait in the ER for like literally the whole day. I think I waited for like almost 15 hours. And then after that, they told me to come back because they wanted to do an ultrasound to make sure that it wasn't anything like related to like my heart or like, you know, my uterus. So then I had to go back again the next morning, waited another that time it wasn't as much. I waited like 7 hours. So I spent the whole weekend in the ER because I don't have a family doctor. And I didn't. And I still don't. So these are the things that we have to start thinking about. Because imagine if I get pregnant right now. Yes, I can probably get a family doctor because they'll put me on high priority as far as the list goes. But at the same time, what kind of care am I going to get, right? And also, I would be subjected to the public health system. Because again, I don't have a regular doctor who knows me, who knows my charts, nothing. It's just every single time that I go to the doctor, it's like, what are your symptoms? Okay. It's just, again, it's more of like, it's not preventative. It's more like our system is not preventative. It's more so if you have an emergency, then you go to the doctor. If you have an issue, you go to the doctor. But they don't have my whole history. They don't have anything. So it's just very like alarming when you think about it. And then if you're supposed to have this like emergency, like, let's say you get pregnant, you have an emergency. How do you know you're going to be seen in time? Because sometimes like you only have a small window to go see someone. And if the ER is packed, when I tell y'all the ER was packed with people, packed. And of course they prioritize the most urgent cases, but again, you have a shortage of doctors, shortage of nurses. They're also dealing with homelessness because a lot of people have a lot of mental health issues, drug issues. And then on top of that, they're clogging up the ER system because they're showing up. They have to get a detox. Nurses are having to deal with an overload of people in the emergency room. And that's because a lot of family doctors are quitting. They don't feel like they're not getting enough compensation for this. That's our system in Canada. I'm just letting y'all know what's going on. And it's not just my province. It's all over, across the board. So a lot of family doctors are closing shop, or they're older, they're retiring. And so we have a shortage. So now, when we were watching that video about them talking about Russia have a baby, this is what I'm talking about. They're not talking about these type of disparities. They think like, oh, you just gonna have a baby, just walk out fresh out, you know, and we gonna be able to just do whatever. No. In order to get the best care, you need financial resources. And even that is not enough. Imagine. You have to put yourself in the best possible case as far as health and economically. You have to worry about those two things before you can even think about other things, is what I'm saying, like family planning, etc., etc. Because if you're not there to be there, if you're not there for your children, meaning that you have all these children, and let's say you're not there for them, or you have a health issue or something happens to you, then it's going to be a hard life. And this is how Again, poverty just keeps going on and on. That's how it keeps repeating itself, is because there's no long-term planning. And I had to start it off. I'm sorry to start the stream off so grim, but after last night, I really sat and thought about it. And I was like, oh yeah, we need a wake-up call. We need a wake-up call. Big time. Big time. Okay, I'm going to say, hey, y'all. Hey, y'all. Hey, Devonda Pittman. Hey, sis. How are you? What is a family doctor, a primary care provider? Oh, the Star That Fell. Yes. Sorry, I forgot to say that. Star That Fell, are you in the U.S.? It's different. I know it has different names. In Canada, family doctor is your primary provider. Yes, so your doctor who knows, like, who you go to seek medical help from. So basically, in Canada, how it works is that you find a family doctor, and then once you have a family doctor, if you have any issues, you go to make an appointment with your family doctor, and they're supposed to refer you to a specialist. And the specialist, like, let's say, for example, I had a lump on my throat here, and I was like, let me check it out because I want to make sure it's not cancerous. You know, a lot of people have thyroid nodules. So then I had to, because normally the steps would be I would go to my family doctor, schedule an appointment, they would check it, and then they'd refer me to a specialist. However, now I don't have a family doctor, so I had to go through telehealth, and thankfully they have set me up with a virtual doctor, so that's awesome, and I'm really happy that this system exists. So then they checked out, they sent a referral to the specialist directly because they talked to me on the phone. They're like, okay, what's the issue? She was super nice. She was like, hey, you know what? I don't think it's anything, but I'm going to refer you to a specialist just in case. We'll get an ultrasound. We'll check it out. I went and got my ultrasound. And then they referred me to the specialist, an ENT, who I'm still waiting to see, y'all. It's been 3 months, 2 months. Matter of fact, thank you for reminding me. I gotta go and call the telehealth and be like, hey, I still haven't gotten a phone call yet. They're like, well, if you want to get sped up, like if you want things to speed up, you're going to have to see your ENT in another city about an hour away from here. And I was like, okay, just schedule it, and then I'll just get Dom to drive me. But if I were to get an ENT doctor in the city that I live in, they said that it would take at least 6 months to a year. Imagine if it was cancerous. I don't believe it's cancerous, to be honest with you, but I don't know. Imagine if it was. I'm waiting a year. And then by the time they find out it is, I'm already probably staged something else. That's what I'm saying. Like, it's really, 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 really extremely important to know the system that you're living in. And everything affects and impacts what your choices are. So my point is this, like, we have to start planning things ahead of time and being mindful of the decisions that we make, because they're going to affect us in the future, whether you like it or not. And even if you don't have kids, when you retire, who's going to help take care of you? Because you're going to be older. You're not going to be able to move like your Mima and Pop did. We don't know, right? Everyone has a different situation when they get older, right? As we age, we might need more health care. You need to be more aware of those things and keeping your body, again, and I'm saying it as a work in progress. That's why I started just eating cleaner, started working out more, and I was like, you know what? I really have to start taking that seriously, because I don't want to be a burden on the system as well, right? So there's just many levels to it. But yes, and that's a family doctor, your primary care provider. Devonda wrote, hey girl, do you think you could do a case study of parasocial relationship people have with Nick and Alandria, because it's getting weird? I will do that. It's very weird, y'all. Oh my God. I don't know what's happening. Like, people are just, I think people are living vicariously through others, and it's not the move, y'all. It's really not the move. I really honestly believe that people are doing that. Sorry about that. People are definitely doing that 100%. So I'll talk about it. Yeah, you said you're in the US, sadly. Yeah, I figured that much. Yeah, I knew it. Yeah. Oh yeah, I know you on Discord. Okay, I remember. Yes. Yeah, I knew you was in the U. You had to be, because I know it's a different system for you guys. Parasocial relationships, that's a good one, y'all. You know what? I might have Dom talk about it with me. I want him to give his perspective on that too. I think it would be very important for us. Hold on, y'all. Sorry. I don't know why my chat box not showing up. Let me see if it's going to show up now. My bad, y'all. If it doesn't show up, I'll fix it. I'll figure it out. Let me just leave it how it is right now. But yeah, parasocial relationships. Let's jump on that real quick. A lot of people are very weird, y'all. Extremely weird. And I think, again, it's connected to what's going on. People are fixated with other people because they're not happy with what's going on. They're not happy. And if you have that much time to be focused on what other people are doing, that lets me know that you ain't got nothing going on. You ain't got no motion. You got too much time on your hands. What are you doing with your time? It's either that or we have children who are on social media, and they shouldn't be, to be quite honest with you. Because you're going to get childish reactions when childish people, they will be parasocial. But even the adults too, it's just everybody. Everybody's just, we have too much time, and we're too much people are spending too much time on this instead of reading and researching. That's what's going on, educating themselves. Love Island again. This isn't over yet. It's never over. It's never over. It's never over. This is a season where it just keeps going and going and going and going. But I'll probably do a live stream on that later on. When I talk about, I'm going to do a live stream on Love Island games when it's done. And then I'll include that in there, in that whole segment. Yeah. But yeah, they are doing the most, y'all. They've been doing the most. Wait, how long we been on here? 26 minutes. Okay, that's enough for us to get started. Let's get started now. You said you see a documentary on Paramount Plus about parasocial relationships with old women and a TikToker. I'm not surprised. I'm not surprised at all, because a lot of people are not getting those connections in real life. That's how you know. This is another thing too. We're going to probably do a whole live stream on parasocial relationships. That's actually a really good topic. I might do that next weekend. Let's see if I can do it next weekend. I need to find research on that. The reason why is because a lot of people do not have connections outside of social media. I'm being honest with you. They don't. And this is why you're going to see a rise in parasocial relationships, because people are lonely. People are very lonely. And a lot of people don't have the social etiquette as well. And I think it's because, again, these are things that have to be taught. And unfortunately, when you have a generation of people growing up on their phones, and then you have the adults also on their phones entertaining it, then this is what you're going to get. They think it's real life. That's the problem. That's the issue. Lack of coping skills is the basis of a lot of turmoil. Exactly, sis. Shauna Michelle, right on the money. It is. And you know what it is? It's because also they weren't taught that. So I can't even fault them. Society hasn't taught them. And then also it was something that I learned, to be honest with you. If you're a millennial or zillennial, because I learned that term yesterday. I know zillennials are like end stage. Millennials kind of in between Gen Z and millennials. If you're a millennial or zillennial, we're the last generation where we didn't have the internet like that. So we actually had to have social interactions. We had to learn how to talk to people. We learned how to network early on because we was outside playing. You had to get along with the neighborhood kids. You had to get along with this squad, that squad at school. We didn't have phones to distract us. And when we did have phones, I remember my first phone I was 16 years old. My first cell phone was a Nokia. Old school. Hold on, let me pull it up. Old school Nokia. 2002. Let me show y'all the phone I had, y'all. Here we go. Y'all gonna see it here. Hold on. Let me fix this screen because I'm blocking my face now. Here. Y'all, I had this phone right here. Hold on. You know what? Let's take this browser off. I can't even see y'all comments. So we just gonna sit it here. This was my phone, y'all. My first phone. This one right here. Yep, this was my phone, my little baby. Yeah, my baby. And I used to play Snake on it. And I could only text. You couldn't even go on the internet on your phone. I don't even think that phone had internet capabilities. My first smartphone was a BlackBerry. I was in my 20s. early 20s. That's what I'm saying. I already had those social skills, and I know a lot of us who grew up during that time, we had social skills. We developed them naturally. However, unfortunately now, with phones being so readily accessible and affordable too, there are no social interactions. You're going to see a group of people get together and then they're on their phones. Phone dependency. It's crazy, y'all. It's an addiction. It's an addiction. Nokia was a fly phone. It was, y'all. Yo, I remember we used to be able to take the top off and then have the, you could get the lights on it. Oh, sorry, y'all could see my lint here. I should have taken them off. But yeah, you could see the lights on it and it used to light up. Oh, I thought I was it, y'all. I thought I made it with that little phone. And I only, you know, the funny part was that I could only get free text. I think it was free calling and text messages between 6 to 9. Oh, I was on that phone between 6 to 9 o'clock. I was like, messaging my friends like, oh yeah, talking nonsense, y'all. Just talking nonsense. But my point is that we had to have face-to-face interaction. There was no social media. And when we were on the phone, it was the landline. So it's not like you could get distracted by being on your phone and the internet while talking to someone. It's like I actually was talking to somebody and we were just talking for hours. And then hang up the phone, go play with your friends. Like, that was my childhood. So that's why I know how to balance social media and real life very well. You will never see me on social media like that ever. Except for YouTube. This is the only time you'll see me on social media. That's it. When I'm, doing something like that. And sometimes I'll be on social media just scrolling, going through stories. But again, there's a time and a place. I actually go out with my friends outside of YouTube. I actually meet with people, interact with them, socialize. We got to learn those skills, y'all. So this is why parasocial relationships are getting worse and worse. Because people are fixated on them. Because, again, you feel like you know someone, but you don't really know them. And then if you don't have any social life outside of that, then it's going to make it very hard. And then you feel like you could tell people what to do. You said your first phone, that star that fell, you said your first one was an LG Shine and it doubled as a mirror. It would be in my pocket and shock me. LG Shine, hold on, let's see what it looked like. I've never seen that phone. Let's see, LG Shine phone. Oh, that one. Okay, I remember this one. That was a beautiful one. I remember that one, but I didn't have that one. That's a nice one. Yep, they used to have, Nokia was it, man. Y'all remember the Nextel? The one that was like a walkie-talkie? Everybody thought that they were like, everybody thought they were the shit with that little phone, the little I remember that. At first, the BlackBerry was the only smartphone. It was. I remember. I still love that sound, like that little sound that BlackBerry makes. It was the first one. And then imagine it was kind of big. They still have BlackBerries, y'all. People still use BlackBerry, but it's more for business now. Yeah. Most Gen Z, 1999 to 2004. I know they got their first phone was between 6th to 8th grade. That's crazy. You see, 6th to 8th grade. Nope. I got mine. Yeah, you see? So it is, and imagine 1999 to 2004, 6th to 8th grade. I know 3rd graders who have phones now. I remember when I was in Korea, 3rd graders would have cell phones. 2nd graders. Imagine I got my first phone at 16. This is what I'm saying. So now we can't be surprised that there's a lot of parasocial relationships. And now the internet has gone amok because there are kids on the internet. Kids, y'all, children. So whenever people sound nonsensical, I always ask, how old are you? I know about how you talking. You gotta be a child. You must be a child. Must be. Because ain't no way you could be an adult talking like this. But then again, sadly, there are some adults who actually do talk like that. So it is the way of the world. 3rd grade, y'all. 3rd grade, 2nd grade, they have phones. No joke. Talking to their friends, parents, it's insane. But this is unfortunately the world that we're in. And a lot of people, but I would say the difference with Korea when I was teaching, when the kids had their phones, is that their parents did not play. They had them kids in school all day long. It was very excessive, to be quite honest with you. So they would finish school with, like, you know, regular elementary school. Then they would go to a Hagwon, which is a private academy, no phone. So as soon as you walk in, you got to put your phone in the basket. You are only able to use your phone during lunch breaks and like during like in between class breaks. They did not play. They made sure they had them babies' phones. And then you got your phone after school, and then they took it again until you get home, and then your parents take your phone. So at least they did that. But unfortunately, in our society, the parents just let the kids have the phone. You just have it. And then kids can outsmart their parents and bypass the parental advisory. They know how to do it. Parents are not checking. And this is the reason why we had that situation yesterday with that young girl that was with that David guy. This is why. I can understand middle school, but elementary school, yeah, elementary school students have phones, yo. If you're a teacher, you can confirm that they are on their phones. They are on their phones, y'all. They are. So yeah, let's what I will say is this. Like, I remember there was a school that banned phones. Hold on. So here, here. So even in my province, that's the first thing that comes up. All school districts in BC have new codes of conduct. New codes of conduct in place to restrict students' use of personal digital devices in the classroom. This includes tablets and cell phones. By removing the distractions from digital services, students can focus on their education. Yeah, this was just this year, y'all. Here. A for effort, first year of cell phone bans in Canadian schools gets mostly positive marks. Here. 12 years old, 12-year-old boy with his cell phone, y'all. This was in Spain, this picture. These are students, y'all, but this was at least high school, grade 11. I want to see the young kids. There are some kids in elementary school that have phones, y'all. They have cell phones. Elementary school. In my province, they banned the cell phones from the schools because it was just too much. You see, K through 12, not just high school, y'all. K through 12 cell phone ban. This was a research done in Toronto. K through 12, y'all. K through 12. And then this is why we have parasocial relationships. This is exactly why. So I'll touch up more on that next week. Let's get into today's topic now. I know I always have to do a little intro. Let's start. So continuing on with yesterday's topic, the Black maternal rate. We brought up a few topics that I think of our interest today, and we're gonna go through them. I remember yesterday's live stream. A lot of you brought up the Black maternal rate or Black maternal death rate in pregnancy or during pregnancy, right? We're gonna talk about that. Another thing we're gonna talk about is about finances just a little bit, access to healthcare, and also we're going to continue that part 2 of that video that we watched yesterday. So we got a lot to come. So let me play the first video because we weren't supposed to watch this one. Hold on a second, y'all. Let me make this a little bigger because I don't know where I'm at right now. Okay, here we go. Okay, we'll catch this after. So yesterday we talk about the Black maternal unaliving rate. And I'm going to show you guys a video. Hold on, not this one. Not this one yet. Not this one yet. There was one video in particular. Hold on, I got to find it. I thought I had it here. Here we go. All right, so we're going to watch this one. It's titled Black Maternal Mortality in the U.S. and its Slave Origin. So we can get a historical reason as to why this is happening today. And then from there, we're going to continue on. And we're going to connect the dots. All right, let's start it, y'all. Let's get to it.
For her partner, Bruce.
Hold on.
Now onto the...
Let me put the volume up a little bit.
Silent crisis in our nation's maternity wards. African-American mothers dying at a higher rate than any other racial or ethnic group from childbirth-related complications. Families affected by this tragedy share their stories on the day their lives changed forever. Janae Norman has this report.
What was supposed to be the start of a new life turned out to be the end of another. 26-year-old Amber Rose Isaac was preparing to give birth at the height of the coronavirus pandemic in New York City in April when everything changed for her partner Bruce.
And I just remember staring and, looking at her face and seeing how scared she was, panicking a bit. And so I'm telling her, yeah, we're going home. This is what we prepared for. This is what we were ready for. It's time. And she looked at me and said, yes, all three of us are going home. And that was the last time I seen Amber.
Amber posted on Twitter.
26 years old, y'all. Remember yesterday in that conversation, the men were like, oh, yeah, you got to have kids before you hit 30 because, if you're 30 years old, it's going to be worse. Yeah, your eggs are going to do this. Your eggs are going to do that. Nothing about this, y'all. Nothing about the health of the mother. Nothing about the financial situation that she's in, access to care, nothing about that. All they were talking about was having a baby sooner than later, only to fit the agenda that they want. It's a control mechanism. That's number one. Number two, they're not considering the fact that even if you are a young mother, complications can happen. Why? Because of the healthcare system that you're in. If you do not have access to equitable healthcare, and if you do not have access to healthcare that can help you survive or have basically give birth to a child where you have a higher chance of walking out of that room alive with your child, if you live in a country where your mortality rate is higher if you give birth, you need to think twice. Think twice. With every child that you have, your body reacts differently. We're going to get into that. It's not as easy as people are making it seem. Oh, just go have a baby. They're thinking about the best case scenario. But again, in our community, we never think of the worst case scenario. Very rarely. And this is something that we need to be serious about. 26 years old, beautiful young woman. There is no reason why she should not have walked out of that hospital. But yet here we are. And then she has a partner. He's not even her husband, y'all. I don't know. We're going to find out more. I don't want to say that. Is it really worth the risk?
Twitter about, quote, dealing with incompetent doctors.
There we go. She even wrote it herself. Can't wait to write a tell-all about my experience during my last two trimesters. So now I have to figure out, did she have the what type of system was she in? What type of care did she have? I know that she's in the US, so I understand that there's a financial component to it because you guys pay for that. So what could she afford? What was she doing? What was her background? What type of work did she do? What was her career, her economic situation, and as well as her partners? Were they together? Were they living together? What was the situation? We need to get into that. So let's see if they explain it to us.
She died 4 days later. Bruce says Amber tried advocating.
Hold on, let me go back a little bit.
All three of us are going home. And that was the last time I seen Amber.
Amber posted on Twitter about, quote, dealing with incompetent doctors. She died 4 days later. Bruce says Amber tried advocating for herself, but doctors just wouldn't listen.
But she voiced her concerns to her OB. She was letting her know, she's not feeling right. She's feeling a lot of discomfort. She's having shortness of breath. And her OB didn't really understand. She was like, oh, well, there are other women who are working while they're pregnant.
Her OB, red flag. Her OB, it's not that she didn't understand. She didn't care. That's the one. And number two, unfortunately, she is a young black woman. She's young. They're not going to listen to you. I'm not saying not all the time, but chances are they are going to look at you like, oh, yeah, listen to what she said. Other women can work. Oh yeah, you don't have to worry about that. You're not the only one. Suck it up. You guys are genetically better than us. Ain't that what they tell us? You're stronger. You can take it. Don't worry about that. Meanwhile, she knew something was wrong, y'all. But again, like I'm going to assume that she didn't have the resources to advocate for herself and to get the proper advocacy. This is a big problem, and it's happening more than you think, especially during that time. This was during COVID, y'all. Worst time. The worst timing ever to be pregnant, to be quite honest with you. The system was overloaded at that time, but there's still no excuse to dismiss people. But a lot of doctors will dismiss you, especially if you look like this. Just letting you know. It's a problem.
So that right there just told me she didn't really care about Amber.
In a statement, the hospital spokesperson saying 94% of our deliveries are minority mothers, and Montefiore's maternal mortality rate of 0.01% is lower than both New York City and national averages, adding any maternal death is a tragedy. Amber's story is not uncommon. July 2nd, 26-year-old Sha'Asia Washington died during an emergency C-section.
How old was she, y'all? Let's go back. We're going to go back again.
Amber's story is not uncommon.
She said it's not uncommon. Young women, y'all, young and old. Everybody. So don't let people try to manipulate you into having a child. You have to be prepared for any type of situation to happen. It's not going to be a walk in the park. Yes, for some it is. Some people, they can give birth very easily. My mother, she said, with every child except for my youngest brother, he was her most complicated childbirth. But she said with the rest of us, I popped you guys out in 20 minutes. It was fine. That was her experience. But then there's people like my aunt who had to wait days to give birth. Every woman is going to have a different experience. So that's why it's better to be prepared, y'all, for best and worst case scenario. It's very sad because sis got a C-section. And then 26 as well. Very young.
July 2nd, 26-year-old Sha'Asia Washington died during an emergency C-section. And July 27th, Yolanda Kadima, a doula and mom of 7, died giving birth to twins, also during an emergency C-section. Experts like Professor Deirdre Cooper Owens, who's written about how race and gender impacted American gynecology, say the struggles these women face throughout their pregnancies and childbirth all come down to racism.
You see that class and status tend to matter. The higher up you go, right, the kind of better protected you are.
There you have it. Class and status matters. It always mattered. But unfortunately, in our community, they act like it doesn't. Oh, you don't need to be educated. You don't need to have this. You don't need to have that. And then look at this. Sis is telling us right now, it has always historically mattered. Always. It will always matter. As long as we live in this system, it will always matter. Do not let people try to tell you that it doesn't. It does. It may not matter to them, but to society, it does.
In childbirth.
And you live in that society, just letting you guys know that. Yeah, I know you guys are smart, but I'm just saying, for those who do not agree.
All come down to racism.
You see that class and status tend to matter. The higher up you go, right, the kind of better protected you are. Mm-hmm. That doesn't exist for Black women because we're all experiencing racism in the same way. So when I walk into the office, nobody knows if I'm married or have a PhD or what my income is. The assumption is I might be lying. Maybe I'm promiscuous. Maybe I don't eat well. I should still be given fair treatment and equitable treatment by my doctor.
My first pregnancy, my birthing experience was pretty traumatic.
And then he actually punctured my spinal cord. I was temporarily paralyzed.
We were so excited about bringing Jason to this world, and then the last 2 or 3 days of his birthing process was too tragic.
I was bullied and I was abused emotionally and and physically in the sense that consent was not asked for as often as it should have been.
It took me a while to find a provider that I trusted and that respected me.
We lost him due to what is known as HELP syndrome. We found out later on that his death could have been prevented, as well as the traumatic birthing experience that she experienced.
So many Black families with similar stories, and these experiences add to a mistrust between the Black community and the medical community, a relationship with a long, dark history dating back centuries.
Enslaved Black women were experimented on, particularly during the 19th century, so a little bit in the 18th century, but largely in the 19th century as obstetrics and gynecology.
Correct. That's the reason why they were able to advance so quickly with the pap smear, all the tools that we use in modern day healthcare, gynecology. It was because of Black bodies. And they're still doing it today. But I won't get into it too much. That's a topic for another place. Y'all already know. Check out the Discord. Well, I haven't started talking about it. I mean, we do have conversations. But if we were to have this conversation in the future, it would most definitely have to be on the Discord. Because there's a lot more to it, too. Black bodies are profitable, y'all. Dead Black bodies are very profitable in this system. I'm talking about global.
Became more formal and accepted branches of medicine. Marion Sims, known as the father of American gynecology, pioneers the surgery to correct this obstetrical fistula condition. People didn't know that he experimented on enslaved women. They didn't know that 2.5 years into his experimental trial, when his white medical assistants quit, he trained these enslaved women to serve as nurses. They were still his patients. They were still his slaves that he either owned or leased. And they still served as surgical assistants. So that part of the story was left out.
The success of James Marion Sims earned him the nickname of the father of modern gynecology. But his legacy is marred by the fact he earned it on the backs of Black slaves through non-consensual human experimentation without anesthesia. Now, doctors like Jennifer Lincoln, also an OBGYN, are fighting against present-day health disparities.
To this day, Black people are less likely to get the same treatment in terms of pain medication. They're more likely to wait longer in the emergency room. They're less likely to be taken seriously. It's a holdover from the days of slavery. And in my field, this plays a huge role in the Black maternal and morbidity crisis. The call to action. Doctors, nurses, anybody in the medical field, check your implicit bias.
Staggering statistics show...
And another reason I want to bring something up too. We don't have enough healthcare professionals that look like us or who look like us. That's another problem. So when they're telling you, oh, that degree is just a piece of paper, these are the implications of that. Right here. In real time. You have more doctors who do not look like you than who do. And I'm not saying having a doctor look like you is going to suddenly make it better, but I'm just saying that the odds are going to be better. As much, like, the more people we have that look like us in those spaces is going to be better for us because we can have an understanding. Just like, for example, like I told you guys, I work for the government. So anytime there's a legislation or law or something that passes within my branch, I can look at it from a lens of, okay, the disparity. I'm going to be an advocate and be like, hey, this is going to impact this community more. Why? Because I have that knowledge, that background experience that they may not have. They're not going to see it that way. And people have to understand that they will not see it that way. They were not raised to see it that way. So it's going to be harder for them to realize biases because that's all they know. Hello. That's what they know. That's how they're raised. So for them, this is normal. Normal. There's no question. I'm not saying all. Of course, we have this young doctor right there. The woman that just came. She's like, yeah, I understand. There's definitely a disparity. This is why every time I see a Black nurse, I'm so happy when I see them all on TikTok. I love it. I love it for us. the more of us that there are out there, the better it's going to be, in my opinion. It's my opinion. Especially when it comes to doctors, nurses, people in the medical field, in STEM, AI, coding, everything. Collectively, it will benefit us. It will. But the problem is that, again, it's not, I don't know how valued it is. And that's the problem. We haven't gotten to that place yet where people are ready to have this conversation. Women are dying, guys. And it's not just black women, but I'm focusing specifically on black women because as with everything, we always get it the worst. Always. If there's anything impacting other communities, just best believe it's going to hit us way worse. So now women are going to have this type of situation, especially the way that the administrations are going in the U.S., at least the administration in the U.S. In other countries, there are other things happening, weakening healthcare systems. This is a reality. This is the reality we live in.
Black women in America die during childbirth nearly 3 times more than white women.
This was 5 years ago.
Making the United States one of the most dangerous developed countries in the world for black women to give birth. And doctors say the issue for mothers extend through pregnancy and postpartum and also impact black babies who are more than twice as likely to die than white babies.
We all know the reason, y'all. I'm not even going to say it. Censorship. I can't say what I really want to say. But let's go through it. I want to look at maternal deaths worldwide. Maternal mortality. This was published April 7th by the World Health Organization. All right. Every day in 2023, so I guess this is past research, over 700 women died from preventable causes. Preventable, y'all. Preventable. Related to pregnancy and childbirth. Okay, I want to check the global one. Here, maternal mortality is unacceptably high. About 260,000 women died during and following pregnancy and childbirth in 2023. That was 2 years ago, y'all. I don't even want to know what the research is going to look like now, especially with everything going on. Approximately 92% of all maternal deaths occurred in low and lower middle income countries in 2023, and most could have been prevented. Okay, so here we go. Mostly in sub-Saharan Africa and Southern Asia. And then the second part here. Eastern Europe and Southern Asia achieved greatest overall reduction in maternal mortality ratio. All right. The greatest reductions happened in sub-Saharan Africa, Northern Africa, and Western Asia, Australia, and New Zealand. Let's check here. The high number of maternal deaths in some areas of the world reflects inequalities in access to quality health services and highlights the gap between rich and poor. The MMR in low-income countries in 2023 was 346 per 100,000 live births versus 10 per 100,000 live births in high-income countries. All right. And then here are the reasons they said. 75% of all maternal deaths are due to severe bleeding, mostly bleeding after childbirth, infections, usually after childbirth. So it's not just while you give birth, it's also the postpartum care. High blood pressure. This is a big one in our community. During pregnancy, preeclampsia and eclampsia. Complications from delivery, unsafe deletion. Y'all already know what that is. All right. Now, this is all over the world. I want to check, because it said the United States is the highest among the high-income countries. So let's check that. A developed country. Let's put. I don't really like that term, to be honest with you, but it is what it is. Okay, let's see if we could get a reputable one. Or CIA, imagine. All right, let's check if they have good data. When was this written? I want to check when this was published. When was this published? This is the CIA government. Okay, it looks pretty recent. Okay, we're going to check this one. I'll trust this one. Okay, so these are all the countries, y'all. Let's go. Continuing. It gets lower and lower. They're naming all the other countries. Nah, we need to see yours. Let me see if I can find it. Here. All right, Fortune magazine published it. Ooh, finally somebody. America has the highest maternal mortality rate among developed nations, and it's on the rise. It's not declining. Here's why we are facing a pregnancy health crisis. And by no means am I telling you guys not to have a baby. I'm just saying be wise about it. Choose your partner wisely. Make sure you have the funds. And even then, and be in good health actually, but even then, there's still a risk, y'all. There's always a risk with everything. Think about it deeply. Don't just do it just to do it is my point. Everything has a risk, obviously. But think about it long and hard. Do family planning. Don't just have a baby all willy-nilly and not be prepared about what might happen, right? Here, over the past decade, the U.S. birth rate declined by roughly 20%. Maternal mortality rates, however, are rising at an alarmingly high rate, which means the number of babies being born is decreasing, while the number of women passing away is increasing. Red flag. How is that possible in one of the most developed countries in the world? You would rather spend money on military than on this healthcare. What's really needed? Most of your GDP goes to the military. Just an FYI, if you live in the United States of America. Despite having one of the most advanced healthcare systems or health systems in the world, the U.S. currently has the highest pregnancy-related death rate among developed nations. This is embarrassing. Maternal deaths rose a staggering 40% in 2021 from just a year prior. While some of this is attributable to COVID, which is what we were watching, pre-pandemic maternal mortality levels were already steadily increasing. Now we're post-COVID, is still going up. It hasn't gone down, y'all. So here, even in the 1930s, they said that the U.S.'s maternity or maternal death rate was always high compared to other countries. We already know that. It's already, you got to think about it. Racism, classism, access to care is all connected. Inequality. With better maternity care, living conditions, and antibiotics, maternal mortality rates improved globally. While rates also began improving in the U.S., they began to rise again in the late 1990s, in part due to the inadequacies of the public healthcare system. Y'all want to know who was president around that time? So if we're going to go to the 90s, the 80s, Reagan, it was all Reagan. 90s, Clinton, Bush, Obama, Trump, Biden, Trump. Here we go. Continuing. As a result, the U.S. Department of Health and Human Services has deemed it a public health crisis. And the current administration has announced a call to action to improve parental and infant health outcomes. So during this article, when this article was written, oh my gosh, 2023, Biden was in office, I believe. Of course, they gave me the paywall, but y'all get the point. Of course, they hit me with the paywall. This is expected, y'all. So yeah, this is a big problem, guys. And it's not just in the U.S. because we're going to go to other countries soon. I'm just starting off with the U.S.
So higher rates of complications related to childbirth and pregnancy as well. It's huge. And it's something that in a population, childbearing women in general are young, healthy women. And then these are not women who should be suffering these extreme complications or be dying, especially in a developed country.
So what do you think can be done for medical professionals already out there to address this?
I think that in reading and listening and understanding why there is fear and distrust of the medical system for certain racial groups, and it's not a personal thing, but it's a whole generational and societal thing, I still have to stop myself every time I'm caring for somebody who looks different than me, and I always check. And I say, am I delivering the same level of care here?
She even has to do that, y'all. And I'm happy she does that. She even has to do that. That's what I said, it's ingrained. It's ingrained, y'all. This is why representation matters. Education matters. This is why. Even her, she's probably the most friendliest, best doctor. The fact that she's even on this panel or in this interview lets me know that she cares, but even she has biases. Red flag. This is why. Doesn't matter how much of an ally someone is. They were programmed a certain way. They have to rewire their brains. And sometimes the biases will pop up. They got to rewire again. It's a work in progress. You're always going to be a work in progress, especially when you were programmed a certain way. Sis even had to say that. Look, even me, I have to check myself and say, am I offering the best quality of care because this person looks different from me? Do I have internal biases that are maybe hindering the process? And do I need to check myself? I have to internally do that. A lot of people do not do that. So I commend her for realizing that. I really am glad that she realizes that. But many people don't. Including the doctors that you see on the daily basis. And then they're telling you to just have kids. Oh yeah, just pop them out. It's okay. You're going to be able to raise them. You'll be fine. And then look at that. Systemic.
These important self-assessments could literally mean the difference between life and death for patients like Charles Johnson's wife, Kierra. She died unexpectedly after the birth of their second son in 2016, and Charles says her death was 100% preventable.
For what was supposed to be a routine scheduled C-section at our doctor's recommendation, and on what we expected to be the happiest day of our lives, and really walked into an absolute nightmare. The thing that's so clear to me is that Kierra just wasn't seen and valued as human. She wasn't seen in the same way, with the same compassion and the same empathy that the people that were responsible for her life would have seen their own daughters.
And he's the one I showed y'all yesterday. This is Judge Lynn Hatchett, I think. Or yeah, it's Hatchett. Judge Hatchett's son. So he has money, y'all. They were at Los Angeles, Cedars-Sinai Hospital. One of the most wealthiest hospitals in the United States. California, one of the most progressive states in the United States. And yet here we are.
Their own wives or their own sisters. There's no reason that Kierra should not be here today.
Charles says for him and his two sons, the void left by Kierra's death can never be filled.
And we talk about mommy all the time. And so I made the decision very early on that I never wanted the topic of Kierra to ever be taboo or to be off limits. We do our best to remain positive and to celebrate her, but my brother says it best, it's like there will always be an empty seat at the table.
But he's using tragedy as fuel to effect change, starting 4 Moms for Kierra, an advocacy group aiming to change laws and prevent negligence from ripping apart any more families. As for Bruce, he's grappling with the reality of what should have been the start of his family ending tragically, and the beginning of his son living a life without his mother.
Now, all I can think about is, Elias growing up without his mother and how he's going to feel when, he's in school and they're doing Mother's Day activities and, making Mother's Day cards. And Elias is not going to have that luxury. And it kills me. It kills me that Whenever we go out to parks, we're going to see full family playing together, and we're not going to have that.
Janae Norman, ABC News, New York.
Our hearts go out to those dead. Such a heartbreaking report. Our thanks to Janae.
All right, y'all. So y'all saw that. Let me read a few comments. Let me put this down. Okay, here we go. All right, I'm gonna read a few comments and then we'll move on to the next one. Who are these people? Block. I don't know where they coming from. Twitch here. All right. So I grow hollyhocks on any blocks. Even with economic resources, Serena and Beyonce had birthing complications. Exactly. Yes. Exactly. So it doesn't really matter. But what I will say, though, is that at least you have a better chance of getting help if you have economic resources, because Serena and Beyonce use their privilege and power in order to be able to advocate for themselves. But imagine somebody who didn't have it or who doesn't have it. That's the problem. Hey, at the Dub Studio. Hey, sis. Exactly. All I'm gonna say is organs. Girl, we gonna talk about that in the Discord. Dang, I didn't know I had that much lint on my sweater. My bad, y'all. I should have used my lint brush. But yeah, we gonna talk about that in the Discord in a future conversation. Oh, it's coming soon. It's coming soon. It is. That's why I don't want to do the ancestry DNA test, because I know my blood type is very rare. I'm not trying to have somebody come and take me up out of here. I'm good. Melody Smith said, I was very blessed to have an OBGYN who was a former Air Force captain, and he made everyone take great care of me. I'm so happy for you, sis. I'm happy about that. And some people have some very positive experiences, but like I said, there's always a risk, right? I don't know about that. Remember, Dr. Jackie, how doctors are educated is inherently biased. Yeah, that's what I'm saying. Like, it's tricky. Because I've met some really great doctors who... I had a black doctor when I was in Toronto. She was amazing. I had an Asian doctor. I've had doctors of different races, and they were all female. And I've been lucky. I have not experienced that type of bias. I haven't, personally speaking, but I know others who have. So it's very tricky. Yeah, it could just be the medical system too. Maybe it needs to be, we need to rehaul it. Everything needs to be innovated. Everything, including our medical system, because they're probably using practices from like 1980s, 1970s. We are in 2025. Our medical system has not advanced. It has advanced as far as the medication and it's advanced as far as the science goes, but not as far as society goes and culturally. And this makes sense because if our country's not advancing culturally, we're regressing, education's not increasing, is decreasing, then you're going to have these disparities. People are only worried about science. Oh yeah, medical advances here, but not about the humans behind the science. That's why I said yesterday, sociology, humanities, all of those, please get those degrees, get them. We need them. We need them. This is how you attach human stories. So yes, I do agree with you, sis. It's true. Even if we have doctors of color, they sometimes don't care either. A black PCP I had acted really weird. Personally, I've had more luck with white female doctors. Yeah, everyone's experience is going to be different, and also the country too. I hate to say it to y'all. The country as well. Yeah, country as well. So I can't even deny that. It's true. You're right. And especially if you grew up, like, that's what I'm saying. Like, if your medical system is already racially biased and you are training to be in that medical system and you already have those white supremacy mindset, it is quite possible that even if you're a person of color, you will not treat your patients well. That is exactly what happened with last week. The woman that was on the panel who was spewing her Republican MAGA rhetoric. She was one of those. But the good news is that the other people on the panel, they understood. So that's what I'm saying. Like, it's going to be hit and miss, but at least collectively, if we have people that actually care, then it will benefit society and our community. to be quite honest with you. Because I know, like I said, like I'm pretty sure there are people who I don't know specifically, but there are people in government who don't give a crap about the constituents, who don't care. But then you have people like me who do. So then that's what I'm saying. Like it's always going to be a mixed bag. But I would say overall, generally speaking, it is still good for us to have representation. Unfortunately, it might come with a little few bad apples. That's the problem. Yeah. Yes, these are important conversations, Romy, that need to be ongoing. Yeah, we're going to keep talking about it. Don't worry. We'll keep talking about these. I'm a gardener, and this conversation you're having regarding this topic is part of my research. It is? Okay. Yeah, let me know. Please put information in there. Let me know. Yeah. I would love to keep talking about topics like this because it's so important, y'all. It's very important. And each one teach one. The more that we learn about these things, the better it's going to be. We'll have better outcomes. The doctor was Nigerian American. Yeah. Oh, you see? That's another thing too. Culture plays a big part. So there you go. So you just said your doctor, you had a bad experience with the Nigerian American doctor. They come from another country. And also, even if they're American, I'm assuming their parents are from Nigeria, so they grew up with that kind of mindset. You have to deconstruct so much growing up in an immigrant household. Deconstruct. I had to deconstruct so many things and biases that I had about people, even people who look like me, y'all. Oh, these people are bad. These people are good. Mind you, we all look the same, y'all. But again, it's that mindset. And if you grew up in a culture where you see certain people as inferior, and then you are now a doctor and you're taking care of those inferior people, then this is going to be a problem too. So yeah, it's such a nuanced conversation. It's hard. And I feel like that's where culture and empathy comes in. And this is why I love having these conversations, to hear different points of views, different opinions. Because just because I had a positive experience doesn't mean that other people did. And I love these kind of conversations because I want us to be able to have different types of opinions. Yep. And Namaya said, in the U.S., the best doctors we had so far are all immigrants trained in their original countries. All trained U.S. doctors are somewhat biased, even ones of the same ethnic group. Yeah, that's a problem. And you know what it is? Before I move on to the next video, let's talk about this. We're going to sit on this for just a little bit. I believe, this is my opinion, I believe the reason that is because we come from a more, remember the history of slavery, like Sis said in the report. We're still using that system till today. It hasn't changed. So that system has just changed in the sense of like, yeah, we no longer have enslaved people. But they're experimenting, y'all. You just don't know who they're experimenting on. They're still doing a lot of that stuff. It has not changed, y'all. It's just new faces, different ways. It's a different way of doing the same thing. And also another thing about Western medicine. So this is where we're going to get into Western and holistic medicine. That's a whole nother topic we could have another day. I might have to spread this out next week too, along with the parasocial relationships. We might have to do a breakup here. But traditional Western medicine is not preventative. It's all about you going to the doctors for acute care. So it's like if you have a flare-up, you have something wrong with your body, then you're going to go see a doctor. Holistic medicine is different. In other parts of the world, they have learned a more holistic way of looking at things. A lot of countries, they don't have their babies laying down. You know, you lay down and you open your legs to deliver your baby. In other countries, some countries, they stand up and they have their babies come out naturally. It's different. Also, we no longer have, I remember when I was younger, my mom had to stay in the hospital. I think it was mandatory that after you gave birth, you had to stay in the hospital for like 3-4 days so they can monitor you. We no longer have that. Now people are giving birth, getting stitched up. You go home the same day. Red flag. How is that possible? How is that possible? Notice, majority of those women, a lot of them, it was postpartum complications. Pre and post. In Korea, I have to bring that up because that's where I lived for a lot of years. You cannot leave. They have childbirth centers. You're not just going to give birth and leave. They're going to monitor you to a T. Make sure everything is right before you even exit that hospital. We don't have that system here. That's a problem. And then the way we give care, that's another problem. Dismissive. A lot of doctors are very dismissive. Oh, you're too young. Even the screenings. Colon cancer. Let's talk about it. There's been a rise in colon cancer. Now young people are getting colon cancer. Just the other day, there was a streamer, very beautiful young girl, 21 years old, passed away, 21 or 22, passed away from colon cancer. This is happening at an alarming rate. But guess what? The screening age is 40. Red flag. Why haven't they changed that? You got to ask yourself those questions too. We have the resources. We have the money. Best believe there's money there. But why isn't there an urgent plea or push for this type of help, for resources? Why aren't they urgent? Oops, sorry. Why aren't, my bad, y'all. I was just checking to make sure my mic is on because I didn't charge it properly last night. Yeah, why aren't they treating this as an urgency? There's a reason. There's a big reason. It's because you're more profitable when you... We're not going to get into that right now, though. That's another topic for another day. But right now, my point is that, yeah, like, everyone's going to have different experiences. And unfortunately, if you're living in this system, then we have to really think about that. And we have to start thinking long term about these type of situations. Yep. My wonderful doctor was Puerto Rican. Shout out to your doctor. That's what I'm saying. It's like, it's so crazy. Other countries have way more advanced medical care than even the country I'm in. That's a problem. That's a big problem. That's a huge problem. I'll read one more comment and then let's move on to the next video. Most immigrant doctors have to get certified in the U.S. Their degree from outside aren't respected here. Yeah, they're not. And now they're making pathways. But again, that's another barrier. That's another barrier. And it's by design. Your medicine is not better than ours. Your schooling is worse than ours. And that could be furthest from the truth. I've met people from other countries. They have learned things more, like, at a faster pace than we have. I wish Dom was here. I wish he could tell us. He was learning calculus in, like, middle school or something. They're learning math. And I remember, you know what's so funny? I'm going to give y'all a story here. A quick story. Not too long, because we got to get to the next video. I remember we were doing an equation. You know how sometimes on social media they have these little equations and then you have to guess it, right? And then Dom came to me. He's like, honey, can you guess this? And I was like, oh, yeah, I'm going to guess it. Da, da, da. I whipped out my calculator. He looked at me like I had 3 heads. He's like, why do you need your calculator for this? This man was like, he didn't even use pen and paper. He's like, done, answered. And then here I am on my calculator. Here we go up, Padmas, parentheses. Remember, please excuse my dear Aunt Sally. I was like, oh, on the paper. Da, 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 da. This man figured it out quickly. Mental math. We're behind, y'all. We're behind. The way we teach, even the way we teach and educate, it's all based off of the Socratic method. And it has Greek origins. A lot of things that we do, they have been passed down. And they're from Europe, guys. That's where it comes from. So that's what I'm saying. Like, there's this whole thing where it's like, even now when we talk about naturopathic doctors or naturopaths, people look down on them and think, oh, they're not real doctors. And to be honest with you, they will be able to help you get a lot of the care. But you need to have access to them. In Canada, you need to have money to have access to them or really good benefits. I remember I went to a naturopathic doctor. She was like, hey, I could get your hormone tested. You just got to pay for this test, $500. My insurance thankfully covered some of it. But again, if you don't have that money, it's going to be hard for you to get preventative care. That's the issue, is we need to overhaul. Our whole system needs an overhaul. That's North America, period. Europe, add Europe in there. We need to have a conversation about diversifying different medical practices. And I think the problem also is that you think you can solve everything with drugs. That's another issue. Again, we could talk about this forever and ever and ever. But it all leads back to the same source. And I'm not going to go too deeply into it. I won't go too deeply into it, but it goes back to the same source. I'll just say that. I'm not sure if it's true, but I've heard that even nurses sometimes have to obtain a new license if they move to a different state unless they are certified in New York or California. Mocha Island, you are correct. That is true. It's just like law. In law, you have to, every time you go to a new or practice in a new state, you have to get licensed in that state. Yeah, they make it very hard. And that's the thing. Another thing we have to consider. I'm glad we're having this conversation. This is another element that's on top of it. Every state, because we live in a confederacy. That's North America. Canada, excluding Mexico. So Canada and the United States. We live in a confederacy. So basically, every state literally acts like its own little country. Do you know how hard that is? This is why the pew pew laws are stagnant. The federal government can only do so much. Let's go into this. We're gonna take a course right now, y'all. Confederacy. Oh, how do I spell it? Confederacy. I believe that's how you spell it. Okay, so Confederate States of America. Canada is also Confederate. So what Canadian government? We're going to start with Canada first. Duties. Well, here. Okay. How government works. All right. So in Canada, here we go. Government roles and responsibilities. Here we go. Distribution of legislative powers. There we go. So now, the powers of Parliament, or the Parliament of Canada. Here, this is what they can do. All right? These are their responsibilities. Exclusive powers here. All right? And then shared powers. That's with the province. Pension, immigration, agriculture. I don't want this one, though. I want a better breakdown. Roles and responsibilities. Hold on, not the branches of government. I wanna have the executive and then the. Hold on, let me see. Maybe this one will have it. Here we go. Okay, this is better. All right, federal government responsibilities. Thank you. This is what I was looking for. Something less condensed. Citizenship and passports, criminal law, currency, federal taxes, fisheries, foreign affairs, and international trade. Indigenous lands and rights, national defense, official languages, Parks Canada, Postal Service, telecommunications policy, veterans affairs. Okay, now let's get to provincial. So every province has its own responsibility, right? Colleges and universities, education, hospitals, and healthcare. So those of you who think that the federal government has a say in how the healthcare goes, you are sorely mistaken. It's provincial. And you live in a province that has a different healthcare system than another province. So BC's healthcare is going to be different from Ontario's healthcare. Quebec's healthcare is damn sure going to be different from Alberta's healthcare. Manitoba's healthcare is going to be different from Saskatchewan's healthcare, so on and so forth. Natural resources, property and civil rights, provincial and territorial law and courts, provincial territorial parks, provincial territorial road maintenance, provincial and territorial taxes, social services. And then these are the municipal government's responsibility. So public transit, municipal. You have a complaint about it, you better go to your local government, your city government. Now let's get to America. Here we go. Branches of government. Here we go. Not the branches. The levels. The levels. The levels. That's not what I'm looking for. Okay, here. This might help us. State government. Okay. Wait, why did it go there? All right. Here. What is... Hold on. Here we go. Okay, this is best. Thank you. How is the U.S. federal government structured? This is what we learned in elementary school, but I understand that sometimes we need a refresher because we learn these things, but we need a refresher. A lot of us do, right? So this is not just to be like, oh, I know what. No, it's more of like, let's remember this. Remember, and for those who don't know, this is it. In the United States, you have the executive, legislative, and the judicial branch. These are the top three. Okay, led by the president. All right. Head of the U.S. federal government recommends laws to Congress. All right, that's the breakdown. Then you have legislative, led by U.S. Congress, U.S. Senate, U.S. House of Representatives. They pass laws. Here we go at the top. Approve budgets, and then they declare war. All right. Judicial, led by the U.S. Supreme Court. Remember when I showed you guys the court justices? That's why it's important. These are the people that are responsible to pass the laws. They vote amongst each other. And if a majority of them are men and they're working with the administration that is not serving you or your people, I'll be honest, neither administration has. Just keeping it real. This is, but there's always the lesser of two evils. Let's just put it that way. Declare governmental actions unconstitutional. Okay, I want to get to state government though. That's what's more important to me. We have the separation of powers. Let's get to state government. Okay, here we go. Federal government, the military, federal taxes, printing money, regulations on trade between states. State governments have their own laws on many areas. Crime and punishment, pew control, ages for marriage, driving, and education. Remember, the top government cannot. It's not they cannot. They have the separation of powers. So if you are upset about pew laws, you need to go to your local, your state government. That's where you have to go. Now, let me check healthcare, because I don't know why they didn't include healthcare in this one. Here. Responsibility of states, USA. Okay, let's try to find it. Why is it so hard to find it? All right, here, federalism. That's what it's called in the U.S. For us, it's confederacy. Okay, states may be able to do more and do more quickly than the federal government. All right, yes. How and when federalism is good for public health? In the U.S., responsibility for public health is lodged primarily at the state or local level, just like Canada. Provincial level. That's because the U.S. has a federal system, meaning authority is constitutionally shared by the national and state government, same as Canada. It's just called a different name, and I'm sure the UK is the same as well. The disadvantages of this arrangement were all too apparent during the height of the COVID-19 pandemic. States gave different messages about the severity of the crisis and the need for vaccination, mask wearing, and reopening businesses and school. This is why we have a problem, y'all. This is exactly why you have a problem if you live in Canada or the United States. It's because every single province is different. Every single province has their own rules, regulations. It's not all by the same. It's not run by the same source. So, for example, let's tie it back to Korea again. One country, one government. Everything comes from the top. They don't have a split about that. Everything is the same. That's why I had to explain this to Dom so many times because he couldn't get it. He didn't get it. He's like, why? Why can't this person do it? Why can't Trudeau do this? And I said, well, Trudeau cannot do that. It is not Trudeau's responsibility. It is this person's responsibility. It is our provincial government. I had to go through all the levels with him. Because in Korea, all the levels of government have to answer to the federal. For us, no. Only certain. Everything is split. Distributed differently. So that's why when you come from a country and your government has the power to do everything, you cannot come to North America and think that it's going to be the same way. No. Because how things operate in Tennessee will be different from Florida. Will be different from California. Will be different from Texas. Will be different from Louisiana, New York. Different outcomes. Yes. So public health, state responsibility. I have to make that very clear. Here we go. The differences played out in death rates, which varied almost fourfold among states. Higher death rates were primarily associated with higher poverty rates, larger percentages of Black or Hispanic residents, availability of quality health care, and the proportion of a state's voters who chose the Republican presidential candidate in 2020. Okay, that's what they get into. States that took public health measures such as mask mandates, okay, this was during COVID, had lower infection rates, and states with higher vaccination rates had lower death rates. So it may seem that federalism was a clear disadvantage for the people of states that fared more poorly during the pandemic, but the authority federalism allocates to the states over public health can also have advantages. That is true, depending on which state you're in. During the pandemic, it provided a second line of defense. States could pursue policies that resulted in rates of infection or death that were far better than the national average. In fact, a number of them did. Federalism lets states stay close to the people they serve. Okay, so then they get more into that. And how states are closer to the people they serve. That is true, because at a federal level, I think, okay, this is what I learned actually in political theory, okay? So this is what I learned. The reason why they set it up this way is because, remember, it all started from Europe. The source goes back to Europe, y'all. During the times of the king, they were upset because the king would make laws for the elite, and all the lower class people had to follow those laws, even though those laws did not benefit them, and they couldn't understand the lower class's plight, basically. So what ended up happening was the law of the land did not benefit the lower working class. That's what it was. So when they came and stole the land from the indigenous folks, came all the way here and then started breaking bread and then decimated them, we all know the history. They decided to create a new system. And then some people didn't like it because they're like, hey, we still have allegiance to the queen and the king, and we don't like what y'all doing in the U.S. Y'all a little too crazy for us, so we gonna go to Canada and start our own faction. Okay, boom, bow. Canada was there, or not Canada. It wasn't Canada at that time, but we're just gonna call it Canada, okay? So then they went rogue and they went up north, did the same thing. All right. So now, when they created these states, they decided, okay, in order for us to be England, we have to be united. But hey, I don't like how your province or your state is doing things. I don't like how your state is doing things. Let's be united, a united confederacy or united confederacy. And then that way we can each have our own states, our own laws. You're only responsible for this. Everything else we got to take care of in our own states. Deal, done. Boom, boom, pow, here we are. It's going to be different. Every single state. And yes, they're right. It does connect you closer to the constituents because you understand the state. You grew up there. You understand, that maybe the culture is different. In California, we're more laid back, peace and love, than Texas, rah, rah, reptar, guns blazing, pew, pew blazing, boo, 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 boo. But guess what? Now it's an issue. Because who's representing you? That's what you need to figure out. These are the people who are going to pass laws about what your healthcare needs, the healthcare needs, and the research and everything that goes into the mortality rates. And if they do not look like you and they don't care about you, then guess what? You're going to have a harder time in this system. We are included. I'm included in that too, by the way, guys. This is the sad part about it, because they don't look like us. They never have. And we don't have enough representation, like I said. And if we do, then you have people who are not kinfolk. We got to think about that. And it's because a lot of us do not have the economic power and the ability. That's another issue too. All right. So, yes, it says it gives more flexibility. All this stuff. I'm not going to read too much of it, but you guys get the gist of it. So whatever's going on with the mortality rate is all state government, provincial government. This is what's happening, y'all. This is it. This is part of the problem too. There are a lot of problems, but I'm bringing up different types of links. We can link it to so many things. This, again, how our countries are structured, how our states are structured, how the government's structured, and funding too. Who's funding these hospitals? If the U.S. government or the top government, same thing with Canadian government, they're funding it, but not as much. So remember, y'all saw provincial governments. They're supposed to be responsible for education and healthcare. But what if we don't have enough funding? What if not enough resources are being allocated towards the federal government? And then you have employees like me. What if we are not represented in high numbers? It's not going to help with the policies. It all starts with the legislations and policies. And then it goes, I could have a whole breakdown about this stuff, y'all. A whole breakdown. Not for today's topic, though, because we kind of went out. Y'all know, this is an ADHD live stream, okay? It goes different ways, but I'm just letting you guys know that, like, as somebody who works in the policy realm, that's where it starts. I'll just say that. And if people who do not look like you are behind the pen and paper and getting this done, and they don't have the same mindset that you do, or they do not see you as like equitable to them, then those laws that are passed and the way that things are funded is going to be different for you. It will always be different. Let's continue. Oh, CC Esther, I'm from Chicago, and the state of Illinois has some of the toughest pew-pew laws, but the states surrounding us don't, so people can easily acquire pew-pews and bring them here. Yup. Absolutely. Absolutely. And this is another problem, too. That's what I'm saying. It's just, there's levels to this. So that's why when people, and the reason why I had to go through this whole, like, breakdown is because some people don't understand that. And then they think like it can easily be fixed. Oh, this person can fix this person. No, they can't. That's not how the country is structured. It's not. You have to go by how it's structured. So if you want any changes to happen, like I said yesterday, it has to happen at the smaller scale. State level. This is where you need to start targeting healthcare. National level, it's not there. All right, let's watch this, because now we're going to get into insurance. We're still in America. We're going to move on to the UK and Canada soon. Don't worry, y'all. Let's get to why the U.S. has a healthcare claim denial problem. And this was published 6 months ago, y'all. Not too long ago. 6 months ago. 6 months ago. When was 6 months ago? Hold on. Let me check the date. February 22nd. Right after Agent Orange took over the White House. Let's continue. Let's watch this, y'all.
My name is Shelby Kingsey, and I'm an ALS patient who has had to fight for my right to receive a life-preserving drug, and I'm not the only one. When we were first denied, we were told it was due to Blue Cross Blue Shield of Texas deeming Qalsody medically unnecessary. We ended up appealing the decision 3 times. By the last denial, we had caught the attention of the senior...
Medically unnecessary. Red flag. Look at this woman. She is on a ventilator, y'all. Oh, trigger warning, by the way. I don't know if this is sensitive for some of you guys. She's on a ventilator, y'all. And they're saying it's not medically necessary.
Vice President of Policy and Advocacy with the ALS Association, who started to reach out to senators and other legislative bodies. Thankfully, the next decision we received was an approval, and I was able to start Cassidy. It honestly shocked me how difficult the process was to get approval for a life-preserving medicine for a disease that doesn't have many options. Almost every other ALS patient I have met has a similar story to mine. We are already fighting a horrible disease. We shouldn't have to fight insurance as well.
The brutal killing of United Healthcare CEO Brian Thompson in December became a turning point in the public's growing frustration with the health insurance industry. Adding to the shock, the words inscribed on the bullet casings hinted at a motive.
The NYPD believe the gunman may have written messages on those casings. Officials say the writings found said defend, deny, and depose, which may potentially go to a motive for the shooting.
That issue of claim denials, it's been on the regulators' minds, Congress, and just patients themselves and doctors who are saying that's become an even bigger hassle in recent years than it has been in the past.
There are a couple of different ways that one might face a denial from their health insurance. One is prior authorization denial or insurer pre-approval care. So that might mean an MRI or CT scan. It might mean a more expensive prescription drug. Yeah. The other type of denial that one might experience is a claim denial, which means that the insurance company...
So I'm going to give you guys a little bit of a background. I used to work for insurance companies. Not in America. The insurance company that I worked for, I worked in commercial and medical insurance. I worked in a lot of insurance, but my field of expertise was medical and commercial. So when I worked in the medical insurance field, it was for insurance companies in America and abroad. And so when they would call us, I got yelled at a lot, y'all, and I get it, it was really bad. Sometimes they would have to get pre-authorization, which she said, but sometimes even with pre-authorization, if they find that, there was some issue or something that was pre-existing, they can deny you, y'all. They can. I've had so many people have to, crying on the phone, claim denials, had to be on the hook for thousands of dollars. It's a reality, and that's one of the reasons I left the medical insurance field, because I just didn't like it, to be honest with you. But commercial insurance, same thing. We had to deny some people, depending, but commercial insurance was a little different because, you're paying for, usually it was companies paying for their insurance. Like for example, grocery stores, we covered them, and it was like millions of dollars of indemnity and all that stuff. So they were fine. But when it came to medical insurance, that will tug at your heartstrings, y'all. It was really sad. We even had some students, I remember I had one student pass away. She got hit by a car. She was it was sad. She was with her host family. Imagine. I don't even want to know how her family had to deal with that. She was an international student just there for a semester. She passed away. And then her host family was trying to get trying to figure out the coverage situation because her parents couldn't speak English. And so they were helping her out. It was sad, y'all. It's a sad reality. It's a sad reality. But anyways, yes, a lot of claims do get denied, even if they have pre-authorization. It really depends. Some insurance companies are going to be like, oh, that was pre-existing, so no. Even though you have pre-authorization. It's insane. It's insanity how they will deny you. It's the little things, y'all.
Company is deciding whether or not that they are going to cover what you have already received. So this might be the experience of going to an emergency department and then getting a big medical bill because the insurance company decides that they didn't want to cover it.
Also networks. I know in the US it's depending on your insurance network too, right? So if you went to an emergency room or a hospital, y'all could correct me if I'm wrong, but if you go to a hospital that's not part of the network, then chances are that it's not going to be covered or fully covered. They also be playing them games too, y'all.
Prior authorization denial means that you're not going to get the care, whereas a claim denial might mean that you're facing big medical bills and medical debt, which can be really destabilizing for the patient.
Blue Cross and Blue Shield of Texas initially denied ALS patient Shelby Kinsey's medication, deeming it not medically necessary, a term insurers commonly use to deny claims.
Another reason why someone might be denied is that the insurance company is saying that the prescribed care is experimental or investigational for the patient's condition.
Imagine. Y'all look at that lady. She needs it. You can clearly see that she needs it. But again, it's the game plan. Oh, you're not going in, yeah. We're not going to give it to you. You don't have to. And even if you do, look at what happened with, I can't say his name, Mario, and y'all know who I'm talking about, the L guy. His parents were wealthy, and his mom had a chronic illness, and even she couldn't get covered properly. It's a problem. A lot of people have to go abroad to get the help that they need. Seriously. A lot of people have to go abroad. That's why I'm saying economics plays a part in it. And who you marry, who you tether yourself to, is going to, again, make an impact if you find yourself in these type of situations.
CNBC contacted Kinsey's insurance provider for comment, but the company stated it, quote, does not discuss member issues with the media. Despite countless headlines and reports pointing to a rise in health insurance claim denials, the system's fragmented nature makes it hard to get an exact count.
It can be difficult to estimate exactly how many claims are denied in a given year by health insurers because not all health insurers report this data. But there are a few things that we do know. The Affordable Care Act did a few things.
Y'all want to know what the Affordable Care Act was? Obamacare. The ones that everyone remember at that time. No, absolutely not. We don't want it. That was it. To make it more affordable. That's the best he could do. Because remember, I just went over it. Healthcare is a state responsibility. So he couldn't, that's why people were like, why couldn't he do this? He did the best he could. The best. I'm not saying he's perfect. Trust and believe me, I didn't like a lot of his policies. However, I say with this, he did try. But again, it's state responsibility to fill in the gap. They don't want it. For a reason. Majority of the people in the state, they didn't see the need for it. And of course, he was a black man, biracial man, but they called him the black man. We don't need it. We don't want it. Obamacare, what's that? They're just taking money from us. Okay. That was that, y'all.
To try to help make more transparent this really complex insurance process of coverage denials. One of the things that it did was it said that when insurance companies are denying you, they have to give you the reason and there's an appeal process. Another thing that the Affordable Care Act did was it said that regulated plans had to disclose information about denials and appeals. But as is the story of a lot of American law and policy, a lot of this comes down to enforcement.
Using this limited data, KFF, formerly known as the Kaiser Family Foundation, published a study in January 2025, finding that 73 million out of 392 million...
See, it doesn't look like a big number when you look at it in percentages, but when you look at the millions, that's a lot of people, y'all. 73 million is a lot of people. That's a lot of people. See, if you're just looking at the data like 19% to 81%, I'll be like, oh, that's not that bad. But look at the people. 73 million is 73 million too many. Especially for people who are paying for healthcare. Red flag. Why are they not being covered? They're paying. This is a problem. That's a big problem. Everyone should be able to get that service. Especially when we see that lady in that breathing tube.
In-network claims were denied in the U.S. in 2023. Also, Blue Cross Blue Shield of Alabama topped the list with the highest rate of in-network denial, followed by United Health Group.
There's a lot of misinformation.
Oh, by the way, United Health Group was the Luigi guy. That whole situation. I can't go into it here, but that was that. There you go. 20 states.
Bouncing around on the internet and social media platforms, and a lot of vitriol accompanying it. We support and pay 98% of all claims.
Most American workers are in employer-sponsored insurance, and those plans have not been disclosing this information. Even
here, you heard that, employer-sponsored. So what if you lose your job? If you lose your job, then you're going to have to get on Medicare, Medicaid, if I'm not mistaken. How is that system going? This is all connected. I know I keep saying it, but I really want you guys to, if there's anything that you take away from this live stream, if you're watching it, shout out to you, because I know it's a lot of information. I understand it might be very sensitive, but this is very necessary, because I think sometimes we need a wake-up call. The employer-sponsored healthcare. If you get on Medicare and Medicaid, good luck. Good luck.
Even though they're supposed to, but the enforcement has been lacking.
Health insurers are also using AI to process data, which some experts say leads to higher denial rates. Companies like United Health, Humana, and Cigna are facing lawsuits over using AI to deny claims.
Insurance companies have jumped right into this, and they're using this technology to do a lot more denials,
That's another problem. Who's behind the AI? This is part of a greater conversation. That's why I said this conversation is not done. It's not just going to be, one live stream. We're done with this conversation. Let's move on to the next topic. It's not the same as other things that I cover, like pop culture, all that stuff. That's different. This is real life, y'all. AI is being used to deny people. AI is already biased because who's programming the AI? Hello? Who's programming it? There's not a human behind that. That's what happens when you just use numbers and you don't see data for what it is. You don't see the humanness or the human impacts behind the data. You're just looking at numbers. Oh, AI, it's a computer. Yes, AI has its benefits. I use it. I use Copilot at work. We're allowed to. I use different types of AI to help me do my work and processes. Yes. However, it can be dangerous, especially when it comes to healthcare. When I say processes, I mean like administrative, like, emails, stuff like that. That's different. But you're using AI to deny claims? There is something ethically wrong with that. You're not even looking. You're just looking, this age, declined. Interesting.
Inappropriate denials. There's some data that suggests that 25 to 30% of claims may be getting denied using AI technology. So it's a real challenge.
There are a lot of efficiency advantages. The problem is that there can be errors here.
Absolutely. It's AI. It's not error-free. You need a human to check the information and make sure everything is correct. Sometimes AI has misspellings, not misspellings, but grammatical errors. And I'm like, oh, no, that's not how I would say that. And sometimes the data is outdated. It's not the current information available. You need a human to check that and to confirm. But nope, they rather just save money. They'll fire you, have the computer determine. And the computer is biased as hell, y'all.
We're not dealing with human beings reviewing these patient files. And we know that human bodies can be complicated and people might present with the condition in one way versus another.
CNBC contacted the insurance providers for comment on AI being used to deny medical claims. Cigna said it does not use AI to deny care or claims, and Humana did not respond to a request for comment.
We do not use AI to tell our doctors how to care for patients, and we do not use AI to deny claims on the payer side.
Listen to what he said, y'all. We're going to listen to it again, and then I have to use the bathroom, so then I'll let this play out a little bit. Let's listen to what he said. You see, you got to listen to the words they say when people say things. He was very extremely strategic in the way that he worded his statements.
Cigna said it does not use AI to deny care or claims, and Humana did not respond to a request for comment.
We do.
Okay, Dr. Wyatt Decker. United Health Group. That's the same group that Mario and, the L guy. That currently has a case out. That packed him up right up out of here. That's that group.
Do not use AI to tell our doctors.
We do not use AI to tell our doctors
how to care for patients.
How to care for patients. Okay.
And we do not use AI.
And we do not use AI
to deny claims.
To deny claims
on the payer side.
On the payer side.
That's across the board.
And that's across the board. Red flag. What about the insurer side? You see, he thinks you're stupid. Let this keep playing because I got to use the restroom real quick and then I'll be back to business.
I mean, first and foremost, I think we need a lot more transparency. The fact that we don't know what proportion of claims are being denied is a huge problem. I think companies should be very transparent about what are they denying? Why are they denying it? If you're using AI, what models are you using? I think all of that would be extremely helpful. It would create incentives to build better models, and it would create incentives for people to be much more appropriate in how they do denials.
It's worth noting that most consumers are not appealing denied claims. In 2023, fewer than 1% did, and insurers upheld 56% of those appeals.
One thing that we've seen in surveying consumers across different insurance types is that they simply don't know that they have an appeal right. If appeals were used more often, it might operate as a check on carriers. From what we can see now, so few are appealed, so it's not operating as a check.
I wrote a book called Coverage Denied: How Health Insurers Drive Inequality in the United States. And I surveyed a little over 1,300 U.S. adults and found that 36% of them had experienced at least one denial. Most of them experienced multiple denials. What I ultimately find is that people from lower income or minority groups tend not to appeal as much and tend not to ultimately get the care that their doctor has prescribed.
We are striving to make the process more consumer friendly because we do recognize that sometimes it's just hard. It's confusing. There's too much time. And if you're dealing with a serious health condition, there's a lot of anxiety and emotional distress that can go with that. So our journey as an organization is to make healthcare better.
Is it? Is it really? We're going to find that out. Let's hear what he got to say.
The U.S. Census Bureau classifies health insurance into private and public categories. Simply put, private insurance is funded through premiums paid by individuals or employers, whereas taxes and government programs finance public insurance. Private health insurance covers 65.4% of the population, while public insurance covers 36.3%. When it comes to private health insurance, United Health Group, the parent company of United Healthcare, is the leader.
They're the leader? This man's the chief privacy, whatever his name. When did that man pass away? Luigi Mangione, ain't that his name? This man right here. When did he do it? What happened? When did this happen? When was he unalived? Oh, December. Okay. All right. So basically they're doing damage control. This is what this interview is about. Okay. All right. Let's continue. This was damage control, y'all. All right, let's see what they're doing. 28% other, 15%. That's a large group.
As the largest health insurer, United Health boasts a market cap of about $500 billion.
And they can't pay all the claims. Red flag! How can you not pay out claims with that much money? This is a problem, y'all. A big problem. And again, it ties to the maternity death rate. Everything. It's all tied together, y'all.
And holds 15% of the U.S. market share. In comparison, its competitors, Elevance Health and Aetna, each command 12.
Oh yeah, I used to work for Aetna, by the way. I could say that because I don't work for them no more. I used to work for Aetna, Generali, and GBG. I think they changed their name to something else. I worked for those three.
Percent of the market and have a combined market cap of under $200 billion. Following the United Healthcare CEO's killing in December, investors closely followed the company's Q4 earnings.
Reporting earnings of $6.81 a share, beating estimates by 9 cents. Revenue of
That's all they care about, y'all. This is what they care about.
$1.8 billion was slightly below estimates.
Despite missing quarterly revenue expectations, if you look at the big picture, United Health Group's total revenue grew by 8% year over year, reaching a record $400.3 billion in 2024. United Healthcare, the company's insurance division, saw its full-year revenue rise 6% to $298.2 billion.
There are very few insurers in any particular market that control most of the market, so we call it an oligopolistic.
Sis, you ain't lying. And this is what's going to happen in everything. Housing, healthcare, everything. All connected. In Canada, it's a little different, but housing, what's she talking about here?
The competitive market. If you look at United Healthcare, which is the largest insurer by far, the distinction is in addition to that oligopolistic power, they also have purchased and vertically integrated with physician group practices all over the country. They're providing physician bonuses to their own physicians to aggressively code things and then deny treatment if possible, if they can get away with it.
So, y'all heard sis. This is why you're getting dismissed. This is one of the reasons. And then they're telling you to have more babies, right? Push out more babies. You need a man. You need to find a man. Have a baby, have families. Why y'all not having these babies?
Frankly, part of transforming healthcare has been employing physicians who are focused on this concept of early diagnosis and intervention in chronic diseases. And so we do not own or operate hospitals. We focus on ambulatory health care and keeping people out of hospitals. And we employ fewer than 10,000 physicians today. By no means would we ever incent our doctors to deny claims or...
Right. You say you don't work in a... Hold on, let me go back. I don't know what this man's talking about.
Bonuses to their own physicians to aggressively code things.
So it looks like he's basically, again, doing damage control.
And then deny treatment if possible.
So this was a research. This is a research, y'all. Somebody actually went out there and researched this, and then look at this man.
If they can get away with it.
Frankly, part of transforming healthcare has been employing physicians who are focused on this concept of early diagnosis and
intervention. Okay, okay.
Intervention in chronic diseases.
In chronic diseases. Okay.
And so we do not own or operate hospitals.
We do not own or operate hospitals. We know that. You're an insurance company. That's okay. So these 10,000 physicians, what's the qualifications? And how do we know? Lord, there's a lot of questions I have, but let's let him continue.
We focus on ambulatory health care and keeping people out of hospitals.
You focus on keeping people out of hospitals, but then you deny them and deny the claims. Red flag. How is that possible? And look at him. His head is all shifty. Like, yeah, we did this. Yeah, okay.
And we employ fewer than 10,000 physicians.
So you employ fewer than 10,000. So he's basically debunking the research. He's like, no, we don't employ 10,000. We actually employ fewer than 10,000. And guess what? We don't own hospitals. We have our own research for early intervention. But guess what? They're not using it. You know why? Okay, he's right. They probably do have research for early intervention and early prevention and intervention. But I'll just say this. He knows how to use his words properly. He's doing the research, but not for what y'all think it is. He's doing something else.
Today, by no means would we ever incent our doctors to deny claims or tee people up to have claims denied. That's just preposterous. We do have our doctors engaged in these value-based care models, including Medicare Advantage. And for Medicare Advantage, it's important to document early any signs of disease. And let's just say something.
They're documenting it so they could deny you. Red flag. Pre-existing. Yeah, you see, I told y'all there's something behind this. He's not doing it just to be benevolent. He's talking about, hey, we're going to do this whole research so we can do early prevention, intervention. No, so they can know, hey, you have a pre-existing condition, so we could keep more monies lining up in our pockets. We found better ways to figure out how to deny your ass. That's what that is, in my opinion.
Something as simple as hypertension. Making sure that blood pressures get checked, monitored, and if eligible.
Yeah, because of the insurance company. He thinks he's smart, y'all. I'm telling y'all. As somebody who has worked in an insurance company, I can tell you he's doing that. They're doing that on purpose. They're going to monitor you. So they could be like, yeah, you see her blood pressure, look, from this age. So let's say that I had this healthcare, okay? I'm gonna lay it out for y'all. Let's say that I had this type of healthcare, right? I was under this company. And then after that, let's say for the first, I my age, I'm 39. I don't care. I'll let everybody know I don't care about that age stuff. So let's say I was 30 when I got the insurance. I started working at this big little corporate company. Yeah, I got my job. Yeah. Okay. 30 years old. Started working at this company. Got this healthcare. And they kept checking my blood pressure. I would go to the doctor all the time. My blood pressure was pretty much okay. Going higher, low, whatever. And then, let's say I hit 39, and then my blood pressure just starts to spike up. It starts to go. And then I'm noticing, oh, there's a difference. What's going on? What's happening? And then a few years pass by, and then I get high blood pressure. I get diagnosed with hypertension. So then let's say that I don't want to say me. I'm not going to put that on me. But what I'm saying is, let's say I have a medical episode. Let's just call it that. They're going to check all those records. They're going to be like, oh, you see, her blood pressure started spiking at 39, and then at 40, she had her medical emergency denied. Pre-existing. They're going to monitor you because, remember, usually they get that information from doctors. But now they're going to get it from their little doctors. Oh, yeah, we got doctors on here. We got nurses. And insurance companies do hire nurses and doctors, just FYI, by the way. So we're going to comb through everything, and now we can see, oh, this is it. It's a better way to deny you.
They to get addressed. That's just good medicine, right? There are financial incentives that are tied to our doctors who do a really good job identifying and treating chronic diseases.
But you didn't tell us whether you pay it out, sir.
United Health Group is posting record revenue and pleasing shareholders, while its insurance arm, United Health Care, faces criticism as the worst major insurer for claim denial.
Of course it is. Look at what he's talking about. Oh, yeah, we going to help you. Don't worry. We got y'all covered. We trying to do preventative care, you see, because then you won't need us anymore. Then the money should not be that high. The claim denial shouldn't be that high either, if what he's saying is true.
One study says it rejected about 1/3 of claims.
Right out of the gate, we pay 90% of claims. So 90% get paid right away. And another 8% turn out to be missing some important piece of information or something. So they sort of bounce around a little bit and they get adjudicated and paid. And then 2% ultimately do not get paid.
So remember I said the numbers sound very small when you're looking at 90% and 2%. But remember we saw the little pie chart. That 19% was like 73 million people. So the 2%, we need to know the numbers. He's not telling us. He's just giving us the percentages. Like, 90 and 2, that's not bad. He's right. Why are people complaining? What are the numbers, sir? What is the 2%? How many humans are behind that number? That's what I need to know.
Which is relatively modest, and it's usually because a procedure or a desired care is beyond the scope of what either the federal government, the state government, or an employer has agreed is going to be covered by their insurance plans.
Honestly, when you look at United Healthcare as a company, it has probably more allegations of denial, wrongful denials than almost any other.
He's the former commissioner of NYC Consumer Affairs, y'all. So I don't know what that doctor was talking about, but I'm inclined to believe this person, him, sis that was talking ahead of him, and all the people, not the people from the company.
A lot of the testimony that you've heard already about United Healthcare is that profits before patients.
Of course.
The allegations.
Of course. There's no way that you can make that much record-breaking profit and not deny. Logically speaking, how are you able to keep that money if 90% are paid? So you're telling me 2% were able to bring you up to the the growth that you had, the record-breaking growth?
As I read about more of them, it's just extraordinary. It's got to be reformed. It's not only United Healthcare, it's all the insurance companies.
The U.S. healthcare system is a paradox.
Okay, let's look at that. Let's look at this chart. U.S. life expectancy 78.4 and health spending per capita is $13,432. I'm trying to see how they did it, but okay, we're gonna go with that. Germany life expectancy is higher and they're paying less. Red flag. How is that possible? How? Let's go to the least, the one who spends the least. Japan spends the least, and their life expectancy is 84.1. 5,640 per capita, and that lines up. I'm not surprised. Canada, 7,000 per capita. You guys are paying a lot for your health care, and you're not even living longer than everybody else. That don't make no damn sense. It doesn't. It doesn't. The least amount is Japan. Second to least amount is UK. And UK is also going through a whole issue, but sometimes that comes with it. Austria is 7,811, Canada 7,013. Australia 6,931. I'm surprised. I thought it would have been a little higher, but okay. Congratulations, Australia. You're not that bad. US is 13 among your peers. That's insanity, y'all.
U.S. spends more per person than any other wealthy nation, an astounding $13,432 in 2023, nearly twice the average, yet has the lowest life expectancy among comparable countries.
Absolutely.
Despite over 90% of Americans having health insurance, medical debt remains a pervasive issue, currently estimated at a minimum of $220 billion. This disconnect between spending and outcomes is further underscored by a recent Commonwealth Fund report, which ranked the U.S. health system last among 10.
Damn, this is eye-opening, because I mean, I already knew this in theory, but seeing it played out visually is very disturbing. They made sure to put y'all all the way at the bottom, lower performing. Canada, we're not that, we shouldn't be proud of ourselves either. We could do better. But dang. Looks like Europe is doing pretty well. Europe is doing way better. But still, they still have problems, but at least they're doing better. US, you're at the bottom. This is insanity. You're supposed to be the richest nation in the world, by the way.
High-income nations. On top of that, U.S. consumers are frustrated by escalating health insurance premiums.
Absolutely.
We don't always have...
Exactly. So how... I don't know. That doctor he's grating my nerves. Insurance is increasing. Your claims are getting denied more. And yet somehow he's trying to say that he's helping y'all. How?
Have the best bang for buck when we look at population health outcomes. And so there are a few different reasons that account for the high health spending in the United States, despite not having universal health coverage. One is that we have a lot of reliance on private insurance, which spends a fair amount on administrative costs relative to just direct patient care.
If one looks at the cumulative increase in the cost of family health insurance premiums between 1999 and 2023, that increase is 314%. And a good portion of that is not being covered by an employer. The workers' contributions have actually increased over that time 326%. Those increases are dramatically higher than the increase in workers' earnings over this time period. The cumulative increase in workers' earnings is only 111%.
Let's go through this, y'all. I don't know. I'm getting. I might have. We need a palate cleanser after this, but I hate to be the bearer of bad news, y'all. But this is reality. We have to really start being realistic. We have to. Hey, everybody. Hey, I'm sorry I didn't get to check the comments. Hey, Sam. Hey, Rosa. How you doing, sis? I'm sad, y'all. This is... Oh, thank you, Fitness. Thank you so much, sis. Luigi. Yeah, I know I can't say his name, y'all, because I ain't trying to have... I don't want to be censored because this is important information. But, yeah, I'm sad, man. This is sad. All right, let's do this. Sometimes I like to, you guys know me. You know my personality if you've been watching me for a long time. I can make light of some situations, but this is disturbing. It's very sad. I'm really speechless, and it's very rare that you'll hear me being speechless, and that's because how is this possible? Look at this. Family premiums have gone up 314%. Workers' contribution 326%. You're paying more. You're living less. So basically you're paying more and your life expectancy is less. And then workers' earnings. Your earnings are only 111%. Red flag. That's global, though. I'm not even going to lie to you guys. We're having an issue here. You go on the news. You can go and check it out. I can't talk about it right now because, I still have to, I took an oath. So I can't talk too much. You guys can check out the news if you're really curious about what's happening here in BC. But this is a problem. People can't afford the premiums. So then how are they going to get this health care? What are they going to come out with? Trump care? Is that the new wave? Because this is unsustainable, just letting you guys know. So then how are they going to feed people and get people to have good health care? If people, remember, health care is tied to the employer and a lot of people are losing their jobs. Then they have to go into the public system, which is not doing very well, by the way, get public funding, right? With a government that's slashing everything. And look at these numbers. These numbers are grim. This was published 6 months ago, posted 6 months ago, y'all, February. We are in September. More people have lost their jobs. So now, if wages are staying at the bottom, premiums are going higher, you can't afford health insurance, how are you going to get your health care? You're going to be in debt. Debt. They're trying to put you in debt. This is why I'm having this conversation. It's very important, y'all. We have to start really making different moves. What worked before is not going to work now. Anyways, let's continue, y'all.
And so workers are seeing a substantial increase of their paycheck going towards covering their health insurance. Now, when people see those disparities, they blame a lot of the difference on health insurance companies. They think health insurance companies are the ones that are enjoying all the profits resulting from these dramatically higher premiums. It actually turns out if one looks at the price data, one finds out between 2006 and 2023, hospital prices have actually increased 180.
Red flag! So... oh, now it makes sense. So every time, remember, people getting denied, not getting the care, black women dying at a disproportionate rate compared to their peers, going in for like routine pregnancy, delivery. Hospitals getting paid for all of that. The data's in your face, y'all. 184% hospital services. Yellow, health insurance is lower than that. I can't believe that. Professional services is just there. So you're not only worried about the insurance company, it's the hospital too, because they're charging you way more than they should. Their profits are increasing. Everybody getting paid, but the regular worker. You're spending more. And not even getting the best care, by the way. And I'm saying that as somebody who is living in a country where I can say we definitely can do better. We need to. Other countries have outpaced us. When it comes to modernizing healthcare, we're still stuck in the 70s, 60s. And again, because everything is so fragmented, when you look at states, that's what I'm saying. Like, I even had to, I always say I talk to Dom because that's the best example I could give you guys. Because Dom doesn't understand that. Because in Korea, again, they have a public health system and a private health system, healthcare system. But both of them are being, they're both really fast. You can see a doctor same day. Same day. So 80% gets covered by the government and 20% you pay out of pocket. You pay nothing, next to nothing. Do they have their problems? Absolutely. The doctors, but it's more of a classism problem. We'll just leave it at that. I'm not going to talk about what's going on. That's another topic for another day. But what I will say, though, is that we're fragmented. And the difference with those countries that we were talking about with better healthcare systems is that, again, like, you have to think about it from a capitalistic perspective. If you have public health insurance, because our health insurance is based off of need, social need, right? So we're a socialist capitalist country, basically, right? Even though we operate under the same type of system, when it comes to capitalism, we do implement some level of socialism in there. So everyone has the right to free healthcare. Everyone has the right to different services, right? Basic rights to food, water, shelter. It's in the Canadian charter, the Canadian Charter of Human Rights and Freedom. Oh Lord, I forgot the name. Canadian Charter of Rights and Freedom. Shout out to Pierre Trudeau, Justin Trudeau's father, by the way, Prime Minister Pierre Trudeau. So that's why we have a social system. He's not the reason why. We've always had one, but I'm saying, like, that's why it hasn't gone away, is because of that, right? So our tax dollars pay for our healthcare system. We just offload it up front, right? The problem is that when you live in a society where it's unchecked capitalism and anybody can do anything, the rules don't apply to everyone, this is what happens. You're going to suffer. If you don't have money or resources, and even then, you don't have the protection. This is what the results are, y'all.
184%. Physician prices have increased 138%, and insurance prices have increased, but they've increased only by 128%. And that's because when you take the cost of health insurance and you net out the cost of the underlying health care, health insurance prices have not increased as much as they have for hospitals.
Widespread frustrations with health insurance are reflected in a recent Gallup poll, which reveals that views on healthcare quality have dropped to a 24-year low. Many, including United Health Group CEO Andrew Whitty, agree that the healthcare system needs reform.
United Health Group CEO Andrew Whitty writing a piece in the New York Times today about what he calls the flawed healthcare system in America.
The folks are paying more and more for coverage of which they know less and less about, and which is more and more complicated. So if I buy coverage, and all I'm getting is a denial, then you question the value of the product
why are we
that
paying
you have
it?
purchased or your employer has purchased for you.
CNBC reached out to major health insurers and AHIP, the National Trade Association for Health Insurers, for comment on claim denials and the healthcare industry. AHIP stated that health plans, providers, and drug makers share responsibility for making care affordable and
health plans. Okay. All right. Let's see what they said. In the fragmented and heavily regulated healthcare system, health plan providers and drug makers, share a responsibility to make high quality care as affordable as possible and easier to navigate. Red flag. Where's the state government? Remember they told us federalism is you're connected to the people. Where are they? Why is this going unchecked? Why is there no regulation for this? This is craziness. Why? And if there are regulations, why aren't they being implemented? Because this is why we have this greed, unfettered greed. Somebody wrote it in the chat. You're right. It is greed. Somebody's getting paid off, y'all.
easier to navigate.
Healthcare in the United States is very fragmented and very expensive. These are true problems that we need to air and discuss. It's awfully easy to find somebody to blame.
Oh, right? Be quiet, sir.
Let's blame health insurers. Most people don't know that health insurers are actually administering plans with rules made either by the government or by employers.
Actually, he is correct about that to a certain extent. That's why I said it's all about what they write on the laws. Laws. Yes, it's true. It is true. I know as far as Canada goes, I can't speak for the U.S., but I'm assuming it's a bit similar, maybe different, but a little similar, is that, yes, your ministry in Canada, so ministry of whatever, we do look at the regulations and things that are like scope of practice, expanded scope of practice, all of those things. However, it is still up to, in Canada, how it works is it's still up to the colleges, so the profession, in order to uphold things, right? So there's like a shared responsibility. So what he's talking about is only a partial truth. You are also responsible, Mr. Doctor, whatever your name is. Yes, he's right. There are rules and regulations when it comes to what health insurers can do, what they can't do. But however, is it being enforced? That's what we need to figure out. And the second thing is you also are able to do things. Sir, don't act like this is the state's fault and not us. You're only working within the parameters that you're allowed to. Red flag. How are you allowed to make that much profit in these times? That doesn't make sense now, does it?
We need to actually bring down costs of healthcare. Too many procedures are done in very expensive settings that could actually be done in outpatient settings at much...
Outpatient settings, red flag. No. 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 Too many procedures are being done they can be done in outpatient settings. You're going to see an influx of people passing away. There's a reason why it needs to be done in the hospital. Some procedures. I'm not saying all. But the way he's sounding, no. He's trying to act like it's like a regular routine. Some people are doing BBLs in outpatient places, outpatient clinics. Let's see how that's been going for them. BBL. outpatient clinics in Miami. What kind of procedures we talking? Routine? And even a routine procedure. People have passed away from root canals, wisdom extractions. Anything can go wrong. What is he talking about? And how are you going to regulate these outpatient places, sir? He's thinking about profits right now. That's all he's thinking. Everything's money. Oh, yeah, we got the outpatient clinic. And then we don't have to spend that much. You see? Then we could... Yeah. Please.
Lower price points and help bring the cost of healthcare in the U.S. down.
As discussions on claim denials continue, former NYC Consumer Affairs Commissioner Bruce Ratner highlights the potential solutions.
It probably would require an act of Congress to do that, to require that, in fact, you have to post or you have to disclose your denial rates. Right. It can be done by the states. I don't think it's likely to be done by the Congress, frankly.
You see? Even he knows exactly. It can be done by the states, but he has doubts it will be done by Congress. Why? Because it's not the responsibility of the federal government. It's your state government. That's why. Check out all your state representatives, your governors. Good luck.
It's the correct kind of system. You need something against the other side. And against the other side would be publishing denial rates so that we choose our company based on denial rates, and that makes the companies work very hard to be competitive.
I wish insurance companies would treat each case like the person they are instead of just another number. I believe that healthcare should be accessible to everyone and
There we go. Yes, sis. Yes.
less focused on making a profit. At the end of the day, these companies are supposed to help us, not make things worse.
All right, y'all heard it. And y'all are cooking in the chat. All I will say is I agree. I haven't read everything, but I'm sure I agree. You guys are smart people. It is not perfect, but when I look at the system in the U.S., I am flabbergasted. Me too, sis. I can't understand it. I can't. It's crazy to me. It's crazy. Sem said doctors stopped saving lives and started working for Wall Street. It's really sad. You'll have it bad in the West. I send prayers that you will stay safe and secure. Thank you so much, Sem. We needed that positivity. Thank you. I send out prayers too, man, because yeah, you're right. Corruption. Ooh, that's another topic for another day. Yeah, they're bought out. Yes. Yeah. Lobbying groups. We need to, you know what? I'm going to do a live stream on lobby groups. That's going to be an eye-opener to you guys. It all makes sense. Rosa, you said, I recall a story of an American man who had a heart attack in France and was hospitalized in the American Hospital of France. He had to pay 20,000 pound bills. It would have been 30K in the US. Yeah, I'm not surprised. This happens so often, y'all. It happens so often. And then they can't afford it. You'll go into medical debt. Imagine if you have an illness, you can't work. You're going to perpetually be in poverty while this man's sitting here trying to tell you that they don't deny claims. He's a liar. A liar. A liar. The star that fell, you said you pay $200 for insurance every paycheck. You have to get the one with the most benefits because you have a disability. Yeah, sis. I feel so bad for you, sis. I'm not surprised. I pay a bit too, but mine is more supplemental benefits. So it was optional for me, but yours is necessary. That's the difference. Mine was optional, so I get additional health care for like naturopaths, like my therapy. But the therapy I have is free. It's covered through our health insurance, through the BC health insurance. But if I want to get like individual private therapy, then I had to get the insurance coverage. I feel so sorry for you, sis. It's expensive. And then look, your life, that doesn't make sense. Wages are not going up. This doesn't make sense, y'all. If you work for a nonprofit in the US, you get really, really cheap insurance, I think, but the salary is usually low AF. It is. And those are the people that we need. But again, it's hard to keep a nonprofit when you can't even keep a roof over your heads. Like, the overhead is too expensive. So that's why you're going to see a lot of nonprofits closing shop. They can't afford it. Politicians, Namaya, girl, I agree. Yup, that's all I'm gonna say. I can't say it out loud, but I agree with you, sis. I agree with you. All right, let's move on to the next video, y'all. This is a tragic one. I'm telling y'all, this is an eye-opener, and I don't want to be doom and gloom. I try not to be, but I after yesterday's live stream, after I watched that video, I just had to be like, no, we need a wake-up call. This is a wake-up call, y'all. Let's go over this sister's story. This video is a bit long, so what I'm going to do is I'm going to skip through the AI voice. This is an AI video, but it's about a young mother, 27 years old. Her name was Namaya. Hold on. Her name was, Kierra Campbell. Sorry, not Namaya. Oh, my God. I just read your comment. That's why I said that, not you. Kierra Campbell was her name. And she tragically passed away, y'all. We're going to find out how she passed away. And again, this is another conversation. All of the women that I've covered or that we talked about in this stream, the ones that you saw that passed away from complications of childbirth, they were all in their mid-20s. Mid-20s. And here they are trying to tell you to have babies earlier. It's not a guarantee, y'all. Let's continue.
With everything she...
All right, so I might have to skip a little bit of this because it's 21 minutes and then there's the AI voice. I don't know. AI voices, Is it an AI voice? Hold on, let me listen.
The insurance she needed to stay alive was cut.
Oh, it's not an AI voice. Okay, we'll listen to it. But there's like some of her I want to go through her thing. Her videos when she went up and talked on Instagram. So let's just hear a little bit of what she has to say and then we're going to skip to Kierra's video.
Off. This is the story of Kierra Campbell. It's a story of how a paperwork problem, a bureaucratic detail, became an actual death sentence. And it brings up a terrifying question. We're told there's a safety net to catch us when we fall, but what happens when that net has holes so big a whole person can slip right through? What happens when that person is a mom, fighting with everything she has to stay alive for the 7 kids who need her more than anything in this world?
7 kids, y'all, at 27. 7. And she had a partner. I don't know if it was her husband, so I don't want to say anything about that part till we get there. 7 children, y'all. 7.
Before her name was all over the news, Kierra Campbell was a mother, just 27 years old, and her whole life was about her 7 children. They were her world, her reason to get up, her reason for every single breath that she took. Her friends and family said she was full of life and all about her family, handling the everyday chaos of being a mom with a special kind of strength, a strength that was about to be tested in the worst way possible. For years, Kierra was battling chronic heart failure. It's a condition where your heart just can't pump blood the way that it's supposed to. It's an exhausting, hard thing for anyone to live with. But imagine being a young mom with a house full of kids. It was a constant uphill climb. She handled her illness with so much grace, but by the middle of 2025, her body was starting to give out. Her heart, the same one that was so full of love for her babies, was failing. Its function had dropped to a terrifying 10%. Because it got so bad, she ended up at the Christ Hospital in Cincinnati, where she stayed for over a month. She was stuck in a hospital bed fighting not just to manage her symptoms, but fighting for her life, minute after minute. Her kids, the center of her universe, couldn't be there with her. They could only wait and hope their mom would come home. And for Kierra, getting home to them was all that mattered. She wasn't just fighting for her life, she was fighting for theirs. So picture it. Kierra's in the hospital room, and her life is literally hanging on by a thread, or more like an IV tube. She was hooked up to 2 really strong IV medications, and these weren't for pain, they weren't optional. These drugs were doing the job her own heart couldn't do anymore. They were forcing it to keep pumping, keeping her alive.
All right, I'm going to fast forward just a little bit, y'all.
Bad.
Shout out to this sister, though. Unapologetic Opinions of Mine. Thank you for this video because you were the ones who did a compilation of all of her videos. That's why I chose this one, y'all. So we're going to hear Kierra in her own words. We heard a little bit of the background. She had a chronic health condition, a heart condition. And imagine she had 7 kids during that time. 7. This is where I said we got to be a little realistic. But I'm going to listen to her story. I don't want to condemn her because she's only doing what she knows. She loved being a mother. However, sometimes your body cannot handle that. And that's another thing we have to talk about too. It's that not everyone can have multiple children. Sometimes your body cannot handle it, y'all. And we have to be realistic about that. And there's this pressure from society. You'll just have kids, just have kids, just have kids. You don't know what it's going to do to your body. Again, another risk assessment has to be done. Are you in great health? Even if you are, again, I'm not saying that it can't happen because I told y'all the story of one of my friends yesterday who was in great health and she still experienced complications. But aside from that, you also have to consider the fact that maybe your body's trying to tell you something too. But then again, if you have a partner or society telling you, family telling you, oh, just have it, when you gonna have your second one? Yo, do you know how many people that have one child and it's like, you guys ready for the second one? You guys ready for the second one? They don't even know your health issues. They think it's easy because you're here. But what they don't understand is while you're here, there's somebody else who had to sacrifice their life for their child to be here. And sometimes both of them are not here. They don't consider that. That's a problem.
She needed to get
let's fast forward
home and see her kids again. It was a race against a clock that was ticking way too fast. A battle against a bureaucracy that moves at a snail's pace.
Okay, here we go.
Love you too. I mean, I don't have nothing else to do. What else am I supposed to do? Hospice is my only chance right now. Like, that's the only thing I can do. I love you too. Yeah, go get your hearts checked out. If anybody feels like flutters in their heart and stuff, that's how it started with me. I was pregnant with the last set of twins. I used to get a lot of flutters and stuff. And my heart was at like 30 to 35 when I found out. Now it's at 10 or less.
So I'm not going to give her a red flag. Like I said, she didn't know. She didn't know. And so this is why it's really good to document things and to share your stories. You don't have to share everything, obviously. There are some things that are personal, but I'm so happy that she did this before she passed. Thank you to you, sis, and rest in peace. My condolences to her family. She didn't know. So I'm not going to condemn her for anything. She didn't know. She thought that everything was fine. She kept having kids. Because again, that's the standard, right? And now she delivered the last set of twins. So she's been having this condition for a long time and it's getting worse. And when you're pregnant, your organs, you got to remember, it's not only your organs are not only fighting for you, because every day your organs are fighting for you. Every day. When you eat that KFC or whatever chicken, it's fighting for you. Trying to block diseases every moment. While I'm sitting here talking to y'all, I'm sure my immune system's like fighting diseases. Left and right. Your body's continuously working. And then when you go to sleep, you regenerate and it regenerates cells. That's why it's important to sleep and get proper sleep, have a proper diet. That's why, because your body needs to regenerate in order for it to fight another day. Now, Sis's body gave out because it was just too much. too many kids. And also, I'm not saying it's only kids, don't get me wrong, but that definitely contributed to this. Because your body is not only fighting for you, but for your baby. And if you already have some conditions, and then also, like I said, there are barriers and inequality in the healthcare system of where you live, in the state you live in. You don't have the economic resources added onto that. This is hard, y'all. It's not a cakewalk.
Yeah, I'm at the point where I can't even bathe myself anymore. I just don't understand what else am I supposed to do if hospice is my only option. Unless I want to stay in this hospital all the way in Cincinnati and be away from my kids and family. It's the only option right now. That's exactly why I stopped smoking too. Stopped smoking, drinking, doing drugs, all that. I wasn't doing nothing but making myself worse.
I'm not going to give her a red flag because she's already gone. But please, take care of your health. Do not smoke, drink, all of that stuff. Alcohol is a carcinogen, y'all. Carcinogen. And then look at how, first of all, the alcohol, the age is so young. Some people are drinking every weekend, every day. Not saying you can't have your little wine and your charcuterie and stuff, but be mindful of how much you take because your body has to fight your liver. Especially your liver has to fight extra hard when you drink, just to detox. And then on top of that, if you have a fatty liver, that's another added thing. There's just so many issues. And then this is all preventative. Again, healthcare, preventative health. Start taking care of your body. And I'm glad she started doing that, but unfortunately, it was too late for her.
Them vapes. I gotta quit smoking them vapes.
That too. That too. It's worse than smoking cigarettes in some cases. There are people on TikTok right now, young at that. They're very young and they're already having these like heart issues because of the vaping. Lung issues because of the vaping. Chronic lung issues.
Ain't got so much though. I have chronic heart failure, and I'm at the end of life. And it's stressing me out. I pray every hour. Every hour I'm praying. I got over like 4 churches, the whole church praying over me. Churches donated as well. One thing about it is, one bag is $950, right?
Red flag! Red flag! One bag is $950 for her care? One bag of what? Hold on, we gotta listen to more. And I don't want to speed this up because I don't know, when I speed videos up, I want to hear all the details. So, and then remember, she has a heart problem, so she has to speak slowly.
And them bags only last a week.
One bag of what?
I think I'm able to get like 11 bags. I think right now. So that's 11 weeks at least.
So one bag, I'm assuming it's the type of bag for her, maybe her heart issue is $950, and she said that it's one per week, and she only has 11 weeks. That's $10,450. Who can afford that? And by the way, y'all, I'm saying who can afford that in 11 weeks? Every 11 weeks, you have to spend $10,000. It's impossible. And it looks like she knew that.
After that, it's slow. Ain't no turning my ICD off, my defibrillator off. I'm switched to DNR.
So they switched her to DNR, so that means, yeah, she's done. That she knew it. That's too. It's hard. Insurance was never going to cover that. To be honest with you, it should. My opinion, if you're paying into it, but they're not going to cover it. They're not. Defibrillator is that machine that people use, when your heart stops and stuff. It helps your heart kind of beat. So basically, she's on a machine. And they put her on Do Not Resuscitate. 7 kids, y'all. 7.
Thank you so much. I'm just worried about my kids, for real. My oldest especially, he's going through it. My sister, Kelsey, she's definitely gonna go through it. But that's why they're sending me at home, because I can spend as much time with the family as I can. They got me a hospital bed. I'm in a wheelchair now. The bathroom, shower, all that stuff. Take any little weird feeling y'all feel in your chest and in your heart, butterfly feeling, get that shit checked out.
She ain't lying. I had heart palpitations at one time when I told you guys my story earlier. That's why I went straight to the ER. Luckily for me, it was just because I ate high sodium food. Ever since I got on my diet, like after that time, I gained a lot of weight in a short amount of time that year. So after that, I decided to start eating healthier, and then the issue went away. Never had that issue again. And it's because I started to exercise, walk, eat healthy. And I also have a condition where my blood cell is like, everyone's blood is like this. You get oxygen. Your cells are like this. Mine are a little jagged. I have the sickle cell gene, but I don't have sickle cell, right? So, so it takes a little bit more for my blood to pump. So again, those are all high risk factors. And then on top of that, she has this heart condition. She had children. I'm not surprised her body just gave out, unfortunately. But it's very sad for the 7 kids because they're going to grow up without their mother. It's high risk, y'all. High risk.
Something's going on. Oh, I don't qualify for a heart transplant. I didn't even qualify for the LVAD no more because it's too bad. My heart's too bad. If they said it's too risky, if I get the LVAD, I'm going to die during the surgery. That's how bad it is. So there's no point in getting that. And if you can't get the LVAD, you definitely can't get a heart transplant.
27, y'all. 27.
Yeah.
Man.
How you feeling?
All right.
Hi.
I'm on Facebook.
You're on Facebook?
Yeah. But everybody knows what's going on with me.
Okay. You're on Facebook.
It's in a
Figure out the list.
So I have to fast forward because she's talking to her health provider. Okay, that was her talking, because after that it goes to the AI, and then is there another video? We're gonna skip through the video here.
Taking my medicine.
Okay, y'all, trigger warning. Trigger warning before I play this. I have a feeling that this is going to be very sensitive, so please exit out if this is too sensitive for you. Trigger warning. Trigger warning. Yeah, I think it was IV fluid bags, y'all. It is very heartbreaking. Extremely. Hey, that girl from yonder. Hey, sis. Welcome. Yeah, it's... Alright, trigger warning, y'all. Alright, I'm gonna finish playing it. Please, trigger warning. Be careful. Alright, I'll finish playing it. It's probably for like the next... It's not that long. It's like a 2-minute video, probably. Or 1 minute. Alright, I'm gonna play it now.
With the medicine that was keeping her alive about to be stopped.
It's all my fault. I was neglecting myself, hanging with the wrong people, drinking, doing drugs.
It's not your fault, sis. And I wish she was alive for me to tell her. But if you're going through this situation, it's not your fault. You didn't know any better. How can you do better if you don't know better? It wasn't your fault. It's the environment that you're in. And also, it was people around you. I'm not saying all, but I'm assuming that this was something that was socialized, right? She was socialized into this. And when people around you are not saying, like, if everyone around you is doing the same thing, and you think that this is the right way to do things, and then you learn that later on this was probably not a great way to live your life, it's very dysfunctional, then later on you have time to change. Unfortunately, in her case, she learned everything too late. And I'm saying this from experience. If you have people around you who are pressuring you to do things, or who have normalized a certain type of lifestyle and behavior, it is very difficult for you to get out of that unless you completely remove yourself. This includes friends, families, and others. It's very difficult, y'all. It's not easy. So I wish she wouldn't have blamed herself. Smoking, drinking, yeah, it contributed to it, but that wasn't all. Your health, weight, the children you had, it all contributed to it. Lifestyle, environment, but you didn't know any better. So I cannot condemn you. I'm not going to condemn you, actually. And I'm happy that she at least has videos and documentation of this as a teachable moment for the rest of us. But it's not her fault, y'all. Unfortunately, when you're in an environment that promotes things, like I said, it's going to be hard for you to get out of that cycle. You have to expose yourself to new things to realize that it's dysfunctional. People have pressured, not, like I said, I'm not going to say too much, but people have pressured me to do things because that's what everyone around them is doing. Why don't you do this? Why don't you buy a house now? Why don't you and Dom have a kid? And thankfully, Dom and I have we talk about these things quite often. And the risk is not, the risk is too high for us. We assessed everything. And we're like, it's too risky. So we're just going to do what we're doing now. Let's get ourselves to a place where we can revisit this discussion once we're able to. But right now it's too risky. And unfortunately, a lot of us don't have that opportunity to have these conversations because people around us, they're going to promote things that may not necessarily be good for us. But because you see other people doing it and they seem okay, then you think that you're supposed to hop on the bandwagon when that could be furthest from the truth. So yeah, all of that to say, sis, if you're like her in her situation, whatever it is, it may not be as bad as her situation. Don't feel bad. Now that you know better, guess what? You're going to do better. As soon as we shut this live down, you have an opportunity to do better. That's what we need to start talking about. Don't beat yourself up for past mistakes or things you coulda, shoulda, woulda. just, you have the opportunity to move forward, you're going to move forward.
And is that oh, because they totally 100% for sure deserve it. Taking my medicine. No. Delicious chicken they may or may not deserve. Purdue.
Right now at the Home Depot, shop more than 20 savings on GE Profile appliances. Sleek outside, dual dispensing.
I think she's listening to something in the background.
All you can think about is my kids and my sister. My sister's gonna lose her school. Something happened to me. She's gonna lose herself so bad.
Funny. I'm trying to get my own car insurance. Well, that's easy. USAA.
It's like, where my kids gonna go?
The internet came.
So let's stop this right now. We're gonna move on to her GoFundMe. So notice how sis talked about her kids. This is the second video. She has 2 videos. She had the one where she was talking in the hospital, and then this one where she was, I believe in the hospital, still in the hospital. She's worried about her kids and her sister. She said, where are my kids gonna go? Red flag. This is the red flag. The only red flag I'm giving. And it's not for her. Where are these kids' fathers? Do they have one father? Why was she concerned about that? This is the red flag. The fathers, where are they? Or father, where is he? She's worried about her kids and her sister. What are her kids gonna go? Where are they gonna do? Yeah, but where's their father? So now, let's get into it. We're done with this video. She had a GoFundMe, y'all. So let's see this GoFundMe. It raised 50K, thank goodness. Or 42 out of 50, that's amazing. All right, so this is their father. That's what I'm assuming. So I don't I don't want to say I don't understand, because I really don't understand, to be honest with you. I'm not in her situation. But if this is their father, then she should. I could understand if she was more concerned about her kids living without her. But it seemed like she was concerned about their care. Or am I misinterpreting that? I feel like she was concerned about their care. But if you have a husband who is a good man, a good husband, there's no such thing as a great husband, by the way, but like a decent husband, a husband who actually cares for you, protects you, provides for you, and you're about to leave this earth, at least you know your child's being taken care of. That's actually one less worry you have to think about. And then you would just be like sad that you're leaving your child without you, but not concerned about their care and well-being, because I wouldn't have to be concerned about that. If I had a child with my husband, I would not be concerned about that. I know that he got them. I don't have to worry about it. So he has them. I know that they're going to be fine. They're going to be straight. But what is going on here? This is very sad, y'all. So this was her GoFundMe. Hi, my name is Kierra Campbell. I'm 27 years old, and a few years back I was diagnosed with chronic heart failure. About a month ago, everything got worse. My heart is at 10% right now, and I've been in the hospital for over a month. I'm having problems with my insurance, which is causing me not to be able to leave the hospital right now. This is a red flag. This is why I went over those videos about insurance companies. Oh my God, I have so much light. Sorry, y'all. This is why. Well, I can't leave because I'm on 2 IV. So you were right. Whoever wrote IV fluid in the chat is correct. I can't leave because I'm on 2 IV medications that are making my heart pump and keeping me alive now. My insurance got cut off due to missing a child support hearing. Red flag. Child support for what? Wait a minute. Wait a minute, sis. Okay, so again, she's gone. No comments against her. But I need to know what happened. Child support sanction? But she has 7 kids. It looks like all the kids are with her. Hold up. Wait, what just happened? Okay, we got back. I gotta figure this out. All right. We're gonna figure this out. Child support told me that in order to lift my sanction and get insurance again, I would have to go down there and fill out paperwork, wait for a court hearing, and then actually attend that court hearing, and then they will lift the sanction. I am currently at the Christ Hospital in Cincinnati, and I cannot leave. The only way I can leave is if I have my medication, which is $10,000 or $1,000 a week. So that's what she was talking about when she said $950 a week. Yeah, for each bag. I really just need 3 weeks of time to go to child support and handle my business. I haven't seen my kids in over a month. What? I'm struggling mentally, physically. I've never done this before, but I'm reaching out for help. And if you can't help, a prayer will always work. God bless you all. Red flag. Who put her on child support? Who did that? Well, hold on, y'all. I didn't even know this part. I'm sorry. I only saw the video on TikTok as far as her passing. It came up on my For You page because I watch a lot of different types of videos. And then it was just timing, right? I was like, oh, we can talk about it today. But honestly, I didn't know she had this whole child support thing. I found the GoFundMe. I was like, I try not to look at stuff before I review it with you guys because this is insane. Why was she on child support? I'm going to read this. Okay, this is from a law firm. U.S. healthcare crisis. Mother dies after insurance denies life-saving drugs. We knew that they would. We knew it. This reminds me of a movie called, what's it called? In Time? It stars Justin Timberlake and Amanda. Her name starts, the girl in Mean Girls. It starts with an S. And if you didn't have it's instead of money, they use time. So if you didn't have money, if you didn't have time, like your time ran out, then you would pass. Like it's literally similar to this. Like you need a lot of money, and then there were some people who had like loads of time and they were hoarding it. And then all the other people, they didn't have enough time. This is exactly it. Greed. Let's read this together, y'all, because I need to know more about this child support situation. Kierra Campbell was 27 years old, a mother of 7, a fighter battling end-stage heart failure. She didn't lose her life solely to illness. She lost it to an unforgiving bureaucracy that let paperwork outweigh the value of her life. Her heart medication was cut off because of a missed child support hearing that triggered a sanction ending her Medicaid coverage. The IV drugs keeping her alive cost $1,000 a week. Without insurance, Kierra couldn't pay, and without those drugs, her heart couldn't keep beating. So they couldn't keep giving her that temporarily. They couldn't keep giving her that, y'all. Remember, record profits, $500-something billion. She's on Medicaid, funded by the public. They don't have to worry about getting your dollars. Your taxes are going to that. Your as soon as your paycheck, before your paycheck even hits your bank account, taxes are taken out. And yet they couldn't fund this. Interesting. Her last words recorded in a heartbreaking message ring like an alarm bell. It's over for me, y'all. They're stopping my medicine and everything. They set me up for the end stage of my life. 3 months or less is what they gave me. Her final plea shared through a GoFundMe campaign asks for just 3 more weeks of medication. Enough time she hoped to resolve the insurance paperwork and get back to her kids. The time never came. Here's how quickly a life can unravel. Kierra had been hospitalized for over a month with severe heart failure. Okay, they just went about it again. Okay. Let's read this sentence, though. We went through all of this already. Oh, we didn't. Okay, Medicaid was Okay, let's go through this. Actually, this is very important. During that time, she missed a child support hearing. The courts issued a sanction. Medicaid was terminated. The hospital's pharmacy flagged her account. Her IV medication stopped. Within weeks, she was recording her final message. The entire sequence from missed hearing to death sentence took less time than most insurance appeals. She required continuous IV medications like milrinone or dobutamine. Y'all, I can't read that. Drugs that help failing hearts pump blood. These aren't pills you can pick up at a pharmacy. They require specialized infusion pumps and monitoring. For someone with 10% heart function, they're not optional. They're life support. Yup. This isn't just Kierra's story. It's the story of a system that routinely fails the most vulnerable, especially black women, especially poor mothers, especially those already fighting for their lives. Shout out to the law offices of Stevenson, Acquisto, and Coleman. Thank you for this article. When healthcare becomes a luxury. Kierra's case is shocking but not unique. Across the U.S., people are dying because they cannot afford their medications. A missed deadline, a rejected form, a bureaucratic delay, any of those or any of these can strip someone of their lifeline. The connection between child support and Medicaid varies by state, but many states, remember we learned that, can suspend benefits for non-compliance with court orders. This is new information I did not know. Missing a hearing, even while hospitalized, can trigger automatic sanctions. It's a system that punishes poverty with more poverty, and in Kierra's case, with death. Okay, so now they get into Cole Schmidnick, a 22-year-old from Wisconsin. He died of severe asthma attack after his corticosteroid, y'all, I don't know these medical terms, inhaler, a medicine he had used for years, jumped from $66 to over $500. Red flag! Why does an inhaler cost $500 if it's medically necessary? How? The insurer changes formulary without notifying him or offering affordable alternatives. Cole left the pharmacy empty-handed. 5 days later, he was gone. There's more, y'all. My goodness. Consider Nataline Sarkissian, y'all. The last names. I'm sorry if I butchered it. A 17-year-old with leukemia. 17, y'all. She was denied a liver transplant by Cigna because it was deemed experimental. Even if it's experimental, it might save a life. What is the problem? I still don't understand that. Well, I don't morally understand it, but I understand it when it comes to a financial perspective. Of course, they're not going to waste money. That's all that is. After public outrage, the insurer reversed course, but too late. Nataline died hours after approval. This is sad, y'all. 17. And they only changed their mind because people drugged their asses. These stories share a haunting thread. Lives hanging in the balance, pushed over the edge by price tags and policies. Who is most at risk? This is very important, y'all. Whew. Oh, man. Oh, I don't cover stories like these all the time, but it's very much necessary. According to the Kaiser Family Foundation, Medicaid is a critical safety net for nearly 94 million Americans. And remember, I said that if you lose your job and you had employer health care, which is supposed to be the best health care, the private one, and you find yourself in Medicaid, you're going to have to start making some lifestyle changes. Please, y'all, start making some lifestyle changes. I'm not saying that it's going to 100% guarantee you. Absolutely not. There's always a risk, but your risk decreases the healthier you are. I'll be honest with you. Yet it is a system plagued by red tape and administrative burdens for low-income people, especially single mothers. So remember yesterday's video when they were telling you have a baby and then you could think about marriage later? Here you go. Here you go. This woman was put on child support sanctions. We're going to get into that. I have to check what that child support sanction was for. I hope it's public record. Who would do that to her? Even a minor disruption can be fatal. And the data is even more alarming for black women. Here we go. If you look like me and you identify as a black woman, wake up, pay attention. Black women are 3 to 4 times more likely to die from pregnancy-related causes than white women. We talking about that today. They are less likely to be believed by healthcare providers when they report pain or symptoms. This law firm even had the references here. Shout out to that law firm, by the way. They are overrepresented in low-wage, uninsured, or underinsured jobs, which often lack paid time off for court hearings or medical appointments. Red flag. This is why you need to be careful in life as a woman if you look like me. As a woman, period. But especially if you look like me. The odds are not for us. Every decision you make is important. Education, where you work, everything. What you do with your time, what you do with your money. Don't think that it has no effect on the future. Y'all heard sis. She was smoking, drinking, hanging out with her friends, having fun. Little did she know that that would contribute to her failure years later. Her heart failure. Because again, we're not prepared. You can have fun. No one's saying don't have fun, don't do stuff. But again, there's a balance that we lack. No forward thinking. It's always temporary. We only think about now, not think about the future. This is unacceptable. But again, it's the system and what was set up and what's been designed. And we have to work within those parameters. Not only that, but we have to outmaneuver and we have to find a workaround. Because those barriers they're getting worse. Worse, not better. So how can you protect yourself? This is where the advice comes in. 1, recognize red flags. We already go through those patterns. Watch the case studies when you have a chance. Not just my channel. There are other intelligent, educated women all over social media who are giving similar, even better advice. Get your money up as much as you can. Stop spending on things that don't matter. Or also, when I say don't matter, I don't mean stop spending. You can spend money. But be wise with your choices. That's number 1. Number 2, stop lending money to people who don't pay you back. Stop doing that. And also stop procreating with these men who are not going to step up to the plate if something does happen to you. You shouldn't be concerned about that. If something does happen to you, you should be confident that your child is going to receive the best care with their father. This is why it's important to choose wisely. You don't know your future. You cannot foresee it. This is why. Poor sis. This is sad. In Kierra's case, a missed child support hearing triggered a sanction that cut off her insurance. The irony is cruel. The same system holding her accountable as a parent left her child or children motherless. What happened? I need to know that. Even short-term lapses in coverage can have catastrophic outcomes. A study published in Health Affairs found that people who lost Medicaid for just 1 month were significantly more likely to skip needed care, be hospitalized, or suffer health declines. That makes sense. It makes sense. It makes sense because you're trying to catch up. Also stress. You're not getting the proper health. You're not eating properly because you can't afford to. Nutritious meals are listen, it's more expensive. That is true because some people try to make it seem like, oh no, like, you could just get an apple, stuff like that. Meat is expensive. Grains maybe not as expensive. But you really have to start budgeting. If you find yourself in that situation, stop eating the sugary foods. And trust me, I'm taking my own advice too, y'all. I had a bad snack addiction. I was addicted to snacks, y'all. I had to cut that junk right off. I had to just cut it. because it was unhealthy. I was eating snacks all the time. I don't like to eat fast food all the time. I'm actually pretty good with that. But you know what my problem was? Eating snacks. Ooh, I love them snacks. Chips was my snack of preference. They were my snack. Cheetos, my favorite. The little popcorn, the cheesy ones. I used to eat them all the time. If you watch prior vlogs, you would always see me sometimes with chips in the house. That's what I would do. Just eat chips. But guess what? It wasn't helping me at all. And I realized I had an addiction and I had to cut it. But at least I lived to tell the tale. What if something bad happened to me because of those addictions, right? And what I was putting my body through. This is very sad, y'all. It is not that easy to eat healthy and to work out. It takes money to maintain. This is why all of these conversations are important. This phenomenon is called churn, the cycle of gaining, losing, and regaining Medicaid coverage, often caused by administrative snafus like income verification or missed notices. Yes, churn disproportionately affects people with chronic conditions. Yes, because after a few months, they ask you, like, they keep asking you questions like, do you still need it? Do you not need it? Like, I know that they always have to follow up with you when you're getting that type of health care. Kierra had been hospitalized for over a month at the Christ Hospital in Cincinnati. Her heart function had dropped to just 10%. She couldn't be discharged without her medication, but with her insurance canceled, the hospital couldn't keep supplying the 1,000-week drugs. Why couldn't they? Remember, we learned that the hospitals were making the most profit. They could have, they just didn't want to. Red flag, they didn't want to. They have the money, y'all. Don't be fooled. They have the money. They have it. They have it. They just don't want to do it. The system halted her care mid-crisis, effectively sentencing her to death. Hospitals have patient assistance programs, but they're often limited to short-term help or require lengthy applications. The Christ Hospital, like many facilities, was caught between providing uncompensated care indefinitely or discharging a patient to certain death. The real failure isn't the hospitals. It's a system that forces such choices. It's still, no, hospital has the money. This one I disagree with. We saw it in the news report. They have it. They have it. Everything is a failure. A healthcare system built to exclude. Dang, who wrote this article? Hold up. Shout out to you. Joy Stevenson Laws, managing partner. Shout out to you, whoever you are. Thank you. This is a really well-written article. I have to give you your props for this one. And they go, what? They even go to different countries. Let's keep reading. Let me check my mic. Okay. Hold on. Let me drink a little bit of water because my throat's getting a little dry. All right, let's get back to it. Even short-term lapses in coverage can have catastrophic outcomes. A study. Oh, wait. We read this one. Let's keep going. Here, a healthcare system built to exclude. In the U.S., access to healthcare is often tied to employment, marital status, or legal compliance. What it said, repeat. Rewind. In the U.S. of A, access to healthcare is often tied to employment, marital status. Oh, I thought marriage was just a piece of paper. Ain't that what they told you? We saw them videos yesterday. It's just a piece of paper. It doesn't mean anything. Or legal compliance. Those three things. In Sis's case, unfortunately, two of those, it hit her hard, y'all. This design systematically disadvantages people already in crisis. Miss a court case, lose your insurance, lose your insurance. Okay, miss a court case, lose your insurance. Lose your insurance, lose your meds. Lose your meds, lose your life. This should be a tagline somewhere. Compare this to other high-income countries with universal healthcare systems. In other developed nations, Kierra's story would be impossible. Let's get to the UK. But UK also has problems. We're going to get into that, and like Canada does too. But at least we have the access. You're just going to wait a while for it. UK, The NHS provides all essential medications free at point of care for those with chronic conditions. That's true. Canada, provincial health plans cover life-sustaining medications with additional support for low-income patients. That is true as well. We do have that. That is true. We have the pharma drug care plan, especially in BC, and that's because of, again, people in the background, such as myself, my fellow colleagues, who worked so hard to implement this. This is why it's important to have representation. Our government is becoming more diverse for this reason. Because of this. Because we have people in the background that are understanding that, hey, this needs to be equitable. We need to start checking communities. We need to do our research. This is why this is happening now. In some countries, I can't say that for the US of A. Unfortunately, you guys are in a really bad place right now. I will say that. Growing up, and when I grew up in America, when I was in the States, I can't say it wasn't bad, but it wasn't this bad. It's gotten worse. It's like every 10 years it gets worse and worse. It's like it doesn't improve, and this is very, very tragic. Germany, mandatory health insurance covers all critical treatments with minimal co-pays capped at 2% of annual income. Yeah, because it's getting better. Your healthcare system should improve, not regress. France. If you live in France, this is amazing. 100% coverage for long-term illnesses, including heart failure. So she should have gone to another country. Unfortunately, she was just born in the wrong one. These aren't perfect systems. That's true. But they share a principle. No one dies because they can't afford medication. All right. So then they talk about her GoFundMe. Kierra's last hope was not her doctor or her hospital or her elected officials. It was GoFundMe. Her campaign asked for $3,000, 3 weeks of medication. The heartbreaking reality is that medical expenses have become the largest category for GoFundMe campaigns. I didn't even know that. It's the digital equivalent of passing the hat. And this is the thing, though. She couldn't afford $3,000. There's no emergency fund. Nothing. And the fact that she had to do a GoFundMe just lets me know that I don't think she had life insurance or any of that stuff. There is no provision. I can already tell. I don't want to make that assumption, but I can say that based on the information I see here. I'm just going by the evidence here. Maybe she did, but I doubt it. She didn't have the financial cushion at all. But relying on crowdfunding to save lives is dangerous. Yes, absolutely. And inequitable. Absolutely. Success depends on visibility, social media reach, and the public's willingness to be moved by your story. Kierra shouldn't have had to tell the world she was dying just to get a shot at surviving. I agree. This is why I say prevention. We have to... 5 P's, y'all. Proper planning prevents poor performance. Every time. We need to plan properly, y'all. For the rainy days such as these. The tragic loss of Kierra Campbell demands more than mourning. It calls for systemic change. Here are actionable steps to prevent another needless death. Okay, so then they go down here for things that we need to do. This is more of... Let me see. Maybe I should read it. This is for states, pharmacies, individuals. Yeah, this is more for government, like what they should do and how they should pass legislation. Patient advocacy, yeah. Kierra tried, she fought. She didn't ask for pity, she asked for time. For 3 more weeks. For a chance to live. Her children now live with the permanent silence of a mother who should be there, or who should still be there. Her death is a policy failure, a moral failure, and a national failure. But it doesn't have to be the last one. When we say her name, Kierra Campbell, we commit not just to remember her, but to change the system that abandoned her. 7 children, one question, what now? Okay, we're going to figure out what happened to them kids. What happened to those beautiful children? Kierra's 7 children, the very ones that the child support system claimed to protect, are now motherless. They've joined the ranks of children orphaned not by accident or crime, but by policy. Extended family, already stretched thin, must now fill the gap. The system that demanded their mother appear in court while dying has no mechanism to restore what it took from them. Okay, so this was it, y'all. This is a very, very informative article. Thank you very much. I need to find out what happened with the child support, though. This is what's why do I keep doing that? This is what's not sitting well with me. Hold on, child support. This is not sitting well with me, y'all. What happened to her? Alright, they didn't go into her child support case. Alright, y'all. I'm gonna read a few comments and then we're gonna get to the... I got a lot of videos. What time is it? 4 o'clock. Okay, I still have 3 hours left. I'm not gonna stay too long today. I'm gonna stay till 6. My time. So... There's nothing about the child support. Why was she in child support court? This is tragic, y'all. Who put her in child support court? For what? Like, I really don't get it. Alright. Okay. That's it. There's no child support information. Let me see if they had the honoring her memory. Maybe that's going to have information. Very sad. Okay, they just wanted donations. Yeah, she really loved her sister, though. She always talked about... those both videos, she talked about her kids and her sister. All right. So now these are the responses. Oh! Okay, we're going to get an update on them kids. All right, let's watch this one, y'all. Okay, here we go. So this video does have an update. All right.
That was so sad. And
oh, yeah, I did see the highlight. I'm glad I chose this video, y'all.
Sad.
I'm glad I chose this one.
It just breaks my heart, right? But the family, her family, will be taking up responsibility for the children. And the other 3 will be with their father.
Wait, what? Let's go back.
Her family, it just breaks my heart, right? But the family, her family, will be taking up responsibility for the children. And the other 3 will be with their father. So, yes.
I can't even give a red flag to this because I don't know the background. So that's why I'm not going to give a red flag. But I'm wondering, are they all by the same father? It didn't say she was married. And he's taking 3. But the rest are going to be with her family. Okay. So, I'm assuming either those 3 were his kids, or he couldn't take care of all of them because he can't afford it. And that's a red flag. Why are you having kids you can't afford? This is what I'm talking about. Well, we just gonna figure it out. This is what happens. So when the unthinkable happens, then everyone's scrambling. The village, thankfully, village came through, but unfortunately, the kids are going to be separated.
The children are going to be separated, guys. Hopefully, the family that has her 4 kids and the father of her last 3 kids, they keep...
So they are different fathers. Okay. Where the other kids' fathers? Again, patterns, programming. This is why that video was disturbing yesterday. So I'm like, yeah, you can have the kids first and then worry about marriage later. This is unfortunately the worst case scenario.
Relationships so those kids can always be in each other's lives. Let's just pray for that, guys. Because that's just sad that the kids will have to be separated.
Very sad. All right, so it looks like I think the child support was not with the guy in the picture. It was probably with the previous father. That's what my assumption is. All right, one more, y'all, and then we gonna move on. This was very sad. I'm so sad, y'all. This is very sad. She didn't deserve that.
Big and beautiful bill put out. I just want to address a story that.
All right, let's go back. Hold on.
With this big and beautiful bill put out, I just want to address a story that is going to probably happen to 1 million of different people by the end of this year. This is 27-year-old Kierra Campbell. She was a mom of 7 and a victim of the healthcare system that truly had failed her. Kierra had end-stage heart failure, and her medication, that was heart medication, her life depended on, and it was cut off because of insurance issues. She went public about the experiences that she was facing and asked for donations so that she could survive a little bit longer for her kids. Many Black women suffer these same health outcomes in America, and she's a tragic example of why. Now her 7 children are left without a mother. We shouldn't have to rely on GoFundMes to help us survive, because health care should be a right and not a privilege. But rest in peace to Miss Kierra Campbell, and I'll give condolences to her children.
Yep, it should be a right and not a privilege. I agree with you. All right, I'm going to read a few more comments, y'all. Okay, we're going to read a few more comments. I might not have time to go through all the videos, so I'm going to breeze through the ones that I believe are the most important ones. Sorry, I'm just going through everything. Okay. All right. Yeah, I'm not going through everything, y'all. It would be impossible with the time we have. But I'm going to make sure that this episode, like all of the themes, remain aligned and connected. Let me read a few more comments. Jacqueline Johnson. Hey, sis. How are you? Oh, thank you. Hey, Strawberry Fraser. Hey, sis. Thank you for the membership. I'm sorry if my energy is low right now. I'm just sad, y'all. This is very sad. It's very sad. Is it real? I know someone's father who did that and lied on the website. No, this one is real. It's real. She was in the hospital. It's very much real. Yeah. It's sad, too. Yep, Rosa, she did. She had baby daddy culture. That's what I'm saying. She was taking care of the kids, but need to pay child support. Crazy. I think it's the first. Yeah, I think the first father is not the second one. I think she had the second one was in the picture. I believe the second baby's father was in the picture that she showed, or they showed. And then the first one was taking her to court for child support for exactly kids she was taking care of. This is insanity. But then again, like when you have vindictive people out there, they don't care. They really don't care. This one's a long one. I'm not going to go through everything, but let's hear a few stories about the healthcare in the UK, because this is going to tie into the story we have to review. I want to review this one too. Mortgage. Let's do this one another time. We're going to do that one another time. This one I won't do today. A lot of provinces, they're starting to attract doctors from the U.S. Canada's brain gain, recruiting U.S. healthcare workers fired by Doge. This one's very important, so I'm going to watch this one too. We're going to continue part 2 of this one because, again, this is the conversation that the conversation we had yesterday that has led to all of these videos today. This one we won't go over today. This one we won't go over today. This one we will. And then this one, no. Okay, there we go. Sorry, I had to cut a lot of videos to make sure. AI. Did I put that on the thumbnail? Okay, if I did, we're going to go through this one. This one will be towards the end. Here we go. Okay. Sorry, y'all. I have to always filter to make sure. Here we go. Okay. All right, so this one is 23 minutes. America's healthcare crisis. This was 7 months ago, y'all. Let's keep watching. Watching and learning. So we're going to go to America. And then I'm going to still stay to America and finish America. So here, this is America. Canada, we're going to go to Canada after. Then the UK. And then we're going to finish watching this video. And then we'll have the 2 videos after. The palate cleanse. You know, I like to do nice palate cleanse. And give you guys advice and stuff. This is going to be... The last 2 are going to be more positive. Show you how to make money. Stuff like that. Like little tips from people. Again, I haven't watched those videos. So hopefully those tips are great. All right. Let's continue on. This one is 23 minutes. Okay, we still have a bit of time. I just have to control it properly. All right. Let's watch this one. And by the way, shout out to the organizations that are covering these type of stories. Thank you. Thank you. I really mean it. I appreciate it because not only is it giving me an indication of what's really happening, but sometimes it's good to... It's not good, but you have to see these type of situations. Yeah. This is making me think a lot about different things right now. So, this is important. An estimated 48 million caregivers in the U.S. are unpaid for their caretaking. Yeah, because they're using family now. The number of caregivers in the country is only expected to grow according to the AARP. Yes, because remember, we have an aging population, especially boomers. Who's going to take care of them? Family members, friends, the village. They're not going to. They don't even want to cover you. Yeah, you see? More than 60% of family caregivers are working while caring for loved ones. Caregivers are fighting for more resources and support from the government. Here you go, y'all.
Yeah. Alexa, play Travis Green. Wake up. Time to get up. Ready to get up? Gertrude is my mother. She just recently turned 80 years old. Time to get up. She is a former educator and a woman who is just a firecracker. Come on. Good job. Good job. Yes. Ready? 1. She loves people. She loves giving back. She's so generous. I'll never forget saying, I want to be just like her. Good morning to you. Good morning, dear Gertrude. She was diagnosed with Alzheimer's with behavioral disturbances in September of 2014. We noticed that she was forgetting things. Good job. Come on, 5. It kind of shakes you. I've seen my mother change. I don't know who she is. Oh, she's exhibiting various behaviors, like she's biting her hands. She paces back and forth. Yeah. Okay. It's okay, Mom. She's doing this sound saying, ee, 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 ee. You wearing yourself out? Are you wearing yourself out? Becoming a caregiver has been hard. I am naturally a go-getter. Like, there's no stopping me. Hey, you so sweet. You so sweet too, girl. Caregiving has shifted things in me. We're going upstairs. Oh, we going upstairs? Yes, we're going to eat because it's not really hitting everyone's home or you don't see it. People really don't understand the magnitude. We need to dismantle the system in order to prepare for what's coming.
Y'all, caring for aging parents is not for the weak. It's going to take a lot of money, time, resources, and that's another thing you have to worry about too. This is all a ripple effect.
There's so many subtle issues with Parkinson's. Just take it real slow. You learn the hard way when she started having more balance problems. Boom, boom. We're just gonna have you sit on it, okay? It was such a wake up for me was when she came to this point of needing to be cared for. Okay, so what are we feeling like today?
I'm wondering.
2 years.
I'm wondering if it's because they cannot afford to give them care and have a caregiver come in. That's what I'm thinking. But I'm gonna wait for them to go to that part. But that's my speculation. Because there's no way you can take care of your parents like that. It's really hard. Usually you need a professional to do that. But even then, you have to find a qualified one and one that will actually treat your parents, because there's a lot of elderly abuse as well. That's another topic for another day. But I'm wondering if it's because they cannot afford a caregiver, or there's just not any good ones out there. That's what I'm thinking. Like, what is the care? They can't put them in a facility where they have... And not all... Let me tell y'all, not all assisted living facilities are bad, y'all. There are some luxury ones... even down the street from not where I live, but like further down near downtown, they're building nice state-of-the-art ones. You get your meals sent to you all the time. The one Wendy Williams is at is pretty cush. But again, you need the money, right? If you go to the publicly funded assisted living facilities, this is where you're going to have a problem. But if you go to the private ones, they're usually pretty nice and swanky. So I'm trying to figure out, like, what's the issue? And there must definitely be a financial issue. Okay, I'm going to keep playing it, and let's see if we can find out.
It's probably all together to kind of accept that this was going to be a full-time thing and a complete reroute of what I've been thinking my life was going to be. So, one more, a little casual. You got your little animals.
I like casual.
The casual. Get your hearts.
Love hearts.
And you do just find your life on this kind of pause. It was very difficult for me, like watching like all the people I came up with start to succeed and start to have families and get married and have kids. And then you just realize, no, there's so many people like us who just, they're not posting because they're embarrassed like we were. Boom. All right, I'm gonna let you get changed.
There are 48 million family caregivers who are unpaid. And if you did have to pay them, it would be $600 billion. It's more than all of out-of-pocket spending in the United States on health care.
Charlie, you're making a debut.
More than 60% of family caregivers are also working. It is mainly women. It's 60% women, but 40% men.
60% women, y'all. 60% women. 60%. Add that to the list. 60%.
About 30% of them take care of both their children and their parents or another older person.
Yep. So children, parents, or another older person. This is reality, y'all. This is reality. I know one cousin who's currently going through that. This is reality. Very much so.
And the family.
Say hello.
Hello.
How are you?
How are you?
Tell them your name.
Gertrude Joy.
Good job.
Yes.
Mommy, look at me.
Yes.
Listen to my voice. Tell them.
I like how she talks to her mother. I love it. She's so patient.
Say my birthday.
My baby.
Say birthday.
Sir.
Yes, good job. Say was yesterday.
Oh, it was?
Mommy. It's been a journey. A long journey. This is her 10th year. So many phases. In 2014, she got lost one day coming home, and where she lived is a small community. She pulled on the side of the road and someone happened to pull behind her. They were like, hey, you okay? And she was like, I don't know my way home. But she just broke down crying. I was like, Mommy, I'm going to do everything I can. We're going to beat this.
Mommy, you hungry?
So I really like this story. I don't like the condition that her mom is in, but what I'm saying is she's able to take care of her mother, and it looks like her husband is very supportive. If that's her husband. It seems like it's her husband. I don't think it's her brother. If that is her husband, he seems very supportive as well.
Hey.
How you doing?
I'm fantastic. How are you? I feel the same way.
Lord, thank you for this food we're about to receive. Let it nourish our mind, body, spirit, and soul. Amen.
Amen.
Open. The memories are always...
Yeah, I believe that's her husband and her children. So they are able to take care of her mother. And that's because she married, well, from what it looks like, he looks like he's solid. They're able to. She made the right decision. That's what it looks like. I don't know about their family. I don't know. I'd have to do a whole segment, a case study. But from what I could see here, mama looks well taken care of. Kids look well fed, well taken care of, and there's a husband right there. Green flag.
It's changing because she's always changing. Hold your spoon. Yeah. Okay.
Oh, baby, don't do it.
All right. You can't eat my hand. There's nothing that comes from resources or government help. Everything is from Mommy's Social Security and her pension. They keep saying my mom makes too much money and it's not enough. So we're getting nothing. Like just recently, my mom's balance was $3.14. We need the money. We need programs. We need the resources. I can make a way because I'm resourceful. Everybody can't do that.
Yeah.
My family is going to eat because I'm going to do what I need to do. Everybody can't do that. It does something to you because it's just like, that's your mom, the woman that birthed you. You're getting dressed. Where is he? He's right here. Look, that's him. My husband does an amazing job at taking care of Mommy. Like, he gets her up in the morning. He makes sure that he's taking her up and down the stairs. I don't want to throw the men to the side, but I just think it's the woman may think it's her job. And she feels like she's, the best for the job.
Yes, sir.
Men absolutely have the same capacity to care as women do, but I have just had to notice how, we are socialized.
So her husband's taking care of her mother? That's what I heard. But you know what? In this situation, I'm going to allow it. She's probably the higher income earner. I don't know their financial situation. And also, he's taking really good care of her because she looks really good. So that just lets me know that they're doing a good job.
It's different.
With what they have, the resources they do have.
Care in different ways.
He is too. He's doing a great job with his mama.
Look at a little video. This is our triumphant first walk home from physical therapy. When she broke her femur, and it was close to the artery, and it's like it could have been lights out. How you feeling? Okay. That was then okay, she needs everyday caregiving, and it needs to be hands-on, and I need to be always accessible. I think a lot of people get to these points where there's an illness or something that comes earlier than you'd expect. And you realize how many systems actually aren't in place.
This is why you gotta plan for everything. Everything. Build emergency funds. Start getting your stuff in order. Start it, y'all. Start doing all of that. You don't know what's gonna hit the pipeline, and even for yourself too. You don't know where you're gonna find yourself. It's better to start earlier than later. If you can. I understand some of you cannot. I get it. But you can still put some, little $5 to the side. Every paycheck, put a little $10 to the side. You have no idea how that can build up. You can put some money to the side. Each paycheck, if you're working. If you're not working, if you're a student, you're going to have to assess your needs and everything. But if you have some money to put aside, you can start small and build up from there. The point is just starting.
Coming a little bit forward. The doctor.
And I'm not a financial advisor. I got to put that out there, YouTube. I'm not a financial advisor. I'm just talking from my experience.
written her prescription to get a home health aid back in 2017, but then insurance denied it.
Bound her feet into the ground.
And that's when we were in Michigan. And it's the thing where every state is different. So once we were here in Illinois, they do have like an expanded Medicaid.
So he had to move to get the expanded Medicaid. Yep, Michigan didn't have it. Not surprised.
She qualified for like 19 hours of a home health aid. I do get paid for the 19 hours a week. It's been great that I can get paid for, a fraction of the hours I work for her.
Every state actually offers some type of paying family caregivers. That varies by state. It may not cover a spouse. There's all different rules. It's often under the state and federal program known as Medicaid.
It's not quite minimum wage. I mean, it would be life-changing if we could get an aid and then I could have those hours back to be working on freelancing in my own career.
And then you'll pass it to your mom, and she'll explore.
It's very expensive to hire somebody to be at home, but far less expensive than a nursing home.
Come on.
That's
Mommy
true.
Has Social Security. Mommy has a pension as a retired teacher, and unfortunately, it is not enough. Care is over $6,000 a month.
Yeah, because of inflation and everything is going up. The cost of living, cost of food, cost of mortgage, cost of housing, cars, everything. Everything. So that pension that sis had is not going to cover much because unfortunately inflation keeps rising. That's why. She should be comfortable. And I'm sure when she was a teacher, she was told, hey, put your money aside to the pension. You have a pension. It's going to be there. Like, you're good. You're secured. And remember, she has Alzheimer's. So she probably was planning for the worst case scenario. She had a good job. And yet, here we are. It's still not enough sometimes. But I don't know Mama's situation, so I can't assess anything. But it's very sad. But at least her daughter can pick up the slack.
And Mommy is not bringing that in. Mommy's care last year was $90,000. She only made $66,000.
There you go. It's outpacing everything. This is a concern that we got to really start talking about. If you have aging parents, this is something that you need to start thinking about. If you're young, you have a head start. Start thinking about that. They got to start thinking about it too. You shouldn't be the only one responsible for that. But at the same time, it's like, this is something that I also have to think about too. Yeah. Her income is not going to sustain the care she needs. You see, her pension was only if the best case scenario happened. If she didn't have Alzheimer's and she just retired like a normal, regular person, no health issues, she would have been fine. But unfortunately, Alzheimer's found her. This is why it's not going to work for her and her family. And Alzheimer's is linked to, cognitive things. So there's many different factors. We could talk about that later. But it's very sad. She didn't foresee that she would get Alzheimer's. I can guarantee you that.
She doesn't have it. Her savings are depleted.
Yeah.
Memory care communities out here are $12,000 a month.
If we do not help family caregivers, if they can no longer do what they're doing, then we're going to have a huge cost problem.
We're having to lean in and give money for care, and we just had to recently release a caregiver. QRSST. I can't.
Okay, so her husband must be working. I think they had a caregiver, and then now they're doing the temporary caregiving because, I don't know, I guess I'm assuming it's because it's unaffordable. That's what I'm assuming.
Not work a full-time job.
Oh, let me close my... Oh, wait, let me go back. I'm going to listen to this part. I got to close my window. It's very cold in here. All right. I'm going to close my window. Let's play this part, and then I'll stop it.
Huge cost problem.
We're having to lean in and give money for care, and we just had to recently release a caregiver. QRSST. I cannot work a full-time job. My husband cannot work a full-time job because caregiving is always at the forefront.
So how are they making it with part-time jobs? This is very unsustainable. And they have I think I saw 3 kids at the table. It's unsustainable. And then those kids look like they're young. So I don't think they're in college. So who's going to pay for their college education? This is not going to work, sis. This is a short-term solution. Just based off of what I'm seeing here. So you're both working 2 part-time jobs or maybe odd hours to make income for your family. But your kids are going to suffer for that because eventually they got to go to college. I'm assuming. This is very unsustainable.
There is definitely a care crisis in America right now. We have 48 million caregivers in the United States who did not expect to be caregivers by and large.
48 million. 48 million. That is more than the population of Canada. Canada's population is 40 million. 41 million. I know United States population is like 300 million. I understand that. But that's the population of a country. The whole country of Canada. Actually, more than that. These are the people that are providing home caregiving for their family members. That's a perspective, y'all. Yeah, 340 million. Your healthcare, people who are providing healthcare for their families is more than the population of Canada.
And half of them actually say they had no choice.
President Donald Trump continuing his overhaul of the federal government. The White House put in place a sweeping freeze on potentially billions of dollars, the broad directive immediately prompting confusion.
It's not clear what programs could be cut.
Many states reported they could not access the Medicaid portal,
which provides health insurance for 72 million low-income Americans.
Trump, he had one rally where for like a minute he said like, we'll do a tax break for caregivers, a tax credit.
And I'm announcing a new policy today that I will support a tax credit for family caregivers who take care of a parent or a loved one. It's about time that they were recognized, right?
And it's that thing where like anybody who's a caregiver knows that like so many caregivers have stopped working.
Wheels on wheels.
Or there are older people who can't work. This tax credit is going to do nothing for them. I worry that we are going to be back in a place now where people are having to fight even just to like protect them being there at all.
With any new administration that's coming in, Americans are always afraid. So I am praying that the Trump administration will see caregivers and will hear our voices and understand that we do need the resources and support. I'm here with the National Alliance for Caregiving.
You're the influencer?
I guess. The main point is to pass the Older Americans Act and how it would be important for caregivers, especially myself, to be able to benefit from the bill. So often we hear we are the unseen heroes, but heroes need to take off their capes too. If you look at the fast scale for Alzheimer's or for dementia, she's slowly moving into the final stage, which is stage 7. That's why we call dementia the long goodbye. There's no way that I can remember the former self. And I know that may sound crazy, but I don't remember my mom at, 10.
It's okay.
I don't remember my mom at 23.
It's okay.
I don't remember my mom at 30.
It's very sad, y'all. My grandfather passed away from dementia, y'all, and one of my uncles has it. So this definitely hits close to home. I'll say that.
So much has happened in the 10 years, and she's a totally different person. Like people say, "Can you show us pictures of your mom?" Before, and I look at her and I'm like, "Who is she?" Point to your head. Where's Gertrude's head? Right here. I've had people come up to me and say, "You saved my life." I can do this because I see you. Happy birthday! Dementia is more than your loved one losing their memory. It's about them losing access to life. And for people to come on the page and find community and see that they're not alone. Listen to my voice. It's quiet time. It's quiet time. It's quiet time. Quiet time. Quiet time. Here it is.
This is a lot of work, y'all. It's a lot. She's doing a lot.
That's it, baby.
I ain't gonna let it end.
Daughter has a beautiful voice.
I steal my joy away. I ain't gonna let it win.
I remember when I first started this journey and I first started Mommy's Page, you didn't see caregivers doing what we're doing now.
Hey y'all, what's up? Oh, you already laughing. Hey.
Thank goodness she has social media, y'all. Social media is a lifesaver, especially for a lot of people, working class people such as myself. It's a good way to make extra money. I would highly recommend you guys tap into that. Like I said yesterday, responsibly, but this is a good way to make extra money and to care for her mother. All the views, especially if she's monetized, this is going to help her out a lot.
Mommy is so tired. You notice, like, with the progression of Alzheimer's, she's getting more and more tired now.
You didn't see your loved ones being put on, display, if you will. And all you had were support groups. And those were filled with gloom and doom and death. And I was just like, I can't live like this.
Yes, Mommy. You looking cute.
You feeling good, right? When you look good, you feel good, you just want to dance, right? I know the feeling.
Yeah, all what you talking about. I want people to know that they can find joy in the journey. That's my whole mission, finding joy in the journey. And so while it is hard, I want to show people that it's hard, but it's doable. It's hard, but it's beautiful. Come here, let me see, stand up straight, look up at me. Let me see.
You're doing a great job, by the way, sis. I'm proud of you.
Go, Gertrude. Go, Gertrude. That's my Gertrude. My Gertrude, that's my go. Go shake it and shake it. Don't break it. You look
okay,
cute.
go ahead, Gertrude.
Yes,
do your big one, sis.
Oh,
hey.
Yeah. You look cute. Go, my Gertie. My Gertie. Oh. Yay!
I've always wanted to be a writer. Before I'd be writing a book and doing all this research, I just ended up applying that to this.
He likes to tell me I'm not a burden, but I feel like a burden. Because he would have been in a career in New York and finding his own dream. And he sort of edited his dream to be different, because it includes me.
Okay, keep it on the sidewalk. 1, 2, 3, 4. You okay? You okay? Hey.
He writes about Parkinson's.
It does feel like part of a bigger purpose. I've been actually given things to write about. I will always say, like, the best stuff in me comes from her.
He's doing a great job, too. They all are.
She's always my biggest supporter and biggest encourager. I remind her often that Parkinson's is the burden, and it's one we share. Boom. Parkinson's is terrible, and it's really dark, and it's horrible. Boom. You good? Just trying to... This is not the life that we ever would have imagined having. It's the grief of it, and it's the loss, and it's the parent you love.
What I most want is time to notice and savor the spring happenings.
You do realize how precious time is. And I have that.
Okay, this was last year.
I'm here with the National Alliance for Caregiving, not just advocating for mommy, but I'm advocating for so many people that feel like they don't have a voice. Who's going to do the call to action?
What I would suggest.
Oh wait, that's the same lady? Oh, she got braids. Okay. Sorry, I couldn't. I didn't recognize her. I think she got braids. That's why.
Whoever is the constituent,
Yeah, she has braids
tells their
now.
story and leads the conversation.
Last night I was like, okay, I have to memorize it, baby.
No,
I
you don't
cannot
memorize it all.
Oh, and she took off her glasses.
I'm like, baby, I can't memorize because I'm a caregiver with my mom has Alzheimer's.
I know.
You're the influencer? I guess. The main point is to pass the Older Americans Act and how it would be important for caregivers, especially myself, to be able to benefit from the bill. Qualifying for Medicaid, I want it to look the same from state to state. Which way? What number? 1419. America. How are you doing?
Good. I'm Tyler.
Oh, hi, Tyler.
Nice to see you.
Very nice to see you.
Oh, that's why they're there. This was during the Biden administration. It just hit me. You know what? I didn't want to say that, but I was like, what this brother doing there? I didn't want to say it like that. But now it hit me. It's November. Agent Orange didn't take office until January. That's what. Okay, that made sense because I was like, they let her come to the White House, and then he's there. He looks super young.
You think about this bill.
Okay, this makes sense
I'm not
now.
just thinking about it and advocating today for my mom, but for me because I'm caregiving with no job right now. So often we hear we are the unseen heroes.
So basically, she doesn't have a job. Social media is basically helping her. Social media. And let that sink in.
But heroes need to take off their capes too, and we need to be taken care of. This is a bipartisan issue. I have faith.
Yeah, I do too.
This has been an amazing day advocating. I can represent my community and just say, we did it. This is a win as we continue to do the work and put our heads down.
I feel sorry for them. Because I know what's going on in present time. This was 7 months ago. Damn, they were so hopeful too. This is sad, y'all. All of that hard work. All of that hard work. This is sad.
You need your reading glasses. Nope. Okay. Ready?
I was a busy young mother, quickly losing herself, spending most nights wide-eyed with no energy or desire to take advantage of the inability to sleep.
So we were both always writers, and that was a thing that when we become like friends, we kept having that goal that we wanted to kind of pick that little passion back up together.
A chronic illness changes your frame of reference. I went from being a 35-year-old confident, busy mother of three to an overwhelmed, frightened mother of three, distraught voice, living in fear.
With these orders to kind of remove all the DEI, this administration, they added the A to the end of it. It was never there, and it's for accessibility. Our culture, like both physically and like mentally, it's kind of built to keep people like mom and disabled people kind of tucked away out of sight.
So yeah, so you see, everybody was talking about diversity, equity, inclusion. They thought about the blacks. It's the blacks. That's what they were thinking, right? Oh, we need to get rid of the black people. This is what DEI is. But little do people know that DEI affects everything, and that's what he's talking about right now. His mother is disabled. She's a DEI. She is. By gender and by her disability. So it's affecting him.
Out of mind. All that kind of spurred us to do this thing that we had dreamed of a long time ago, of starting kind of an open mic reading series.
So another thing I want to say, I want to add more to what I just said about DEI, is when it starts with that, then it trickles down. So you already know that anything about diversity, equity, and inclusion, they're going to target all policies related to that. That's why he mentioned that. So these people, unfortunately, they didn't get what they wanted. It wasn't passed in time. And it's going to be a long 4 years. We didn't even finish the year yet. This man been in office on February, March, April, May, 9 months, y'all.
So we're happy for you. We're the perfect people to be here. I'm Brandon. This is my sweet mama Janice. For anybody who hasn't met us, we are care partners.
I'm a little nervous. I'm going to lose my voice a little bit. Overnight, it seemed I was having a hard time putting one foot in front of the other. He believes in me. What we're reading today shows that.
One Big Wish by Brandon G. Will, age 7. One day, I was perfect, and that night my fairy godmother visited me and said, "Since you were perfect today, I am giving you one big wish. I wish my mom wouldn't be sick anymore."
Or 2 peas in a pod. And he's still learning from me. Thank you, Brandon.
Thank you, Mama. I want to thank everybody here. I think anybody who is dealing with disability or aging or caregiving knows that, like, willpower only gets you so far. You know, like, you need it. It's crucial. But, you know, you can't really get anywhere without a community.
Brandon is wonderful. It takes a lot of endurance to take care of somebody else.
It does.
Who used to be your mom.
You guys are doing great work.
Whatever magic is happening here, it needs to keep growing.
If you got love in your life, everything becomes worthwhile. I love you, Brandon. We're not alone. And we don't leave this world alone. So we need to leave it better than it was when we came.
Oh, Lord, this is sad.
Get louder. I'm gonna shine, shine, shine. Yes. Shine, shine. Yes.
All right, let's read that. Medicaid provides support for caregivers in every state. However, the extent of that coverage varies depending on where you live. Ty hopes to change this, ensuring the same support is given to caregivers across the country. God bless you, Ty, but I'm sorry. This administration is done. Sadly. Brandon and Janice continue to host open mic readings together. The next is on April 6th. Okay, passed already. While at the Capitol, Ty met with staff members of several congressional leaders. She has not received follow-up calls. Absolutely not. We already know why. We already know why, y'all. Damn. Very sad. Wow. All right, man. Whoo, Lord. So many sad stories. Let me read a few comments here. It is beautiful. Yeah, Ty is doing a great job. Shout out to Ty and all the other caregivers who are helping their parents. That's really, really commendable. Sometimes we got to highlight these stories. Yeah, her mother, I'm afraid too, but I'm gonna keep hope alive, sis. I'm afraid too, Rosa. Sis, the same thing. They don't want to hear that about DI. They rather just ignore the truth. Exactly. That's the wake up call. Jacqueline, you said that's why people in non-third degree countries have many kids, so someone to take care of them. Yeah, but this is the thing. In other countries, the cost of living is a little lower, and then it's just more communal. Thankfully, they have a community of people, but it's just too expensive. That's the problem. The Star That Fell, I didn't know that. And trust me, I know it was probably hard on you to take care of your mom at that time. So I'm proud of you for doing that. It's very difficult. It's very difficult. Yeah. You watch her decline and improve. The family had to step in while you were in college. It was sad to see. It's so sad, y'all. And this happens, you see, a lot of you probably, this has happened to you all. So that's why these type of conversations are important. So you guys know that there's support here always, and I'm not exempt either. I don't know what the cards have in the future, right? We can only hope and pray that our parents are healthy, but more than likely we don't know. We never know. So we have to prepare ourselves. But I'm so happy that you got the support from your family. Shout out to your family for that. But it's still difficult, especially if you're a college student. It's too difficult. It's very hard. Yeah, it's very, very hard. All right. Let's continue. This woman was about to lose her job. This is a 6-minute one. We could watch this real quick.
If you're a lawyer, you can own your practice.
So remember that guy was talking about, we have less than 100 doctors covered. All right, let's see what's going on here.
Baker, you can own the bake store. I'm a surgeon. I own the surgery center.
This is the surgical center that Dr. Elizabeth Potter started a year and a half ago in Austin, Texas, where she does reconstructive surgery for women with breast cancer.
The fact that we have this is so powerful. I have these skills, and when I have an operating room, I can really offer them to people.
You see at $390?
Because if I have the skills and I have the place, why can't I? What's in the way? And lately it's insurance.
In January, Dr. Potter went viral with a video detailing her frustration over an experience with United Healthcare.
It's 2025 and insurance just keeps getting worse.
Now she says she's being punished for speaking out, and it's pushing her practice to the brink.
I'm scared. I spoke out against health insurance, and the insurance company decided that my facility can't be a network. And I built an entire business plan and invested almost $5 million in being able to be a network with insurance.
And mind you, she's actually doing something for women who have breast cancer. The reconstruction. So, when you have breast cancer, you lose your breast. It's very, it affects your self-esteem. And she's helping them build their self-esteem back up, especially after chemo. Your body goes through so much. She's helping them gain confidence, and then look how they repay her. All because she probably expressed herself and said something that's true. But remember that clown that was in the last segment talking about, we got doctors and we look for intervention and all that stuff. And then this is how they're treating her in the background. Red flag. This is horrible.
I feel like crying sometimes.
Potter herself has long been in network with the major insurance companies as a physician and believed it would be easy to get her center in network too.
I am going to pop in and see room 3. I heard insurance companies saying, hey, we want to move these really expensive cases out of the hospital and into ambulatory surgery centers. It saved the healthcare system.
You see? Remember, he was talking about moving people from inpatient to outpatient. That's what she's talking about. And she's like, no, this doesn't make sense. Why would we do that?
Money, and they said, we want to do more of that. And I'm like, I'm over here. I can do that too. I assumed that they would let me do this. Hi, how are you?
But nearly 8 months after her video got millions of views, she says several big insurers have not yet contracted with her, including United Healthcare.
After I posted that, they just went radio silent.
When you found out that they were not going to let you into the network, what impression did that leave you with?
It makes me feel like the only way to succeed or the only way to have safety as a doctor is to play nice, to be polite, not to upset, the powers that be.
Is there a culture of not speaking out about insurance?
Oh gosh, yes. There's a huge problem where you're not allowed to say negative things about insurance companies or you'll get penalized.
A spokesperson for United says the company told Dr. Potter in October of 2024, quote, well before she posted any videos, that it was not accepting new surgery centers like hers into its network.
Okay, we'll be in contact soon. Thank you.
But industry experts we spoke with said that isn't usually the end of the conversation.
So when you enter these negotiations with an insurance company, is it fairly common to hear, no, this network is closed?
Absolutely. The insurance company will say no often. That's just the start of the negotiation.
As the CEO of Payer Health, Armando Cardoso's job is helping doctors like Potter negotiate these contracts. Though he declined to speak to the specifics of her case, his company has been handling her conversations with insurers, including United.
Insurance companies have a a lot of strength and a lot of scale that give them disproportionate leverage.
How much of an impact does it have, if someone is able to get in or out of a network?
It's a huge impact. So if you're not allowed into one of these networks, it's a big chunk of your business that you're not going to be able to access.
Because there's a huge percentage of patients who are going to say, like, this person's not in network, I can't go there because it's too expensive.
Exactly.
United told CNN that after its initial decision, there were no ongoing negotiations.
We don't believe you, United.
We aren't penalizing her for anything.
Please.
The insurance company added it has 33 in-network ambulatory surgical centers in her county, noting clearly in the Austin area, there are sufficient options for our members.
Yeah, but they lost one. Red flag. They would have had one more.
In July, Dr. Potter began to face the financial reality of what it would mean for her facility to not be allowed in-network.
This is all happening because of the doctors speaking up. That week was really hard because I felt things crashing down around me. We were running out of money really bad. We'd emptied our savings. My husband cashed in his 401k so we could make payroll. I sold some things that were important to me.
She took to social media.
I am checking in today, asking for help.
Her fans rallied around her, raising over $700,000.
That's a lot of money.
$20 bills.
Just
random from Oregon. Just say, I believe in you. Like, no, it's crazy.
What does that say to you?
It says that I work for the American people now. That's how it feels. The other night I woke up and I had an email from, I'm gonna cry. Okay. The other night I had an email from a dad whose son has cancer. And he said, thank you for doing what you're doing. And I want you to know that I have to explain to my son why the grown-ups have decided that the medicine that was working so well for him, we're not going to do that one anymore. And I lie to my son and I tell him this new medicine is better. And I know that the old medicine was better, but his insurance company has decided he can't have it anymore.
Red flag. Why? He's paying for it. This is a problem. It's either there's too many sick people and they don't have enough money to cover everybody, or somebody's pocketing the money. I'm gonna go with the latter.
So keep fighting, please.
Dr. Potter continues to post about her interactions with insurance.
Do you know what her risk of lymphedema is? Well, I mean, I think this is part of the issue. If you're my peer, then
they don't care.
You should answer that question.
And has become a vocal advocate for patients.
Thanks for all you do, truly.
The insurance companies are not gonna care, and the people who are paid to give the information, we gotta keep a roof over our heads too. It's a cycle, y'all. It's not that they don't want to give you the information. It's not that, they don't want to cover you, as far as I'm talking about the people working in the insurance company. It's just that you're given the instructions and you follow, as with all jobs.
Oh, I wish I could do it for free.
She's still pursuing conversations with other major insurers. Donations have helped buy her a few extra months, but she says it costs $100,000 a month to stay open.
What would it mean for you to have to give this up?
I just can't let them win. I can't.
Sis, you might have to move. You're part of the brain drain. I'm about to go cover that right now. I think that's the next video. You're part of the brain drain. You might have to move. You might have to. Because if they're not putting you in network and you can no longer practice, or it's too expensive, either you're going to have to, I mean, that's just my opinion. Again, I could be wrong. Y'all let me know in the comments. Either you're going to have to downsize or move. That talent needs to be used elsewhere. And there are a lot of countries that are starving for doctors. We're going to get to the next video.
I can't for me, and I can't for everybody, because that's just not right. I've got months to figure this out, and I just know that we will. I'm here for whatever needs to happen, but I'm not going down behind insurance.
All right, that's how they're. This is what's going on, y'all. Whew, Lord. All right, let's wrap US up in a bow. I'm so sorry that you guys are going through this. I'm really sorry. And again, I didn't mean for this to be like some type of fear-mongering tactic. It's more of like informational and educational, so that whatever you're doing right now, just realize that it does matter, and we need to start making better decisions with the resources we have, money, time, all of that stuff, because it's only going to get trickier from here. How many minutes is it? 2 minutes. All right, perfect. 2 minutes. So this is what's going on in Canada. I can confirm that this is definitely what's been going on. There's a brain gain for us and a brain drain for the US, because a lot of professors, even university professors, they're leaving. A lot of Canadians who were in the United States, they're leaving. They have left and they have returned to Canada. And a lot of US doctors are coming to Canada. So, but the payment model is a little different. However, they are coming. So this can be, I can assess and confirm that this is happening. And this was 5 months ago, so it's probably different now. There are a lot of government who are rolling out programs for U.S. physicians and healthcare workers. Just an FYI to all of you guys.
Crowds of laid-off healthcare workers line up outside federal buildings as promised cuts to jobs and spending take effect.
As part of President Trump's DOGE workforce reduction initiative, we're going to streamline HHS.
But those losses could be Canada's gain, with agencies here seeing a surge of inquiries from doctors thinking of relocating north.
There's no question that US physicians are interested in coming to Canada.
But Canadian authorities need to turn that interest into offers, she says.
And so if you can demonstrate that you're a province where there's less paperwork, where people can seek out research if they're interested, where they will be supported to do the work that they really feel passionate about, that weighs a lot when someone's thinking about where they want to work.
Currently, only BC, Ontario, New Brunswick and Nova Scotia have fast-track pathways for...
They have. Confirmed.
US physicians to migrate and work in Canada without needing additional exams or supervision.
So I just Googled jobs in Toronto, which is where I'm from, and they had job offers and said that Americans were invited. I was, whoa.
Dr. Karen Ginsberg is transferring her American qualifications to work in Ontario starting next year.
The sentiment as a physician here in the United States right now is really, it's been quite depressing. It's not the medicine itself. It's the way our country is going right now and the way medicine has gone, and it's a mess. It's a big mess.
But recruiters warn it'll take some time to settle people.
By the time they get licensed, interview process, I mean, you're talking at least a month to maybe 2 months, and then they have to give notice where they are. So we usually say, you're looking at 3 to 6 months.
And they also have to worry about the cost of living. It's high, especially in Ontario and BC. So, yeah, that's another thing they have to worry about. But they're going to be doctors or physicians, so they should be able to afford it. They will be able to.
For years, Canada has turned to other countries to recruit healthcare workers. Now expect provinces to get louder and more targeted to speak directly to Americans. Georgie Smythe, CBC News, Vancouver.
All right, so y'all heard that. But this is sad because this is a win for Canada, but it's sad because we're going to go through this in another conversation. When you start to see the educated people leave your country, that's not a good sign. That's really not a good sign. That's what happened to Haiti, Venezuela, other countries, Mexico too. When you have people, Nigeria, that's happening right now. A lot of educated Nigerians are leaving Nigeria. And that's why there's a lot of conversations happening where people are like, oh, how come they can't rebuild the country? It's because the top educated people, they flee, they leave. When you have educated people leaving your country, it's a problem. But like I said, I think I said it yesterday, the innovation stops. That's what happened. So unfortunately, it's going to be a loss. I can't even celebrate that because I know the doctors that come up here is going to help build our health system, but then your health system is going to be affected if you're in America, which is the sad part. You're going to lose out on a lot of talented people. A lot. Unfortunately, this is the reality of the brain drain / gain. So this is why a lot of other countries, or this is how America was actually. In the past, a lot of people who came from less developed countries would flee to America. And then they would start businesses, go to school, get an education, become the next workers in tech and other industries. But now they're fleeing, looking for other countries. They may not want to go to their country of origin if they're not American. So then they're going to be like, hey, let's go to Canada. Let's go to another country where we can still keep our lifestyle, but also not have to worry about this political mess that's going on right now. So this is very sad. I can't even celebrate that, y'all. Let's watch a little bit of the UK. Just a little bit. Just a little bit. We're going to do 10 minutes of the UK. Because this is a 54-minute video. It is very long. I can't watch all of it. So 10 minutes. And then we're going to hop into this discussion. Because this is what spurred the conversation. Finish this one. And then I might have time. Actually, let's do this one. Oh, how AI is called. Did I put that on the thumbnail? Hold on, y'all. I got to check my thumbnail. If I put it on the thumbnail, okay, we're going to watch this one. It's only 8 minutes. Okay, we're going to speed through these because of time. And it's Sunday. I don't want to stay too long because I know people got to work tomorrow. So we're going to chop it up. 10 minutes of this.
When the UK population is on the NHS hospital waiting list.
So, what is the point?
So remember, there was that article that said UK had a better health system than America, but UK is still struggling with systemic issues as well. So just had to put that out there. And this is what they're struggling with. Canada too. I already explained to you guys what's going on in Canada.
Having a health service, if it doesn't work.
For the first time ever, there are over 7.5 million people on the list, waiting for routine checkups, including hip and knee operations.
In the United Kingdom, there is only one consultant neurologist per 91,000 people.
Red flag! How is that possible? What is going on in the UK? One for 91,000 people? Did they leave? They must have left the UK. That's what I was talking about, the brain drain. Once your country, the educated people start leaving, you in danger.
After 35 years of working in the NHS, nothing prepared me for the shock I felt when I was told I had a year to wait to see a consultant.
Guys, the UK health system is so far behind compared to other countries, and let me tell you why.
People say the NHS is great and doctor surgeries are good. They're not.
Okay, y'all, hold on. I gotta use the restroom again. Let me go use the restroom, and then I'm gonna let this play while I use the restroom. Just 1 second, okay? I'll be right back.
Really not.
With 300 to 500 people dying every week in the UK because of delays to emergency care.
The NHS waiting lists have got to be a joke, right? Right?
The NHS is hanging by a thread and patients are paying the price, sometimes with their lives. Waiting times are a joke. Doctors are overworked and leaving. People are stuck in endless queues. Ambulances are taking hours and the hospitals bursting at the seams. At this point, healthcare isn't about getting help. It's about hoping you don't need it.
So, I had to call the doctors this morning and I feel like this is just a joke, but it's not. This is just reality in the UK. I was 29th in the queue at 8 a.m. They open at 8 a.m. and I called at 8 a.m. Bang on. Literally, the time went down and I called. So, God knows how I was 29th in the queue. Anyway, it was ridiculous. 8 a.m. I'm feeding the kids. I'm getting them dressed. I'm like dealing with multiple arguments. I've not got time to wait in around 40 minutes for you to answer the phone to then tell me that you've got no appointments left. And I've got a call again tomorrow. Like, is this just the way things are now? Because like I don't have the money for private healthcare. I haven't got that.
1 in 7 people in the UK population is on the NHS hospital waiting list. For the first time ever, there are over 7.5 million people on the list, waiting for routine checkups including hip and knee operations. And over 383,000 people have been waiting on the list for over a year. And obviously a lot of this is down to the impact that the NHS strikes have had. I think a common mistake when discussing the strikes is the idea that the government genuinely cares about the NHS, but behind the scenes,
This was 3 months ago?
that they have been trying to privatise the NHS for many years. Labour's health spokesperson Wes Streeting has said that private firms would be used to reduce the waiting lists. The government is deliberately expanding the role of the private sector market by forcing the NHS to rely on
So UK, you guys have something to worry about. Do you guys have a conservative government again? Hold up. I need to go and check this out. UK, you guys have a prime minister too, like Canada, right? Yeah, you guys do. Okay. Keir Starmer is your prime minister. I should know this, y'all. This is very unfortunate that I don't. All right. What party is he with? All right, that's good news. Canada does too. They recognized Palestine as a state. That's what's up. What's his political affiliation? Okay. Is it? I don't know too much about UK politics. Y'all let me know in the comments. Keir Starmer? Okay, let's put healthcare. Yeah, how does healthcare work in the UK? We need to figure this out. Oh, okay, this is recent. 7 ways Starmer's plan could change the NHS. All right, let's figure this out. People smiling, so that's good. Okay, Sir Keir Starmer has set out his 10-year plan to reform the NHS in England based on a shift from hospitals to neighborhood health hubs. Lord, he doing the outpatient thing that man was talking about. A new focus on prevention and better use of technology. Okay, let's not judge it. It might not be the same as the other man. Health hub sounds a little bit more. It sounds a little bit more innovative. Let's see. He said the government's 162-page. 162 pages. Y'all better be reading that. This is the thing. When governments come out with publications, please start reading them. I feel like you guys don't read them enough. Or maybe if you want me to read them, I'll do it. It might be the last chance to put the health service back on its feet. Here's what the plan could mean in practice. Okay. A doctor in your pocket. All right. More use will be made of the NHS app to book appointments, order prescriptions, and refer patients to local charities and businesses that can offer health support. Oh, okay. I think I understand. Like you'll have your like clinics, health support. Okay, we'll start there. Starmer said that it would be like having a doctor in your pocket providing advice 24 hours a day, 7 days a week. Okay, all right. Your full health record should be available on the app. Yeah, that's true. That's good. We have something similar. I could see my records on my app. Along with the Red Book, which contains a child's health data, including any vaccines they have ever been given. I see a privacy issue with this. This is going to be a security issue, y'all. This has security implications written all over it. Where are my cybersecurity folks? The star that fell. Aren't you in a security? Or maybe it's someone else. To all my cybersecurity folks, y'all going to let me know. This may be your time to shine. I feel like there's a potential for a data breach here. There's too much information on the app. Too much information. It could mean doctors can quickly look up a patient's history online rather than start from scratch with a new consultation or ask for records to be emailed to them. This sounds like, oh no, this is not good. Red flag. This sounds like a data breach waiting to happen. All it takes is one person or one country. Y'all know they got them bots. I'm not going to say which country. All it takes is one very determined hacker to go through this app And your information will be all over the world. This is not good. There has to be a better way. They don't have blockchain for health data or something? This does not sound secure to me. I don't know. Maybe I'm thinking too much. There are concerns people who might not have access to the app or a smartphone, such as the elderly, could be excluded. That's the least of my concerns. They'll figure it out. Their kids will figure it out. They'll find somebody to figure it out. My problem is the data that's on the app. All of your health information on an app is a recipe for disaster. Care on the doorstep. The government is promising to set up around 50 new neighborhoods, 50 centers by the end of this parliament and up to 300 by 2035. When is the end of the parliament? What's his name? Steamer? Oh, Keir Starmer. What did it say? Parliament? End of parliament. Sorry, it's a different system than I'm used to, so I'm learning right now. Wait. Humiliation for Starmer as he loses control of Wait, that was just in July? Wait, when was this written? July 3rd. Okay. I don't know. Y'all let me know in the comments. I don't know. I'm not from the UK. I have no idea what's going on here. Okay, I'm just... Boris Johnson. He's still there? Is this year? Yeah, Boris Johnson is still there. Okay, this was September 13th. Okay, just recently. Okay, you know what? Let's read The Guardian here. I don't know what's going on. What's going on in the UK? I don't know. Every time I see something about the UK, there's always something crazy going on. Keir Starmer warned time running out to repair faltering leadership. Oh, so he's not even going to be there to roll out these 50 neighborhood centers. After a disastrous week, some MPs predict challenge against PM, likely if local and Welsh elections go badly next May. Oh. What time is it in the UK? Do I have some UK watchers here? I know it's too late for y'all. I'm sorry. I should have done this in the morning. 1:15 a.m. Oh, it's too late. Y'all probably gonna talk in the morning. Okay, if you get to this part of the live stream, if you do, please let me know what is happening here. Okay. It looks like they want to pack him up out of here. So you see, that's another thing with government. You guys have to keep in mind that everything's gonna keep changing. Because you don't know when they're going to be packed up out of there. It could be good or bad or worse. All right. So it looks like they're trying to get them up out of here. That's what I'm getting from this. Yeah, you see some people say, okay, Jonathan Reynolds told colleagues he's unhappy to have been moved from business secretary to the backroom role of chief whip, according to the MPs. And earlier this week, Ed Balls, my goodness, the names... Balls. All right. Said on his podcast that his wife Yvette Cooper had found her move from Home Secretary to Foreign Secretary frustrating. Okay, people are upset in his party. Sorry. He's moved all the people who are loyal to him to ministerial or PPS roles. Is that bad? With the end result being that he's now got no one really left in the back benches fighting his corner, and put a load of pissed off ex-ministers there instead. Oh, so he made the wrong move. Basically, he made the wrong decision. Oh, there's a labor conference. Okay, all right. Anyways, let's get back to the healthcare. This plan is not going to be put into fruition. The way this man, they packing him up out of here. I don't know if this plan is going to be taken into effect. Very ambitious, by the way, and I'm not saying that it's a bad plan. But it needs to be executed properly. But the way it's sounding that he won't even be there. And they're going to axe everything. New centers should eventually be open 12 hours a day, 6 days a week. Okay, obesity, they're trying to tackle that. We're not going to go through too much. New alcohol warnings. Yeah, a carcinogen. Stop drinking, y'all. I went to Jamaica, started drink. I remember when I went to Jamaica last year, I drank a lot and then I regretted it. Because I don't really drink. I'm not really a drinker. My body couldn't handle it. It was so bad. And then now I'm like, nope, never again. I'm not drinking like that. Just sporadically, but I'm not drinking overly heavy again like that. Mental health, okay. They're going to have dedicated mental health emergency departments. That's actually really good. But will it happen? Social care, my goodness. All right. We don't know if it's going to happen, y'all. All right, let's finish watching 5 more minutes of this, y'all.
While refusing to commit to long-term workforce planning, new strike dates have been announced for the 24th and 25th of August in response to a 6% pay rise for NHS medics. The British Medical Association has described the below-inflation pay rise as insulting. The tax on NHS workers' pay will drive them away, which will have devastating effects on our health service. And we can see this in the healthcare inequality in countries like the US. Ministers continue to publicly claim their support for the NHS, all the while they are investing in private providers and refusing to take any important action to help secure the future of the NHS.
If I invite 10 people to my Christmas lunch and I spend £100 on it, and the following year I invite 20 people to Christmas lunch and I spend £150 on it, I can say I've spent the most ever on Christmas lunch. Doesn't mean they're getting a better lunch. And that's a bit like this when you try and use statistics like this. It doesn't really matter. We're faced with a problem just now, which is NHS workers are leaving in their droves. Those who are there are stressed out because of the job they do. People, if you walk into a call centre, the stress and tension is palpable. And these are people who are earning under £11 an hour.
I just paid £400 for an MRI. Yes, you heard me. £400 for an MRI scan. Like, we know that...
Wait. NHS doesn't pay for MRIs. Red flag. What are you talking about? What? Hold on. I need more information on the UK health system. They don't pay for MRIs? How's that possible? Oh, she might have had to go to a private care provider. Okay, let's hear more, because this doesn't make sense. I thought they had universal health care. That should be covered.
NHS is getting bad, but guys, the NHS is really getting bad. Side note, if you're the loonies from the other videos that think that anyone can put on a wig and a dress and think that they're a woman and try to say biology doesn't exist and think that...
okay, I don't believe in this, okay? She's talking. That's not my stance. Okay, that's her opinion.
Anyone should have access to changing rooms where women are and where young kids are. Scroll off this video. You don't possess the intellect to understand what I'm going to say. So guys, I needed a scan. And I thought, got a doctor's appointment finally. Yeah, we all know waiting times are bad. Imagine they gave me an appointment for December 2025. Not for the scan, just to see a consultant. That's right. That's more than 9 months waiting just to see the consultant. Mate, we need to do something about this NHS. I heard Starmer's getting involved with NHS more. We need to really realise what's going on here. And also, we need to save money if you can. A little £5 here, a little £10 there, a little £15 if you can, and put it towards a health box, like a health pot. If you have Monzo, Starling, the digital banks, put a health pot. Start putting money back, because it's only by the grace of God I could afford to pay for that £400 MRI. If I didn't, I would have to be waiting until December just to see a consultant.
Wait, 400? Oh, so she probably had to go private. That's why she had to pay for it. What's £400 in Canadian? Sorry, I don't know the equivalency. So that's $700. So, that's expensive. $742 Canadian USD. It is $538.
And who knows what could be going on with my health. Health is wealth, as you know. Mwah, have a good week.
Okay, we're gonna listen to one more. We're at 5 minutes. Okay, one more.
After 30 hours in A&E, I finally got a bed in the corridor.
30 hours? Red flag. What is happening?
Guys, the UK health system is so far behind compared to other countries, and let me tell you why. So over the last few months, I've had some problems with my skin. I've recently moved to Thailand as of maybe 2 weeks ago now, and I'm still getting the same problems, and I've been suffering with it, I'll be honest. So I thought, you know what, let me just go to a walk-in doctor's in Thailand, let me see what it's like. It's probably going to cost me a bomb, but let me just go in, because I need to get it sorted, you know what I mean? And bearing in mind, in the UK, I've seen over 5 GPs, and none of them had a clue what it was, and what they did diagnose me with, was not even the right thing. So tell me why I've walked in the doctor's and I'm seen within 5 minutes. I just had to sign a form. I'm sitting down in the doctor within 5 minutes and he tells me exactly what's wrong with me. Literally straight to the point. None of this and ahhing, none of this, I don't know, it could be this, it could be that. Let me try you on this, let me try you on that. He literally just said, look, it's this and this is the medication I'm going to give you.
They have less bureaucracy. That's it. Less bureaucracy, and also there's a lot of levels to this. That's gonna be another topic for another day. I have to research more, but my theory is that they have less bureaucracy, less greed. No, they still have greed. I like corruption exists in every country. Let's be clear, but it's working in some countries and not in others. I don't know how it's being distributed, the corruption. But apparently in Thailand it's working. They care for the people. That's what it looks like to me. When you care about your country's people or the people in your country, this is a reflection, the healthcare. The number one way you can see if a country cares about its people is what they invest in healthcare, education, those top two things. You're going to really see that. And it looks like the Thai government really care, like the government, like, and isn't Thai is not, I think they're ruled by a king, right? Yeah, hold on, Thailand is not a democracy. I don't believe so. I don't think it is. Yeah, it categorizes itself as a constitutional monarchy. The king has little direct power under the constitution and exercises power through the National Assembly, the Council of Ministers, and courts in accordance with the 2017 Constitution. Okay. Yeah. I'd have to check their political system. I haven't investigated that quite deeply. But I do know that, yeah, lower, like, it is faster to get healthcare in some countries than other, even if they're less developed, quote unquote. They have less regulation around it, which can be good or bad depending on what you need. But the fact that he could just walk in and get what he needed, quick access to healthcare. There you go.
Before this, and literally 15 minutes later, I've walked out. I've got my medication.
15 minutes, y'all.
And the next thing you're probably going to say is, Cam, while the NHS is free in the UK, it's free. You've probably paid loads. This cost me less than £15, and that's included.
It sounds like Korea. It sounds just like Korea.
To see a doctor and to also get my medication. Am I missing the point here, or is the UK just so far behind? Let me know in the comments, man, because this is bad.
Right, okay, you lost your leg and you're bleeding. Fair. 1 sec. Hold on. Right, okay, can I just confirm your name, please? I know you lost your leg, but I need your name, alright? Jessica. How'd you spell that? Are you conscious and breathing? What's your postcode, please? No, you lost your leg, alright? But I need your details, okay? Yeah. Listen, Lou, do you have any paracetamol or ibuprofen that you can take right now so we can carry on the fun conversation and I can book you for an appointment?
What is going on?
You don't. Can you pop into Lidl or Sainsbury if you have money and get yourself a ibuprofen or paracetamol, then call me again? And remember, remember we close at 4. All right, thank you, bye.
Quickly talk about the GP system in this UK. Yeah. So, I have to call at 8 o'clock in the morning. I'm behind 500,000 people. I finally get to the front. The woman says to me on the phone, "Oh, we need to book you for a telephone appointment." Babe, I need my blood test done. What are you talking about? What do you mean I need Anyways, get a telephone call. You're going to be called between 8 a.m. and 12 p.m. at night. Okay, fine, whatever. Get a call. Oh.
12 p.m. at night? Red flag. You mean 12 a.m.? What?
Come down. Cool. You go down there. Very rude little lady at the desk. No morning, no hello, no nothing. What time's your appointment? Looking at me as if I'm boo-boo the talk. Who are you talking to? And who are you looking at like that? Very rude. I'm very polite and respectful. I expect the same. It's a normal... Anyways, then sitting down in the waiting area. Bro, why am I waiting 20, 30 minutes with no apology? No nothing. And the thing is, it might not be your fault. But you could just say sorry. Sorry for the delay. Because that's what
Anyways, but if I'm late, if I cancel, party's done, don't ever come here again. You're now off the booking system, don't ever come here again.
That's true.
And it's the same thing for these beauty therapists. Why is it you got to put down a deposit, but if I'm late or if I cancel, deposit done, don't ever
Deposit? Red flag. Y'all putting deposits? Red flag. Y'all putting deposits for doctor's appointments in the UK? What am I hearing? I thought it was universal healthcare. I'm confused because in Canada it's completely different. I've never had to pay a deposit ever. This is alarming.
Block translation.
Like, why are they treating this like this is a nail appointment or something? Like, you gonna put like a hair appointment. You gonna put your deposit before I could do your hair. What is going on here?
If you're late or you cancel, then it is what it is. No, bro. No. I'm going to start charging it to the game. I'm putting it back on people from now on. You are taking 20% off of my... Yo, we got to start charging it to the game.
NHS waiting times are an absolute joke.
So, that's it for now, y'all. We got to move forward because it sounds like UK's healthcare is in shambles. And then these folios are telling you to have a baby and everything's gonna be a-okay. Y'all heard one of the videos, it took 30 hours waiting in the ER. How are you supposed to get the best maternal health care if the healthcare system is already depleted? Riddle me this. How? How are you supposed to get the best state-of-the-line healthcare if the normal healthcare conditions are not where they need to be? How? Resources are not there. Already, it's in crisis. And then piling on to it. And then if something sadly happens to you, like that young lady, the 27-year-old who had the heart failure, the heart condition, has 7 children, by the way. 7 children. How can you afford your care? Decisions. Oh, let me read a few comments before we get to this video. Sorry, y'all. I'm breezing past through them because I really don't want to stay too late today. It's Sunday. I should have popped in earlier, but I had something else to do. I had an emergency pop up. All right, people also need to put their health in their hands by notice when their body change, trying to cut food to see if it's affecting their body. Yes, Jacqueline, correct. That's what happened. I'm telling you, that happened to me too. I noticed, I was like, oh yeah, I really cannot eat high sodium foods. My body hates it. My body hates high sodium, high sugar. I cut out sugar, never been better. I've never been better, y'all. I cut out like processed sugar. I only eat natural sugar, like in fruits and stuff, like blueberries. I have a little oatmeal, overnight oats that I do with blueberries, like, and then I only add minimal salt to my food. It's been working wonders for me. I feel so much better. And yeah, we need to start doing that, start testing. It's all connected: food, environment, water. I don't drink any soft drinks anymore. I never did. Actually, for years, I don't really drink soft drinks. I stopped a long time ago. But I had to cut out coffee. Coffee was it wasn't working for me. So I cut out coffee. I just drink tea and water. That's it. That's what you see here. Water. Yeah. And Rosa, yep, advocate for themselves. If a doctor doesn't seem competent, you change. Absolutely. But I have to say that some people don't have the option, unfortunately. And that's why I was talking about money, financial ability. Yeah. But these are good. This is good advice here. Exercise. Amen, Sylvia BT. Yup, exercise. And you know what I had to learn? You don't have to do every single exercise. Like, I really hate doing like that heavy lifting, but I still lift. I lift enough to get muscle. But what I do now is, for cardio, I hate being on the treadmill, so I just go outside and I take a walk. If you have the opportunity to. I understand for some of you, maybe it may not work that way, but if you have the ability to walk. Walk everywhere. I don't drive right now. Well, I don't drive at all. Dom drives the majority of the time. I know how to drive. I just don't drive. But most of the time, I just walk everywhere. As long as it's within a 30-minute walk, I can walk. Even an hour, sometimes I walk back and forth. So I get my steps in. During my lunch breaks, if I'm downtown, if I go to work, walk everywhere. And track it with I have a watch here, your fitness watch. Buy you. Invest in this, y'all. Invest in this. You can also use your phone, but I find the watch is better. I don't know. That's just my opinion. I try using my phone, but I feel like the watch accurately, like, it captures everything. This right here. And it tracks your steps. Walk everywhere. And then just try to live a very stress-free lifestyle. Please drink your water, y'all. Get the water filter. Eat healthy. That's it. And I'm not saying that, again, it's not promised, but your chances are higher. And try to get rid of all the stressful things in your life. Anything that's stressing you, causing you anxiety and stress, get rid of it. All of it. And I'm talking about people too. Get rid of them too. All of them. Anything that causes you stress in your life, get rid of it. Trust and believe me, I've been living a peaceful lifestyle. I do not feel lonely. I cut so many people off and it's been amazing. Most peaceful life ever. I entertain people who I want to entertain. Let's just keep it at that. I'm talking about in my real life. You love junk food too much? Gotta, you're gonna have to cut it out. Yes, at the Depth Studio, you're so right, sis. Consistency is the most important thing with exercise. Amen, sis. Amen. Amen. Like, wait, whose diet is restrictive? Oh, Dr. CB, yeah. You know, I had what? Okay, quick segue, 5 minutes. 5 minutes. Dr. CB, y'all need to get his book with all of the alternatives and stuff. Very helpful. Very helpful. It's very restrictive though. I ain't gonna lie, it is restrictive. But guess what? You feel better. You feel so much better. You know what's so crazy is when you go to the grocery store, you have way too many options. We don't need all of that, to be quite honest with you. We don't. You can't stop processed food. Yes, you can. Oh, you love junk food too much. I did too, but I had to cut it out. Now I still do it, but in moderation. So like, for example, like if I'm craving popcorn, I love popcorn. Popcorn is, I love Cheetos and popcorn. Those two things. And these Boom Chicka Pop. Oh, that Boom Chicka Pop. My goodness, you reminded me. That popcorn is so good. Boom Chicka Pop, cheese puffs and popcorn, the best. But unfortunately, it's not good for you. So what I would do is if I crave it, I just have a smaller portion of it. And that's it. And if I crave popcorn, I buy the Dr. Orville's ones at the grocery store. The small pack, they have it 80 calories per pack is the light one. And then I'm good. I don't eat out anymore. I rarely, when I go to the, like usually with my coworkers, we used to go get coffee and like desserts. I don't do that anymore. I don't eat desserts anymore unless it's a special occasion. No more sugar. Like I really legitly cut out sugar. Sugar was my problem. It was my enemy. My enemy, y'all. But ever since I cut it out, it's been amazing. Amazing. So yeah, consistency. I'm so glad you guys are writing this. I have treadmill and juice. That's perfect. Keep going. Keep going. Because the way this health system is collapsing, we need to lose weight. I need to lose weight. I still got my belly fat that I got to get rid of. But guess what? It's getting there. It's getting there. I've just been very consistent. It's getting there. And it's going to get there for you guys too. Just be healthier for yourselves and for your future. Because Lord knows the way things are going. I don't want to say there's no hope, but don't depend on the health system that we have now. Please, I beg. All right, let's get to this video, y'all. We speeding right up. Let's get to it. Remember, yesterday we watched part 1. If you didn't watch part 1, you got to get the replay after. We go into part 2. All right. That's the reason why I showed all the videos that I have. We've been on for 5 hours worth of content because of these men. Let's continue.
You have time narrative become a comforting lie for women in their 30s? Or are women being misled into thinking marriage and motherhood can wait forever?
I spoke to multiple men and they say...
Yeah, by the way, it's getting darker here because the sun is setting. I guess it's the position of where I am. So when the sun sets, it gets darker. So just letting y'all know that. That's why it's going to get light, dark.
Every time they ask a woman their body count and they say a number, they automatically double it or triple it.
Cookie, you've been encouraging women to go and have a good time with their boudoir. I'm tired of older women that do not tell younger women that they do have a time frame, they do have a biological clock, and there are consequences for their actions.
I'm now raising children that I don't want, and I will end up hating because I never wanted to do it. But because somebody...
Yeah. I'd say 99% of the time, if a woman has slept around and slept with loads of men, you're not going to get a top quality guy. You're not.
White people really don't care about those things.
You're not white, bro. What are you talking about white people for?
We're going to stop
what
there.
Do you mean white people?
We're going to take it back
what
to
are you
the
trying to
audience.
say?
Yeah? We're going to stop there.
You know why she talking about white people? Mr. Riches and the rest of your friends over there on the panel, is because she knows y'all date them. Red flag. Well, not a red flag because you date them, but red flag because you couldn't see that. That's what she's saying. She's saying that she is basically saying that you do not have the same smoke or energy when you're dating outside of your race. That's what she's trying to say. Let's see if she actually explicitly says it.
White people just throw their pussy.
Hold on, stop.
What are you trying to say about white people?
Guys, my friend, please.
White people don't have standards?
Lord, I know this part 2 is gonna be crazy.
Hi, good night, everyone. I'm Mafiela anyway. But I just wanted to say that some of the things of age is a lot of the girls that got pregnant earlier was due to lack of knowledge. Sometimes lack of knowledge, it can hinder a relationship as well, if the guy's older as well. Because when you're looking at a girl, expecting to...
You know what? Sorry to stop it so early on. Thank you, sister. The audience members seem to have brains. So you know what? I retract my sentiments about the UK. I think it's just a breed, and unfortunately, like a small segment of the population, they have the loudest voice, such as in North America. It's true. But then when people like her and the brother with the dreads last time, when they speak, I'm realizing that you guys are okay. You got some soldiers out here that are smart. Yes, sister. Thank you.
To do grown things, it can there's expectations in that relationship already it's not gonna kind of tally up. Do you understand what I'm saying? I do agree with that. Everyone should, when you're sleeping with men and you know that your body count's going up, you have to remember that that's something that your husband is going to ask you.
Red flag. So sis, I was with you up until that part. I wish she said your husband, if he is of a demographic, is going to ask you. For secure men, they're not going to ask you that, nor will they care. They don't care. They don't. They never did. If that was the case, I know Kim and Kanye are divorced, but nobody seems to care about Kim K's body count. You want to know why she can't find a man right now? It's because she got a whole bunch of kids. That's why it's harder to find one. That's it. I promise you, if she didn't have her kids, it would be easier. I don't think it matters for a lot of them. Just saying.
When a man comes to you, that's not one of the first requirements for a woman that we have. We ask for stability, safety, protection. Those protection. His provider. Protection and how he feels about his woman is they count it by the men you've been with. So I think that we always do need...
Immature men, guys. Immature men and unevolved men. Just putting that out there. Because if that was the case, if people really cared about body count, a lot of women would not be married. And I'm talking about other demographics of women. They would not be qualified to get married. They wouldn't be. You even have porn stars who are married. Come on now. Let's be for real. OnlyFans married. They are out there. So no, just stop with this whole purity. And I'm not saying that you shouldn't be. If you are, stay that way. Because there are a lot of wolves out there. But my point is, you shouldn't feel ashamed. I will tell you that. Why? Because the same men who are asking you for your body count, they have probably the highest body counts. And it doesn't matter for the other races of women, but somehow you get penalized for it. Just remember that.
To educate the younger generation of females that when you go, if that's the wife that you want to be, the questions that you're going to ask come underneath that.
This is the thing. I understand what she's trying to say, but not because you want to be a wife. The reason why body count matters is for you, your health. Your health. Your health. Do not engage in risky behavior. That's what I would care about if I'm asking you about your body count. Unprotected sex, no. Stop doing that. Having babies by men who don't need to be fathers, please stop doing that. Stop doing that. That's why it would matter to me.
Bracket where the man is going to ask you, who have you been with? Age and stuff and that, obviously, as a mum, when you're young as a mum, there's loads of things you can learn. That's why they do say that most of the time when a younger girl has a baby, she turns to her mum or she turns to someone older. That's knowledge. Like, you can't go into a museum and look in a museum and see anything from 2 weeks ago. It's from a long time ago. That means you need to learn.
Talk up my
Do you understand what I mean?
No, I just big up my sister. Yeah, say mum, say dad. One math, never two. Come talk up the things there, girl. Yeah, girl.
Wait, what? Hold on, let's go back. What did she say?
Look in a museum and see anything from 2 weeks ago. It's from a long time ago. That means you need to learn.
Talk up my
Do you understand what I mean?
No, I just big up my sister. Yeah, say.
Oh, that's her sister. Okay, same mom, same dad. She ain't had to add all that though. Red flag. Why do we have to add same mom, same dad? I understand that, yes, it is a privilege to grow up in a household where your parents are still together, but why does it have to be a flex? Like, you would still be my sister if you were my half sister. I don't know. Anyways, okay. All right, that's her sister there. Ciao.
Hey, mom, say dad. One math, never two. Come talk up the
Did she say one man, never two?
things there, girl. Yeah, girl.
Okay.
As a woman,
this is why people stay in. Man, you know, I already want to wrap it up. Wrap this right up. What? You know what? I'm not gonna say nothing. I have nothing. I have nothing
if
to
you're
contribute.
looking to be in a certain space with a man, know that that is going to be one of the questions that they ask. And I believe that if we have our requirements for us, what a man should have his right to say.
Yeah, he has his right, but that doesn't mean that it is. It's okay. So, like I said, the standards are different. They're not gonna ask another race of women their body count. I can guarantee that. And I done told y'all about Tammy yesterday. That's a pseudonym, by the way. It's not her real name. I done told y'all about her. I'm not joking. There were many a Tammys in my college. There are many a Tammys everywhere. And yet, whole neighborhood paired up married. Need I say more? There's people who homie hop, y'all. Homie hop. Homie hop. They're still married. I told you, the standards only matter when it's you. If you look like me. Just remember that.
Hey, how much men have you been with?
Can I interject after my sister, please?
Yes. Fab, me love that, Matthew. Yeah, that's my sister that just spoke in the audience.
Hello, sister.
But I just wanted to, big up my sister. I love what you said there. And it's the truth. Your husband should be able to. Because what people need to understand is a woman's requirement, her first requirement is safety. Women want safety. Men want respect. So they don't want to go into a room and they know that the whole room's had you. That knocks points off of their team.
So how did that happen with Kim K? Red flag! Hold up! This don't make no damn sense. And I'm not... This is by no means trying to shame her, by the way. Because I really don't care about her body count. That's nothing to do with me. This woman has a whole sex tape, y'all. Done been with Ray J. A lot of people. And yet she was still able to get married. 3 times, might I add. J-Lo. How many husbands does J-Lo have? J-Lo had like 3 husbands? Hold up, let's see. Did they even list it? She had the first guy, J-Lo's husbands. Here, she was with Ohani Noah, Chris Judd, Mark Anthony, Ben Affleck, and I'm sure she had relationships in between that. 4 times she was able to get wifed up. Lauren Sanchez, Jeff Bezos' wife. This woman was married to a whole other man. Her and Jeff had an affair. He left his wife, she left her husband there together. How come that doesn't matter for them? When you walk into a room, they want to know who you slept with. It's about respect. He didn't care about that man's respect. He still took her. Let's go to biblical times. David and Bathsheba. Bathsheba had a whole husband, y'all. Whole husband. That man went out there and unalived her husband. Got her husband unalived. Took him up out of there. Put him in the front line. Said, "Oh, you part of my army. I'm the king, so I'm gonna put you in the front line." Unalived him and married her. Oh, but they care about how many men you slept with, because when you walk in a room and they were dapping up men that had slept with whoever. They would be in a whole room with men who have been with their wives and they won't bat an eyelash. They don't care about that, but you do. And then where's your economic where's your the word I'm looking for? Where are you economically is what I meant to say. Worried about the wrong things. The wrong things, y'all. That's not what provides respect, by the way. Having a low body count does not provide respect. If you want to have a low body count, do it for you. Do it for you. Your health. Do it for you, not for them. Because it would matter. The only way that it would matter is if he also had a low body count. So then you guys can actually have that conversation. Because he is what he's looking for. But he wants you to be pure and he wants to be a hoe. Red flag! No, that's not how it works.
Makes man look like what I'm saying. There's enough girls out here that if their man downloaded their file today, they would not be with them. Remember that. Do you understand what I'm saying? Know your file. It's not. I'm not bashing the women. I'm just trying to tell you about women, because I speak to women when they're at the age, like 40s and that, $5 a time for IVF, dating agencies and all of them things. They're hinging that, and then they don't even know who they're with. It's an investment. When you're invested in a
Thank
house.
you. Look at Zilla's face. I like Zilla and Cookie are like, what the hell she talking about? Look at that one. Them 3, yes, I agree with y'all. I already know. You see the icon. I already know what's happening here. Thank you, ladies. My goodness. That's how I'm looking right now, y'all.
You have to save. You have to know about these things. So when you're investing into who you're going to have children with and who you're going to marry, it's the same type of thing. You understand what I'm saying? Mm-hmm. Your quality of living is based off the man that you have. You could have money. That still don't mean you're going to have a good quality living, because he's meant to be the head of your household.
He is, but if he... So this is why it's backwards. Sorry, I keep pausing because this is just ridiculous. If he's the one who demands respect from you and he has all these standards for you, then by logic, your standards should be even higher for him if he's the head of the household. But yet they can infiltrate and just walk right on in. You can procreate with them and it's fine because it's different for when it's men, but not for women. Where your money at? What's going on in the UK? Look at the healthcare system. You don't even own a clinic. Can't even help your community. Had to get the government to step in. This is embarrassing. But yet you care about body count.
He's meant to be the leader. You're meant to be following what he's doing. Do you understand what I'm saying? And you're meant to help him navigate it. So you need to have the right woman behind you and you need to have the right man behind you. Everybody has their own preferences and their own standards. But if that's your requirements, why can't you have them? Because if you want to know what type of woman that you're going to be beside, And the same for your man. I don't want my man that's been all up and down the place everywhere neither. Because the same way a woman can get rubbed.
Thank you, finally.
Out, man can get
Stop
rubbed
her talking as well then.
Do you know what I mean?
No, I was going to ask a question.
women
Wait, I was
say
going to ask a
it's okay,
question.
but when men say it, you're old.
Okay, I'm going to ask a question. What if you got married to a girl who's had barely any experiences in life? Like, she hasn't gone on holiday, done all of that kind of stuff. She marries you. Her mileage is low. Box hasn't been given out. And now, while she's married to you, she wants to experience things in the safety of the marriage. Let's just say she comes in and she says, babe, can I go on a girl's trip? Would you let her go? Or would you be like, no, you should have done that before you got married?
Have a nice time. I must have built up trust with
So
my
you're
woman
okay
by
if your
then
girl experiences certain things while she's married?
I'm not saying that. I wouldn't say that.
Oh, so you would. So basically, wifey material to a degree for you. Can I just ask a question? So wifey material to a degree for you as a girl that's inexperienced in quite a lot of areas. So I'm asking you the question: is that what it is? Because he just said he's fine. Wifey, go on a girls trip, no problem. I have a feeling that if your wife came to you and asked for a girls trip, she's never been on one. You're gonna assume she's gonna cheat on you or something. So can I ask, would you guys as men be okay with your girl experiencing new experiences while she's married to you?
Please answer that.
You're asking Richard.
Okay, I'm asking.
Yeah, that question. Wait, sis, I don't understand what this has to do with the conversation. But let's listen to this.
China and King, because you two in particular have this thing about mileage box. So I want to just hear.
I'm not trying. I'll take this.
Would you be okay with your girl experiencing new things in your marriage?
Wave as well. Who's she going on? Who's she experiencing these new things with?
I told you, girls trip. She's never done one before.
Are they single friends? Which one? Or they married? Well, I mean, would you want your husband going on a boys' holiday with a bunch of his single friends, no relationships, no marriages? Would you want that?
Do married men?
I mean, if he says
no, I'm saying, would you want that? I'm not saying.
If I trust him, why not?
No, but I'm saying
my love is not controlling.
Well, first of all, I don't understand this question. This hypothetical question doesn't make sense. That's number one. Number two. Okay, let's continue listening. I'm at a loss for words.
No, I trust you. Okay. I like the words. Wait, hold on. You use the word.
They're the biggest cheaters.
Wait. You use the word controlling. I like how you use that.
Yeah,
my love is not controlling.
Go on a trip if you want to.
Okay, so that's not controlling. So when your parents asked you, where are you going? What time are you coming home? Who are you going to be with? Is it because they were controlling or because they loved you? So you seem to have a different looking on certain things. When we have different concerns, especially in foreign countries, we have different concerns and protective. And what she was talking about, men being protective, okay. There's scenarios that happen in this country.
Okay, he's right about that. It's true.
Women talk about not being protected, especially if you're a black woman. When you take yourself overseas, you put yourself in other dangers as well. So we're not going to be there. So a lot of the times you just think it comes from a point of we're trying to... No, it has nothing to do with that.
But the same black women that are here not protected, you didn't protect them. That's why they're talking about it.
No.
So what's the difference?
No, but my girl... So if my wife, you've moved it. So if it was my wife, she wouldn't be in a nightclub unprotected. Do you get me? I would be very concerned about...
So she's only allowed to go clubbing with you then?
No, of course not. But if she's going to go to places...
She mentioned about going to a girls' trip. On a girls' trip, there's things that can happen.
Yeah.
And this is the thing. Someone could spike your drink. I wouldn't know. What happens then? Someone can take in the cab.
Okay, I'm going to tell you guys right now why this conversation doesn't make sense to me. As a married woman, okay, there are different levels and stages you reach in life. You can go on trips with your friends, don't get me wrong. But at a certain point, you understand that you're in a different phase in life. So I get where she's coming from, where she's saying like, hey, if this woman didn't experience life and she wants to go on a girl trip, would you let her? First of all, there's no let her. She is a woman who has her own agency. She can go wherever she damn well pleases. However, I will say that this is where, yes, if you are married, you do need to talk to your husband about it because he is part of your family and he is somebody who you need to talk to. Actually, like you have to do that. But permission, this is not a parent-child relationship. It's more of like courtesy and respect. This is where respect is needed. Now, if you decide that you want to go on a girl trip, I don't personally think there's a problem if you go to 1 or 2, but if you constantly go on girl trips all the time and all your friends are single and you're the only married one, I can see where that could get tricky. So I'm not going to completely disagree with them, because I personally would start to get suspicious if my husband was always going on these boys trips with his single male friends all the time. And I'm like, yo, one time, you know, sometimes for a bachelor party or wedding, stuff like that, that's fine. Whatever, do whatever. But like, if it's like a consistency thing, it's a constant thing, then I'm going to feel like you're not really, you don't want to be married. Again, you've reached another phase in life. There are certain things that you can do as a married person that how can I say, it's a respect thing. This is where respect comes in, not about the body count. And if I walk into a room and I found out he slept with all these girls, I don't give a damn about that. What I'm talking about is more so like, if you are a married woman, then there are certain things that you cannot entertain. You can no longer entertain. I'm just being honest. And that's for the respect of your partner. That's it. So this conversation doesn't make sense, because even if she's inexperienced, her going on a trip, that's for her and her husband to decide, you know, once, whatever, his comfortability, if he trusts her, good. But it's about the frequency of the trips. That's where my personal opinion, that's where I would have to draw the line. Because, again, if you wanted to go on all these trips and do all that stuff, then you should have just stayed single. Why are you with? What's going on? Like, I'm not talking about, like, going on trips once in a while. I'm talking about frequency. I don't know what they're talking about here, so I can't gauge it. But I'm just giving you guys my opinion based on the frequency. And then also, it's kind of like being a parent. Once you're a parent, you can't just pick up and do whatever you want to do all the time. You have to consider your child. And you have to consider your spouse. So it's like, once in a while you go out with your friends, it's no problem. But let's say every single weekend you out at all types of hours with your homegirls. What are you doing? That's what I'm saying. It's like a graduated phase. And unfortunately, I can see the lack of maturity here a little bit. I can see it there, but I get it. They're just asking hypothetical questions to get the guys' reactions. But I just think that this conversation doesn't make sense to me, because that's something that she'd have to discuss with her spouse. And also, it really depends on the couple. There's so many factors. My opinion might be different from another couple. Maybe another woman would be like, I don't care if he goes out with his friends. I don't give a damn. Then that's okay. It's all dependent on the person. So I don't understand. I don't know. Maybe it's just me.
Talking about your daughter. You're talking about your partner. Do you understand? If she's your wife,
and that same grown woman doesn't want to open the door in the night time. You don't even want to take the bin out in the night time. Let's get someone's gonna grab you.
So basically, you're saying if you didn't have fun before me, don't expect to have that kind of fun with me.
You're putting words.
Okay, we're gonna go back to the audience.
Don't do that. I didn't say that. I did not say if you didn't have. Don't put words in my mouth. I did not say that. That's what she's doing. I was talking about.
Why are you getting so upset? Okay, now he's the new Ginger J. What happened now? I mean, he's not as crazy as Ginger J, but what's going on, brother? Why are you getting what's going on? Something happened?
Concerns. I was talking about certain things, and you're trying to act like I'm trying to stop a woman from doing anything. Don't do that. We didn't say that.
I don't remember saying that, but that's what they've been doing all day.
Don't do that.
I'm going to echo a few things that have already been said. I think both of you gave fantastic points. I think a lot of things are based on the facts of the question, which is biological dynamics, men and women. It is stupid and it is wrong to lie to our young girls that you have all the time in the world, because you don't. That's just fact, right? Like in any decision you take in life, you have to apply sense, you have to apply wisdom. So when you're making your decisions to live life, does that coincide with you being a wife? You also have to understand what men feel threatened by or need reassurance in, and what that language looks and sounds like, right? So, yeah, they've mentioned a lot to do with sex. That's because my assurance comes in you to me. And if you've imprinted, using that word, with multiple men, going back to you, should you ask the question?
Again, it only applies to you or if you look like me. That's it.
At a certain age. Yeah, well, actually, if I'm feeling like I need to, then probably there's an issue here. Because I feel a sense of insecurity and I'm not getting a sense of assurance that I need. So I think generally with what everyone's saying, everyone's sort of saying the same things. Let's not lie to our young children. Like, enjoy your life, yes. However, be wise. Like you are with the careers that you're choosing to pursue or the person you're choosing to grow and become. Like, apply wisdom. I think that's just...
Can I add to that? Can I add to that?
Are you listening? Are you listening? Are you listening?
I'm allowed to add to that.
I'm in a relationship.
I'm just saying. Are you listening?
So you see, notice how this advice is only for the women and not for the men. Notice how he said, oh yeah, like, you know, wife, da 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 da. What about the husbands? This is why this conversation doesn't make sense to me. Yes, you should apply wisdom 100%. Be careful of who you lay with 1,000,000%. If anything, I would promote abstinence in this, especially in this economy, please. Because some people don't get the memo and then they have all these kids and all these problems that come with it. Headaches. However, what I will say is don't be ashamed if you didn't get the memo. That's my point. And you have a decision to decide what you do with your body. That's my point. It is not going to make you less of a human being or less valuable, is my point. I don't know why they're getting on their moral high horse when they get with Becky and they don't care. They never care when it's Becky.
I didn't ask you, are you in a relationship? I said, are you listening? Okay.
Can I add to that? Now, based on what that man has said, as much as we say live your life and do what you're doing and all of that, you also factor in that there's things that in actual fact affect your ability to live your life. Mm-hmm. One of them being income. One of them being your family status, your situation, whatever else. So sometimes when we want to do certain things, we have to recognize that within the time that you want to do it, you're not capable of doing it without maybe finding a sponsor or do. So when you're saying be guided, sometimes we have to limit the amount of life that we want to live, because we might tell ourselves we want to be in Bentleys doing whatever else, but the reality is that we're in our mum's house, in our bedroom. Let's be realistic of what in actual fact we want. Take time to actually think about, not just ladies, even guys, what you actually want. Because what you want often is not based on what in actual fact you want. It's based on what you've been told you want.
That's true.
It's often based on what you've seen.
Yeah.
And the reality is until you get it, you then realise you don't actually want that.
Well, that's life, innit? That's life, innit? We're going to go back to the audience.
Kind of back to the original statement, which was like, is you have time like a comfort in life? I feel like it is, because like eventually, you know, women, they are on a set time or they do go through menopause and all that kind of stuff.
And you get tired.
Sorry?
And you get tired.
Yeah, and that's just science, isn't it?
You just get
you know, they might want to snatch back into shape after their pregnancy or whatever, do you get what I'm saying? But it becomes more difficult. I feel like with regards to marriage, it's a different timeline for multiple reasons. An example of this is a woman will expect her husband to take care of her, which if in most, not all cases, that means financial stability, do you get what I'm saying? And a woman might be ready for this at 27, but a man may not be at this age in his life till he's 35.
Red flag, then don't date him. Next.
Do you get what I'm saying?
Sit down, brother. Whatever you gonna say after is null and void. If she's ready at 27 and he's not ready at 27, then she gotta move on. Okay, it was nice meeting you, brother. You don't have what I want. I'm gonna go and find somebody else. Next. Stop. Dating for potential has been dead. It's been done. No, that's the light bill guy. That's what he talking about. Oh, maybe he's gonna get there. No, he should be there. If you, okay, let's put it this way. If you want to date for potential, you setting yourself up, you're gambling. That's a risk. You're gambling. Holla at me when you get your stuff together if you don't fit the standard. Let me know once you graduate and you get a job. If you're in the membership channel, you would already know that Lillian James, she was banking on him finishing his schooling. He had the potential. He was in school, but guess what? She was funding his lifestyle. And then as soon as he got a full-time job, what did he do? He left her. Or she left him, actually. And then he got with somebody else afterwards. But he was making it real hard for her. Let's just put it that way. Don't bank on potential, y'all. It's not going to work. Start with what they have right now. Start with what they have. If you have the requirements minimum to pass the points in my standards list, You're able to keep a job, a good one. You have an education. Okay, we could see that right there. But no, potential is not the way he talking. No, we not gonna get that to 35. Well, then see you on the other side. Not in this lifetime. Maybe in the next one. I'm gonna meet somebody else. Next.
And so I feel like it's different. And also, I was gonna say there's still like benefits. What I was saying to P-Wave before, like when people do have kids from young, it can still be beneficial. Like you get to grow up with your kids. You get what I'm saying?
Sir, sit down. Red flag, sit down. Sit down, sit down. You get to grow with your kids. What you gonna teach them? And it's only a small percentage of children that are born in those situations that actually turn out to be successful. And that's because their mother had to work damn hard to undo everything. Look at Toya. Toya Rushing. Sorry, I don't want to call her that. Toya. Lil Wayne's baby mama. Or ex-wife. Sorry, she's not his baby mama. She was his baby mama. Then they got married. They had their daughter Regine at 15 years old. 15. I think it was 14, 15. Around that time. And then she grew up with her daughter. And you want to know what her daughter said in an interview? Her daughter said that I want to get married before I have kids. I don't want to have kids right now. That's what she said. And one of the reasons she said that she doesn't want to have kids is because she saw her mom being a young single mother. And then she said that she wants to know more than her children because it was hard for her because she's growing up as well as her mother. And she said there's some advice that my mom couldn't give me because I felt like we felt more like sisters than mother-daughter. So I don't want that for my kids. As much as I love my mom, I want to have a kid that I can actually give wisdom to because I'm older than them and I've been through life. That's what she said. And her mother is 15 years older than her. They're very close in age. And she said that. Red flag. She understands. And thank goodness her mother also understood that she didn't want her daughter to follow in her path. She made sure to put her daughter in the environment where she would thrive. Did Regine make mistakes? Absolutely. But considering the fact that her parents were teenagers, she's doing a damn good job. Especially now. She's doing okay. I mean, of course, sometimes you got to hit your head a little bit. She's a little hard-headed with these little boys or whatever. She was messing with these young men. But she's still on the right path. What he's talking about, small percentage. Majority of children of teen parents or parents who are not mature enough to have children, they do not end up like the Regines of this world. They end up just like their parents, repeating the culture, repeating the cycle. So please go sit down, sir. Sit down.
I'm saying, like, when I'm young myself, I'm 25. But when I was growing up, like, I grew up with a slide-up Sony Ericsson Walkman. Do you get what I'm saying? Now you look at your phone, it unlocks and social media. There's a whole heap of things going on. Do you get what I'm saying? When you're old and your kids are growing up in a whole next generation now, where it's going to be, 20 years from now, 15 years from now, you ain't going to know what's going on.
You see, now I understand what's happening in the UK. I couldn't put it together. I really couldn't piece it together, but now I understand. It's the healthcare system that's frying something here. So, technology as if you can't learn it. Red flag! We got 80-year-olds on TikTok right now. What you talking about, sir? What are you talking about? You can learn technology at any age. It's about applying your knowledge and your skills. Oh, so I don't know the technology that's right now. So I'm not going to be able to see my kids and raise them. Do you know how stupid that sounds? It's dumb. Very extremely dumb. Extremely.
I'm saying, so there's pros and cons to it. But yeah, that's pretty much it.
Don't clap for him.
We get back to the original point of the question about is it
what is it? Is it a comforting lie and whatever not? But I feel like every time we talk about like these kind of things, we always stay at one end of it. You understand? We always stay one end because it is on one scale is you're running out of time, and then the other scale is you got plenty of time. But the reality of the situation is just the education. All you have to do is educate yourself or other women or your children and all these things about, like you said, the biological clocks and all these things there. But you can't put too much pressure on it, because what you can do as a consequence to that is you can force them to have kids and get married too early. You understand? And then that can have a negative effect.
Thank you, brother.
Life, everything just mash up.
Yes.
Because you could be a lovely lady and you understand, forced into because you feel like I'm running out of time. You have a kid early, you get married early, it becomes bullshit, then you turn into the hole, if you know what I'm saying. Because of trauma, you don't believe in love and all these things no more. So what happens? It's very. So what happens? What happens? You turn into a hoe after marriage. What happens if you take too long and they say you can't have a kid anymore? That's but it's not about. I'm not saying.
Okay, and if you wait too long, you can't have a kid anymore. I'm not. Again, this is just me, my opinion. I know everyone is different. If the doctor came to me and said you can't have kids anymore, then so be it. So be it. There are other fulfilling ways that you can live your life. Having a child is not the end all way that you can show your value to this world. There are a lot of childless people who have made an impact on this world and in this world. Plenty that you guys know of, even in your history books. Plenty. Not everybody's meant to be parents, y'all. Not everybody is going to be a parent. What is the problem? Oh, you find out your clock. You find out that you can't have a baby. And then you can't. That's it. What are we talking about here? Oh, because that matters to him. So he's basically letting y'all know if you can't have his baby, he's gonna be upset. Not even thinking about nothing else.
Saying that what I said is educate yourself on both ends of the scale. Because what I'm saying is we lean too hard on one and start applying pressure.
Why you turn into a hoe?
People that get married and have kids from young and it mashes up, some of them turn into a hoe. We all like to act like extremists, you understand? There's no middle ground. It's either one end of the scale or the other end of the scale. You got a man asking me, why would she be a hoe? You know hoes. You acting up.
Why is she a hoe and you not? That's my question.
Have your kids in marriage and you have a stable relationship and then you raise your children. Not saying with everyone. I wasn't raised in marriage, but I'm just saying you have a better chance. Remember, we was talking about starting points, innit? So you just have a better chance. So even separating them, we actually shouldn't, because we should all be thinking about them all together. You should want to have kids with the person you marry. Do you understand?
I was going to say that earlier on, but I just thought
If you want to have kids, yes. Yes. If you can't have kids, it's fine too.
Oh, this one I want to just chill out now. I was going to say something.
Yeah, but you know, it's not everyone's reality though, isn't it?
We have to go back to the audience.
Hi everyone. I was just gonna make a comment at the start with the guy saying it. You know, I'm a medical professional myself, and I think there's this massive I just want to debunk that. You know, studies have shown that women's health is at their peak and the same as in their 30s and their 20s, especially if they're living healthy lifestyles. The thing that's made it different, especially in our generation, I've just turned 30, is we're making smarter choices. We're learning lessons from our parents and from other people. We're choosing men who are going to be not just good partners, but they want to be good husbands.
Oh, thank you. And you see, look at them. They listening. Oh, look at them. They're like, oh, preference is talking. Oh, yeah, now they're listening. Notice how they're quiet. We got company here. Yeah, but notice when the other women were saying it, specifically Zilla and Cookie. Now look at them, quiet as a mouse.
Okay,
I agree.
And that's so important. But the issue is, I'm 30, I'm single, but I've realized I live in a generation where there's a lot of lustful men. So it's trying to find the ones that are serious from the ones that are talking, right? And as someone like myself that's Muslim and my best friend Christian, we're God-fearing women. And one thing I know is I want to take my time. I want to get to know a man before I can commit and give him marriage, because the virtues that I will give him, I expect the same back. And another thing is, you know, we're having this conversation. Let's give each other grace. You know, we all have a journey. We all have our seasons. Trust in God's.
Thank you. Oh, because she's saying it, so now everybody quiet. Oh yeah. Not her, because she's always been on that train. Cookie's good. I'm talking about the other ones, especially the men. Oh yeah, you're right. Notice the demeanor change.
Timing. And one thing that my Nigerian friends always say is, I'm gonna marry once and I'm gonna marry right. And that's what I want.
Isn't that cute?
It has nothing to do. It has nothing to do.
Should we cook her now?
Yeah. So I would rather wait, marry once, marry right, and be a good mother and a good wife to a rightful man, but in God's timing. Thank you.
You know what that is?
When she says it,
you see?
No, but when she
there we go. We should just end it here. She done said everything. Everything I would say. That's it. That's all. Wrap this right up. How many minutes we got? Okay, not that much longer. We just
when she talks about the health stuff, you're quiet.
Because she's educated.
What do you think about what she said about women's health in their 30s?
No, I agree.
What do you think of what she said? You haven't said anything. I'm just asking. What do you think of what she said? She's a health professional. She said women's health is the same. So please, what do you think
from a health perspective, if she's talking about biological evidence based on what she does, then of course we're going to listen to it. We're not going to argue against it. We're also going to factor in that no matter how much evidence she has, there's always going to be the individuals that don't. Okay, is what I'm saying. So how do you want to look at it? Okay, so if you like, take her medical evidence and go and run with it. In fact, come and spread it to every school in the world, every kid in the world, and tell them to go and follow it. Yeah. And if it doesn't work that way, let them come back and say to you, "Wow, I listened to all that medical evidence, but here I am now."
The evidence doesn't match.
It doesn't match.
Let me tell y'all something. First of all, notice how they getting heated for you to have their babies. We have not even there's so much energy about having children, but not having the ring. Marriage. I wish he was just as passionate about marriage as having children. That's number one. Number two, based on all the health risks that we done went over and complications of pregnancy that black women specifically, those black women right here on the panel, may experience, it wouldn't be such a bad thing not to have kids. That's just my opinion. Logically speaking. Because my risks would not be as high if I didn't have a kid. Just letting you know. So, sir, when you say, what if we went to all the schools and told them this and then they didn't end up having kids? Well, it's not the end of the world. They'll be just fine. And for those who can have children, they'll continue to have children. For those who are having high-risk pregnancies and all that stuff, then maybe it's going to be a wake-up call for them. And they'll be like, you know what? Maybe this is a bigger risk than I thought. I need to really sit down and assess whether I should have a child by this man. I don't see the problem with that. But again, education's not there. For me, if I'm assessing it based on a risk assessment, y'all know I like to do risk assessments. If I were to weigh out the risks and the rewards of being a mother, in my current state right now, my current condition, it's not so bad not to be one. Personally speaking. Because I'll be putting my health at risk. Finances at risk because taking care of a child is very expensive. Daycare is expensive where I live. Let me show y'all. Daycare costs in BC. Here we go. BC failing on affordable child care. This was published July. Just July, y'all. 2 beautiful babies here, by the way. For Surrey mom Lisa Kemp, childcare for her 2-year-old and 6-year-old costs nearly $2,000 a month. Red flag, why is it so expensive? It's astronomical, she told CBC News, and nowhere close to the promised $10 a day daycare, which the government has been saying for years to be coming our way. Yes, because we do have that program, but not everybody qualifies, and there's a long waiting list. She and her husband have spent years hunting for one of those coveted $10 a day spots, which right now make up just over 10% of the 160,000 licensed childcare spaces in BC. I have found frustration and disappointment and overall lack of care spaces in the city of Surrey. That's because Surrey has a lower proportion of $10 a day sites compared to Vancouver. Surrey has $760 $10 a day child care spaces, while Vancouver has $3,800. Sis is paying $2,000 a month, y'all, for 2 kids. $2,000. That's more. That's almost the same as some of y'all's mortgages. So yes, sir. But it might be too late. Well, then so be it. I'm good. I'm okay. It's fine for me. Again, not everybody has the same mindset as me. But if I'm weighing, like I said, if I'm thinking about it logically, from a logical perspective, I have a child, my health's at risk, my body, they may grow up without me if there's any complications that occur. Not only that, if I make it past that time, then I have to worry about postpartum care. I have to worry about all those things. Then when they get of age, even 1 year, I only get 1 year maternity leave. And then after that, they have to go to daycare for $2,000 a month. She pays for 2 kids. Let's say I have 1 kid's probably half. Let's say $1,000 a month. 1,000 something a month. More than my car note. Way more than my car note. That's like rent right there. Mortgage, whatever. That's contribute. 1,000 is a lot. That's a lot of money right there. And then I have to care about I have to be responsible for them. All their needs, clothing, everything. They depend on me a lot. Yes, it's very highly rewarding for those who can and have the resources. But if I'm weighing out the risk assessment in my life, my life, it's not worth it for me. It's not. Not right now anyways. Maybe we could revisit this conversation in the future. And like I've said, and I've said it many times, there are many kids in this world who need that guidance that I can actually provide to them. If I don't have my biological children, it is okay. And let's say you do have a biological child, because some people think, oh yeah, legacy. How do you know that they're going to survive in this world? You don't know that. You don't know. So if you're going to have a child, have it because you actually feel called to have a child. And you can actually take care of your child and be there for your child. Not just to carry on your last name. There are going to be other people that can carry on your last name. Trust and believe me. Bloodline. You don't know when it's going to end. You can't control that. So if I'm looking at risk assessment, it would be better for some of us not to, in my opinion. Or be very careful who you have a child with. Definitely that.
It's fine. No, it's fine. I want to hear it. I like when someone brings statistical evidence, medical evidence, and people don't know to talk out their arse. Yeah. But what I'm also going to factor in is that no matter how much research you do, no matter how much medical evidence you have, there are always factors for people that go against that evidence. So, for the majority, I'm going to sit there and say, well done and thank you, you have enlightened us and informed us. You should sit on the panel. But for the individuals, no.
Can we just forget that she was also saying this about God's timing?
I spoke about religion earlier and no one mentioned anything to do with religion. No one cared about religion. So, again, there's the biological clock and there's the religious clock. As far as the religious clock goes, that could be any time. We've heard it. Some women are 70 having kids.
Can I say something here? I find
if you go and tell the medical doctor, based on religion and based on your research, which one should we go with?
I think he's uneducated, Joe. This sounds like the ramblings of an uneducated person. Continuing.
I think we should go with religion. Oh, yes, do it. I'm 70. I still haven't got a kid. Doctor, what do you prescribe?
Hello, motherfucker. If you go to villages...
Do I find it interesting?
Body's not real now.
I find it interesting.
In the westernized countries and stuff with all of the medication and stuff pumped out into you. When you go in the villages, the women are having babies up until 60. Because they're not going by what the statistics are saying. They're going by God and what God said.
It happens.
They're eating good. They women know how to cook and them things. They actually look after themselves very, very well. They can afford
She's not lying.
Good products and techniques.
She ain't lying.
Self-care is our top thing for big women. Remember I told you that? They look at what they eat, everything. So when you're seeing women having babies at 40 and that, they are actually fit and fertile. How it go? Do you understand what I'm saying? Yeah, you need to put some respect on their name. That's what you need to do.
When you're looking in the mirror, you're talking about you and your biological.
Basically, you're saying the new statistics don't make them the rule. It's the exception.
No, to be honest with you.
So you see, this is enlightening to me, because why are they so pressed? Having a baby must do. There's got to be more than just the bloodline going on with the man. Why are they so pressed for women to have their babies? They're so very passionate about this subject, y'all. Interesting.
I'll take on the statistics, yeah.
But you're saying don't make it the rule, make it the exception.
So you see how she's presenting these statistics? I'm going to take them on board. I'm not going to challenge her on them.
And all women read Proverbs 31.
Yeah. But at the same time...
I know why now. It's dawned on me. It's because they don't have to do anything. Minimal work. Just pump and dump. That's it. Yeah, let's play with daddy. And then you go about your business. Because trust me, if you know how much hard work goes into something, you'll be less inclined to do it. You're going to think twice. Think twice. That's why there's not that much work that goes into it. This is why, okay, let's use university as an example. This is why a lot of people drop out of university. One of the reasons. Some reasons could be other reasons. It could be financial, it could be different things. But if it's not financial, usually it's because the course load is too much, it's too overwhelming. Because you didn't realize how hard it was until you got into it, right? But they're not seeing that. Are they fathers? I don't think so. And if they are fathers, they're not active fathers. I can already see that. Because any parent who actually gives a damn about their kid and takes care of their kid, they're always going to say the same. I've heard it time and time again. They say, I love my child, but it's hard work. Don't have a child unless you're prepared financially and mentally. But these men are just yapping. They talk the talk, but they don't walk the walk. I guarantee you, if and when they do have kids, the tune is going to change. And they're not going to be responsible for that child's well-being, and care is going to be the mother. That's why they're talking a big game like this. This is exactly why.
These statistics are probably made by the same...
Muslims.
Wait, hold on. These are made by the same white men you didn't want to hear the statistics from earlier on. So I find it interesting. Women pick and choose when they want stats. If I start telling you stats about single mother homes, you guys are going to try to eat me up. Even though these are the stats, right? You pick and choose when we want to take stats seriously and who we want to take them from. But the fact remains, we generalize, we majoritarize, and we listen to stats. So I will take in the stats, yeah? But at the same time, if you want me to take on these stats, then you have to take on all the other stats as well, because they're there, right? And that's all I'm saying. So I'm not even going to argue, but at the same time, regardless of that, are you now going to take this on board and go say to young ladies to go do the opposite of what we said based upon this? Would you feel confident enough to go?
I'm confident. I am confident. I'm going to let y'all know right now. I'm very confident in what I said. Extremely confident. Extremely confident.
Do that, because I wouldn't.
Yeah, you wouldn't, because you're not responsible. Red flag. She would be the breadwinner and taking care of the kid. That's why. That's why you're so comfortable spewing that. For anybody that has to take a lot of responsibility, you're not going to want to do that. You're going to think twice.
Wait, Zilla's gonna speak.
And I noticed, sis right here, the biracial one, she's not talking at all. She's mighty quiet. She's mighty quiet. She only talked a few times. She spoke a few times and she's actually like, this conversation's a little too low vibrational for me. I'm gonna just chill in the cut.
This is not with your point, by the way. I just have
what
something
the fuck
to
is
say.
going on, fam?
I just have one thing to say. I just wanted to say it. This is just personal as well. Ladies, I find it weird if you're going outside and not sleeping with people because you're thinking about an imaginary man, what an imaginary man is going to think. Hold yourself virtuous for yourself.
Thank you, Zilla. You know, last time I kind of went into you a little bit, but yeah, this episode you're cooking. You and Cookie. I like you guys are actually thinking.
Do it for man. Don't sleep around because you have pride in yourself. You respect your own.
Thank you.
Not because this imaginary man in
exactly
is not going to like the
Thank
fact that
you.
your body count is on.
Exactly. I'm sorry. I couldn't even let her finish because she's cooking. Let's listen to her again. Yes, Zilla. Thank you, sis. Yes.
I just have one thing to say. I just wanted to say it. This is just personal as well. Ladies, I find it weird if you're going outside and not sleeping with people because you're thinking about an imaginary man, what an imaginary man is going to think. Hold yourself virtuous for yourself. Don't do it for man. Don't sleep around because you have pride in yourself. You respect your own body. Not because this imaginary man in 10, 15 years is not going to like the fact that your body count is on 11.
Okay, anyway. Go.
So
Well,
obviously...
who cut her off? Hold up. Who said, oh, anyway? Hold up.
Thinking about an imaginary man, what an imaginary man is going to think. Hold yourself virtuous for yourself. Don't do it for man. Don't sleep around because you have pride in yourself. You respect your own body. Yeah. Not because this imaginary man in 10, 15 years is not going to like the fact that your body count is on 11.
Okay, anyway. Go.
Red flag. Why you mean anyway? Maybe they cut it that way, but no, not anyway. Thank you, sis. Thank you. So her, Cookie, and homegirl, health professional. Good. Like they... Here we go.
So obviously you boys complain a lot and you talk a lot, but you don't take any accountability. Let me just...
I know I'm going like that. Let's perk up. Hold up. Let me read a few comments. Black men are so confident to talk when their demographic are the... That's what I'm saying. Too much mouth. Too much. They should be... But that's because... That's why I said, like, when you know how much responsibility goes into something, you're going to think twice. Women, protect your uterus. Amen, Sylvie. Amen. These men are like whoopee cushions full of air. Exactly, Mocha Island. Rosa, they are husband, no father, not educated, no degrees, but they talk the most. The most. The most. Let's continue. She about to come in, y'all. Okay, I'm going to brace ourselves. Let's brace ourselves. Whew, sis is about to cook because I know. I have a feeling I'm going to like what she said. We're going to have a standing ovation here. All right, let's go.
Tell you something. Hey. All the 5 of you right now, actually, you're not eligible. Yes, none of you are actually eligible bachelors for a woman of high quality in her prime years. How many of you, stop, let me finish. How many of you have got baby mothers? How many of you already in your 30s and not doing much?
How many of them got baby mothers for real? Why didn't she should have stopped right there?
Not probably being able to afford a woman, and then even sorry China, but you are getting older for a woman that is in her prime to have children with you. It's the fact. So the problem is, my point is, men are not taking accountability. Listen, men are not taking accountability for now being a community of unsuitable bachelors. So where is your accountability? Yes, I don't want to be with a man that's got 1, 2, 3 baby mothers. I don't want to be with a man that is 33, 34.
What you mean you got one? That's a red flag. That's one too many. That's one too many. You taking care of your kid? But you've been real quiet, so I'm not going to get on you too much. You better not talk. I need to hear how active of a father you are. And I'm talking about financially, not just showing up, hey, babe, let me play with my son. No, I ain't talking about that. Give me my son. I'm talking about financial and emotionally there. That's what we talking about here. Keep cooking, sis. Burn them all. You know what? Let's rewind. Rewind. I rewinded it for Zilla. We're gonna rewind it for sis here. Sis in the pink, hot pink sis.
So obviously you boys.
I knew she was gonna start cooking when she said, yeah. She was ready to let it blow.
Playing a line, you talk a lot, but you don't take any accountability. Let me tell you something. Hey. All the 5 of you right now, actually, you're not eligible. Yes, none of you are actually eligible bachelors for a woman of high quality in her prime years. How many of you, stop, let me finish. How many of you have got baby mothers? How many of you already in your 30s and not doing much and not probably being able to afford a woman? And then even, sorry China, but you are getting older for a woman that is in her prime to have children with you. It's the fact. So the problem is, my point is, men are not taking accountability.
Let me be guided today,
men are not taking accountability for now being a community of unsuitable bachelors. So where is your accountability for who you... Yes, I don't want to be with a man that's got 1, 1, 2, 3 baby mothers. I don't want to be with a man that is 33, 34, 35 and cannot sustain himself and a family. And I don't want to be with somebody that is much more older than me than above 10 years. That's a lot. So what do women do? Women have to wait and have their own back. You guys have let yourselves down. Stop blaming the girls. You as men are letting yourselves down, and we have to wait because you're not doing enough early. Before, men at the age of 25 were made men. You guys are 30 and above still talking about I'm not ready. I beg.
Yes, I don't like her, but
Round of applause. I would give a standing ovation, but I'm too lazy right now. Thank you, sis. Thank you. Wrap this up. Done. She ain't lying. Whole bunch of men talking nonsense. Body counts. Can't even. What do they? I need to know all their professions. How many? Whatever question she asked, we need to hear the answers. Let's see if they address it.
I hear her.
Am I allowed to speak? Am I allowed to speak?
Speak.
Am I allowed to speak?
No.
I'm gonna make sure
We don't need no girl to speak on this one. We can do this all by ourselves. We can do this.
No, you don't speak in.
Accountability and we need to be adaptable. We need to work around this. Work around this riffraff. That's what y'all gotta do. In the UK, work around this riffraff. Open up your options. Start taking applications elsewhere. This right here, they are not qualified.
Man, sit down, bro. Sit down. At the end of the day, yeah.
Wait, why are you telling a woman to sit down, bro? Red flag. You see how he's talking to a woman? This is what I'm saying. You can tell a lot about a man on how he treats other women around him. Something's wrong with him. Sit down, bro. Who he talking to? Who you talking to? You need to have respect for women. You have no respect for women. So I already know that you're trash. You've been trash. You always been trash. He doesn't respect women, y'all. So he's already, all of them disqualified, but especially him. He's a red pillar.
No, man, she's chatting shit, bro.
She's actually not chatting shit.
Whatever. No, you're entitled to think what you want.
There's a lot of young girls that are
Men who argue with women are dangerous, by the way. I'm just going to leave that out there. He's giving me vibes. Y'all know what that is. He needs to say, no, this is very problematic. The behavior, the demeanor. He can't even talk to a woman. Look at him already getting angry. And she didn't say him specifically. She said all of y'all. All of y'all. But you see how they're getting offended, upset. They can't control their emotional. They need emotional regulation classes. They don't know how to regulate their emotions. And then you want me to believe that these are going to be the best leaders of the household and of the community, pillars of the community? If they can't even take criticism from a woman, what makes you think they can take criticism from anyone? This is why they're in the condition that they are in today. And that's any man. But especially I'm talking about these men in particular, but that's any man. If he can't take criticism and he gets irate and angry at women like this, that's a big red flag, y'all. Big red flag.
I can't find a one.
Whoa, let me speak, bro.
Calling women bro. And he's qualified to speak on it. He shouldn't even be on this panel. But yet, here y'all go platforming him. There we go.
Fuck, man. This is very disappointing. Why are we getting triggered? The number's not even on the panel today.
Thank you. Cardo, thank you. Is he the one that made sense? I think he was the one who made sense. Why are you getting triggered? Exactly. This is a debate. It's a conversation. You can't even have a conversation. Even if people yell, even if people get upset, it's okay. You need to know how to keep your composure. You're not always going to have some great conversations with people, especially when you're on this type of platform. This is expected. Why is he getting upset? I don't understand. That's like me putting myself in a debate. I already know the environment that I'm going into. I know that there's going to be stuff said that will offend me. I need to know how to regulate my emotions enough to speak properly, eloquently, communication. We don't have to argue and yell. We can have conversations. But look at him. He's the new Ginger J. Is he gonna crash out? What's happening? Calm your tits. Sis.
Point to the nurse or doctor, whatever you are, yeah?
Excuse me? Oh, red flag! Nurse or doctor or whatever you are. She's more educated than you. You better put some respect on her name. She is a qualified health professional. You are not qualified for anything. You're not even a qualified trash man. This is what I'm talking about. Condescending tone, the dismissiveness, and yet he doesn't have an education. I can already tell. I can promise you he doesn't. Because if he did, he would know to respect her. And her qualifications, might I add. But yeah, oh, she's just a health, but her stats don't matter. Yeah, that's, like I said, do they not realize how much research goes into these type of things? Do you not... How many hours have we been on here? Okay, I'm going to try to wrap this up. I don't think they understand how much research goes into being a health professional, how much work goes into it, how many labs you have to go through. This woman is speaking from her experience, what she sees. And then she backed it up with data. You think she didn't have to research this for university, sir? The mind of the uneducated. The miseducation of the youth in the UK. The male youth anyways. Just stupid.
Yeah? You were talking about your 30, boom, 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 and all of this, and you're talking about God and God's timing, and that's lovely. Yeah? But at the end of the day, yeah, what have you been doing from 18 to 30? What have you been doing? That's the question I have to ask. That's just the question I'm asking.
Going to school. She's a health professional. Working. Doing what you haven't been doing. You sitting on podcasts talking nonsense. I'd say she's been doing very well. What about you? How about you, sir? What have you been contributing to society? She's actually contributing to society. Helping people get better. Helping people in their time of need. She actually is very instrumental into the system that is in the UK. Probably helping your family members. What are you doing? You're just talking on a mic. Spewing nonsense. You're not even educating people. I haven't heard any informative thing coming from neither of these men. The only one who seemed like he had some sense was the one in the blue jacket. That's it. The rest of y'all, nothing. And the dread guy, the guy with the dreads in the audience. That was yesterday. She's actually contributing to society. What are you doing?
Don't pipe
down.
It's not an attack. I'm asking you a regular question. What have you been doing?
Sis, please clear his ass. Clear him, please. I beg you, clear his ass.
Take it, and also...
She needs to answer.
I'm not done the question. I haven't finished my question. What the fuck? And also, let's not make it just about you. What do you think in general, from what you've seen out there, what are girls usually doing at them ages? What are they up to?
What I can see, just like there's different types of men with purpose, men with...
It's not about... The question wasn't about men. Okay. I'm asking you about women, bro.
There's just like there's good women, there's also bad women as well, right? I can confidently sit here and count in one hand how many people I've been with confidently. And I know that I can walk in any room and whoever I decide to settle with, he's going to be proud of me because of how I was raised and of my culture. So. And I also know of many women of that caliber. But I also have friends that live very different lives. Some people want marriage, some people don't. Some people want kids, some don't, right? So you can't generalize.
So in your opinion, do you think most of these women, who they haven't settled down and they've got to 30, 35, 40, they've only slept with like people, as many as 5 people in their life, in that time, from 18 to 30 or 35?
They might have not.
You think they're all living the same life as you, realistically?
I'm not, again, you said not.
It doesn't matter. I don't care if my doctor slept with 20 men before she came to work her shift. All I care about is if she's qualified enough to give me what I need. I don't give a damn what she does. And she could be doing whatever, getting buck wild in the club. I don't care. As long as when she comes into the hospital, if I need care, she's able to give it to me. That's all that matters to me. What does this have to do with anything? From 18 to 39 years old. I am the same as this woman. Same thing. Same thing. Same exact thing when she said on her hand. I told y'all that yesterday. And guess what? It doesn't even matter. I was just even telling you guys just as an example. Because my body count might be too high for somebody. It might be. They might be like, oh, that's too much. Too many men. And then for other men like my husband, they don't give a damn. Why does this matter in the conversation? She's saving lives. She's helping people. I don't care who she slept with. I could care less. And this is why this conversation is stupid. It's dumb. It's really dumb. But yet here we are.
Not to pinpoint it to me, right? But what I do know that a woman,
But you spoke about your five though, so you made it about you.
No, I made it about me because I'm saying that there
Why are they interrupting her? Again, all of them.
are good women out there that are selective of who they date. Now, to me,
I'm talking
body
about
count,
in general, though. In general, generalizing.
listen,
Yeah.
in general.
Hold on.
No,
You
listen,
three.
In general.
You three. Again.
No.
Can I please finish what I'm saying?
Yeah.
A woman that's of high value will choose like a partner on who is going to provide, protect, respectful, kind, God-fearing.
Oh, I love sis in the back. That's right, sis in the hot pink. Yes, y'all better clear them. You know why they getting madder? They're getting more upset. He's upset because it's one of the girls he would be attracted to. So he's like, no, you better reduce your qualification, reduce your standards. What about everybody else, not just you? Yeah, because he wants to date somebody like her. He's realizing that they don't want to date him. He's not qualified. Maybe to sleep with. But she's not going to marry you. At least I would hope not.
The number doesn't
That's not the question I asked
the number doesn't necessarily count in that aspect.
So why did you make a big deal about the five?
What she told you is she's
Why
going to
was
be
the five a
careful of
big
who
deal?
she lays in bed
Why was the five a big deal? Why was the five? Because she was like, I can count on one hand the amount of men.
because he said
Trust
that
me.
he made
Anything
this
up to five. So anything up to five.
If she wants to take pride in less than 5, let her take pride in less than 5. What's your problem?
Anyone up to five? Anyone up to five in the whole?
There are good women that choose who they lay in bed with. Some decide to be a little bit more laid back. It's on them. But my
So they're not good women.
there are good women,
Laid back is
and
not
there
good
are
women.
also women that are more open, and that's
Laid back is not good women.
I hate when women count. Women are hoes. Some women are hoes. Be honest.
Okay, then I'm a hoe. I'll just say I'm a hoe. Okay, and what? I'm a hoe if that makes you feel better. I'm a hoe. I'm a hoe. Been a hoe. Always been a hoe. Hoe. I am. Okay, and what? What about it? What about it? What about it? Exactly.
Some women sleep around. Like, so what we're doing is...
Okay,
so,
you three, 1 second.
Wait, come on, let us answer.
1 second.
It's a joke,
What's going to
bro.
happen?
No, you guys keep throwing stuff at us and you won't let us answer. It's a joke.
One out of the three of you is going to answer, yeah, to what has just been said. And then we're going to...
You didn't even answer the question. What do you mean?
King,
I'm answering
please,
nothing.
I beg.
What do you mean?
One of you is going to answer
You're a
right now.
joker,
And
bro.
then we're going to go back
Nah,
to
I'm not.
what? King, for goodness sake, you stop talking. There are some women that are ready and are young but just can't find a suitable bachelor because they're not ready, because they're outside.
They never
and
said
they're
that
having
we're
their
not
fun.
suitable.
So we're going to answer the one question here just to finish that off because you took us back to a place that we weren't.
She attacked us. Denova, like...
She didn't attack you. She was just making an observation. And then she provided evidence, but y'all don't want to accept it because you're stupid.
Bro, you should know better. Truth say now you got a little man now, yeah? Now you want to talk bare agrees. Like, bro, not too long ago, you was in the single pool, bro.
Who got a man? Who you talking about?
Just to finish that off, because you took us back to a place that we weren't.
She attacked us. Denova, like, bro, you should know better. Truth say now you got a little man now, yeah? Now you want to talk bare agrees. Like, bro, not too long ago, you was in the single pool, bro, yeah? So stop acting brand new. Second of all, yeah, women, it's easy for you to get dick. It's easy for you to find a guy that is going to be happy to be with you. The problem is you want a guy that's really good looking. You want a guy that's really tall, and you want a guy that's got expendable income. That's why you have problems. But there's a load of guys.
This is why. He's insecure. He's so insecure. And if somebody put that on their standard list, what about it? What about it? You don't qualify. That's why he's upset. I told y'all that's why he was more upset at the preference of the woman, the beautiful. All of them are beautiful, but that woman, the health professional, he's upset because he now. Oh dang! Even the preferences are starting to get a little bit picky. Yeah, we've elevated. Where have you been? Wake up.
Guys in your friend zone. There's a lot of guys in your DMs. There's a lot of guys at your supermarket.
Why do you care?
That want to be with you.
Okay, but we don't want them. And just like you don't want to. Okay, I could say the same thing. There's a lot of women out there, especially black ones, who would love to be with you, King Riches. Why are you not with them? Oh, but it's okay if you have standards based on colorism and superficial attributes, but not for women. Red flag. This is how stupid they are.
But you don't see them, bro. Yeah. So I don't want to hear no complaints, yeah? None.
I'm going to sit here and say that majority of young people, yeah, when we're talking about young men, yeah, we mature a lot slower than girls do, especially in our teenage years.
That's an excuse.
The problem is that by the time we get to the place, yeah,
it's an excuse.
Yeah, where we do reach a level of maturity, our level of maturity don't go.
That's not true. Again, let's circle it back to other countries. Them 25-year-olds, they already got careers, professions, everything. There are some 30-year-olds right now who are sitting pretty on money. 30-year-old men, might I add. They are out there. It's just that you lot, because I know that's the UK word, you lot, you think that everybody is the same because of your environment. That's all you've been exposed to. So that's what you're thinking is normal, but it's not. It's not. You are an embarrassment to the rest of the world. However, unfortunately, in your community in the UK, you're probably heroes. Unsung heroes. But to the rest of us, this is embarrassing. This is embarrassing. When are you going to grow up, Peter Pan? When are you going to be a man? Please let us know.
And what then happens is that we then respect this thing of stability, support, care, protection, and what you respect is a trip to Maldives. And what then happens here is that we then have to manage your emotions, we have to manage our emotions.
So you
have to
hold
on, motherfucker!
You put me! You put it all back on nothing.
No. What I did was I gave you your props, and then I brought mine back in. Because the reality is that when we look at y'all motherfuckers...
You know why we going to the Maldives? Because we can afford it. You can't. That's why you mad. You're mad. You can't afford the trips. You're mad. Shout out to the girls who go on girl trips, by the way. You single, you living your life, you're doing what needs to be done. Go and live your life, sis. This is why. They're mad because you're actually putting time into yourself. You're educating yourself. You're getting better. And they're understanding that they don't qualify anymore. So what are they going to try to do? Trap you with a baby. Notice, this whole conversation is about babies and not marriage. They're upset. This is what's happening, y'all.
You do not hold the same level of responsibility that I do.
Is that why
I have to manage my emotions, my expectations, and your own, because majority of y'all motherfuckers don't want to run a household.
So
you don't even know wait.
Why would you? What? What is he talking about? Running a household? What is he talking about? Does he have a wife?
Takes to run a household.
So Gabs.
So when you're talking about this thing of,
we don't know what it takes to run a household. What that mean? Like your mama did? Red flag. You see, they want you to be like their mother, laboring and muling. That's what he wants. And trust and believe, I'm just highlighting this conversation, but this can be found in a lot of other races of men. This is a character flaw. If you see a man talking like this and talking like them, but maybe he may not be the same color, but he's talking like this, run. Run as fast as you can. Be like Sonic the Hedgehog. Just run. Speed it up. No, Roadrunner. Bleep. Remember, meet me. You're going to be like Roadrunner.
No. What we're talking here is very simple. I'm a man. I provide. I do certain things in a certain kind of way. What then happens is you not often don't like that because it's quite boring for a little girl. And when you go...
Is he married? What's he talking about?
Instagram and Love and Hip Hop Atlanta and Kim Kardashian, all this other shit, making yourself believe these different things. You come back to strong men and you tell us that we're not good enough. So then what then happens is that we're not good enough. We then say, fuck y'all.
Do you think...
You're not good enough. You're not.
Wait, calm down. 1 minute.
She is entitled to say we're not good enough for her.
1 minute.
That's fine. But sorry, mama.
That's because you lot want to go for younger girls. Why you're saying they can't run a household?
No. Elder girl, we was just here today. We looked at this. We looked at the situation.
See, I'm happy sis said that. You see, she was thinking, she was observing. Yeah. You want younger girls and then you want them to be mature like women. Red flag. That's that mindset, y'all. The archetype of a Dusty. Best believe it's not just black men. I'm just highlighting them because it's just what I found. But best believe they have a similar pattern. The dust mite. We might need to do a whole case study on a dust mite man. That'll be a live stream though, because I talk a lot.
Situation, and we looked at all the girls and asked them how many of them live on their own, motherfucker.
Babs, you're not listening.
How many live on their own? How many of them are responsible?
I just need you to listen to Tariq.
I lived on my own and I was responsible for many years. I left my parents' house at 18. Stayed with family for like a year and a half. Got my own place at 21. Around 21. I was alone for many a years. Yeah. Paying my own bills. Nobody tricked on me nothing. Shout out to us who do that. Pay our own bills, pay our own way. And if you don't, that's okay. Don't feel embarrassed. But he's trying to make it seem like everybody is on that wavelength. I don't know what he's talking about. And I'm sure there's women in the UK who are paying their own flats. What the hell is he talking about? Again, environment.
I just heard you, though. Okay, say it again. Say it. Tell me, Shrew.
I was saying, you're saying the girls that you're ready to marry, you do everything, they're not even ready. They can't even run a household.
Yes, you can't manage yourself.
Every girl I know in my age group knows how to run a household.
Yeah.
What you lot said earlier is you're going dating younger. Like,
hello. They said about younger girls. I like mature.
Let me finish. Maybe the younger girls don't know how to run a household. This whole generation is changed.
He said that.
Yeah, I know.
I feel like there needs to be more be what you seek. You need to be what you seek.
Finally, sis. Yes, thank you. Some common sense.
Within, everyone's looking at the opposite person.
Mm-hmm.
Once you work on your inner, you attract that anyway. That's why they say you're a wife before you're a wife. Do you understand what I'm saying? Even with the body count question, sometimes people are asking you certain questions. When you've got a certain aura, you don't even get those questions asked.
Thank you. Thank you. I told y'all. It doesn't matter to a person who has this. They don't care about that. Like I said, I don't care what you do in your extracurricular. If you gonna be with me, like that's what I qualifications before my husband came along, of course. I need to know, are you healthy? Do you have any STDs that I need to know about? Or any incurable diseases I need to know about? That's what I care about. More than your body count. Like I said, everybody got a past. A lot of people have a past. I prefer to date a man who has only dated women. That's my preference. Have you only dated women? Yes. That's what I care about. You making good money? Did you get an education? We're going to talk through these things. That's more important than the body count.
How about that? You know them ones there? That's what we need to do. There's too much underqualified men speaking on wives when they're not even ready to be husbands. I'm just saying. I don't know if anyone's bank account is enough to do all that providing, mortgage, all of these things.
She got hit by the ghost of the pieces. I think that spirit, that energy was spreading throughout. The energy, oh, look at them. Look, he mad. He's angry. I love this conversation. Yes, sis. At first, I had no hope for you, sis. A little bit. You was starting to get a little shifty. But yes, you closed off on a good note. Love it. Love this.
And all of them things there. When you're able to can do those things, do you understand what I'm saying? Then you can enter the conversation fully with your chest. Do you understand what I'm saying? Until then, you allow it. That's it. That's what I'll say. Women,
Don't make nobody tell you when it's too late. Although there is, we have to work with time. Like I said, what you said, the nurse, I love it.
They're laughing.
I love what you said. Can't remember. Yeah, man, you're the OG. How can I not forget your name? Big up Lucas. But yeah, I loved what you lot said. We know about God and time, but knowledge, people, knowledge. And look at your surroundings where you are. Don't be taking advice from somebody that can't even do that. Do you understand what I'm saying? That's it, really.
Life is not a race. Don't rush into things. Do it in your own time and trust in God, please.
Yes, you can do anything at any given time, but at the same time, you cannot. Don't let people gas you up.
Bye. Goodbye. We don't need that. We don't need to hear what you got to say. Bye. Good night. Good night. Bye. Oh, yeah. Bye. 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 I'm done. And we ain't want to hear all that. Mavro said, I've lived on my own in multiple countries since I was 18. What is he talking? Exactly. They so sassy, sis. Too sassy. Too much. How much time we got? Dang, I wanted to finish all these videos. Okay. Oh, this is 15 minutes. This is too long. Okay, you know what? Let's play this one. The AI conversation is going to happen another time. We'll save that for another live stream. Let's end on a good note, y'all. We need a palate cleanse. This is the last video, and then I'm going to bid you guys adieu. We going to leave. Adieu. I don't know how to say it. Goodbye. Let's watch this video as a palate cleanse. Last week, we watched the Travel Abroad or Move Abroad. Today, we're going to watch money lessons from self-made millionaires, guys, who retired in their 30s. Now, again, this is not to say that you have to be a millionaire, but at least, hell, if they could give us some tips on how to save money and how they were able to do it, then we might be well on our way to getting financial freedom. All right, let's continue if we haven't reached that place yet. And for those of you who have, awesome. Keep going at it. Retain your income. Don't mess with the dust mites. I need a spray. I'm going to start bringing some bug spray. Just spraying my screen. We need to clear the energy. Where's my incense? I ain't got no incense in here. I wish I had incense. I'll just spray it. I feel like that energy infiltrated this room. Let me go outside and make sure that there's no dust. I'm allergic to the dust. I feel like it infiltrated my room. Whew. I need a palate cleanse. Let's do this, yo.
All right, this is exciting.
Oh my gosh. Okay.
I got it.
You got
I got my thing. All right, here we go. I retired early at age 29.
I left my job at 40 years old.
I retired early at the age of 31.
I left my job at 32 years old because I wanted to spend more time with my husband.
I realized that there's a lot more to life than work. In the US, we typically think of retirement as something like maybe 65, maybe 70 years old. In reality, retirement is just a number that you reach. My net worth is currently at $900,000.
Over $5 million.
$1.2 million.
What is our number?
1.6.
What is it? Yeah. Oh my god. I'm like blushing.
When was this published? 5 days ago, guys. Right on time. Right on time. Let's look how other races of people are thinking about money.
I'm the middle of 5 kids and a single mom living in a homeless shelter.
See, she came from humble beginnings, y'all. Humble beginnings. Humble beginnings. Single mother. Remember they was talking all, spewing all that rhetoric?
Many times having no car, using a lot of public transportation, sometimes not having enough to eat, living off food stamps. I wanted to get out of poverty. That was a big goal for me.
I think the biggest financial struggle that I personally went through was going to college. I didn't have any help from family. I was a waitress for part of my college.
That's a reality for a lot of us. So if you have parents that have been able to help you and that have paid off your education, you should go hug your parents. Call them right now. Say, I love you. Thank you, mom and dad. Thank you. Say that to them. Because a lot of us didn't have that. Not saying that they wouldn't have done it. My parents didn't have the resources for it. So a lot of us have to pay our way through college, especially if you went to the college in the U.S. Shout out to you, because your tuition is astronomical compared to ours. Ours is still a bit expensive. I'm talking about outside of Quebec. In Quebec, I paid the cheapest tuition. But when I went to Ontario and I had to finish school, I paid a pretty hefty amount, but not like y'all. Yeah, mine was definitely not even anywhere close to the U.S.'s amount. But anyways, let's continue this. This is going to be very inspiring, y'all.
College career, I was working like full-time while also being a full-time student.
My dad was a teacher. My mom was a nurse. We didn't have a lot of extra money. My parents prioritized our education, and that meant that we had to cut costs elsewhere.
My parents did not feel like they got a great financial education from their parents. My dad was very open of, hey, son, you've got to learn about compound interest. You've got to learn about investments. You've got to learn about these things.
So back then I was 22 and I started my job. I definitely was not focusing on retirement or saving. So I did spend a majority of my paycheck, didn't have a lot of savings outside of the 401k investing.
In fact, I really didn't want to tell a lot of my friends what I was reading, or because I was a little embarrassed. It was, not the comic books or not the other things that they were reading.
I started working nonprofit because I really cared about my community and I wanted to give back to my community. Quickly realized that working a nonprofit, you're literally one paycheck, maybe two paychecks away from being on the street too.
Mm-hmm. Yeah, because they don't have funding, y'all. They don't get a lot of funding. And they are literally depending on the funding of donors. That's the problem. And if the economy gets tight, even if you want to give, you don't have enough money to give, you're going to cancel your contribution. So that's the issue. But I'm really liking this so far because they are basically letting us know that they did not come from a rich background. They came from a normal working class background. And I can assume all of them are educated based on what they're saying. They had to go to school, pay through school, all that stuff. So let's hear how they got to their millions.
I thought, well, let me go into sales.
I was a logistics manager for 10 years.
I worked in marketing before retiring.
I spent my career as a physics teacher.
I worked corporate finance.
I just didn't want to do that same thing over and over again.
I never really could unplug.
Having to meet new sales goals every month and just pushing myself every month to just survive.
I never hated any of my jobs, but I'm like, do I really want to do this every day, 8 hours a day for the next 40 years? And the answer to that would be definitely not.
No, that wasn't the thing for me.
I remember one particular day that was very crushing.
I love the jacket.
I was away on travel for work. My wife was going through some struggles on her own, and I realized that I wasn't able to be there for her, and that really hurt. And when I came home, I really decided that it was time to make a change.
Cheers.
What did he say? Let's go back. Hold on, sorry, y'all. I gotta hear what he said.
Not.
No, that wasn't the thing for me.
I remember one particular day that was very crushing.
I love the jacket.
I was away on travel for work. My wife was going through some struggles on her own, and I realized that I wasn't able to be there for her.
This is a man who loves his wife, y'all. On a work trip, he's worried about his wife and her well-being. Green flag. This is the type of man we talking about here. Not worried about body count. Did she go on a girl's trip? What you doing on a girl's trip? He's thinking. He was like, dang, I gotta be away from my wife. I feel like we should have a better financial future. Let me get this started. Let me start thinking of other options. This is not real life. He's thinking about his wife and their future together. This is husband material, y'all. Right here. He's not worried about himself. He's worried about his wife while he's on a work trip. He wished that he could have time to be with her. That's what propelled him try to get financially independent, is to spend more time with her.
And that really hurt. And when I came home, I really decided that it was time to make a change.
Okay.
For his wife, y'all. This is a real man right here. They're out there. They exist. Look at him. He did it for his wife. It hurt him to see her hurt. This is when you know somebody loves you. He's hurt seeing her suffer and struggle. It's hurting him.
Cheers.
found out about the FIRE movement, and it really changed my life. FIRE stands for Financial Independence Retire Early, and it's essentially getting yourself to a position financially where work becomes optional.
It doesn't mean that you will never do any work ever again.
It's a math equation.
Whatever you spend in a year, you need 25 times that amount invested. Then you can reliably pull 4% of that portfolio's original value out of it every year. You'll never run out of money.
And it just comes down to what is...
Let me listen to these men. Hold up. Let me perk up, y'all. Let's listen. FIRE. Hold up. All right. These are the videos I need to pay attention to. All right. Sorry, y'all. I had to focus because I'm really paying attention. I'm not joking.
Your life cost, and how do you support that with your passive income that no longer is dependent on your job? The most impactful decisions early on were just saving and investing as much as I possibly could. Starting out, I was maxing out my 401k and maxing out my Roth IRA because I could.
Low housing expenses is number one. Number two, we've always shared one used car between us. Even now, we only own one vehicle.
The other piece has been willing to work and work a lot. I worked at 2 to 3 jobs at any given time.
Number three, just cooking at home, avoiding dining out. And
Notice it's the men talking about working. I don't hear none of the women. They're working too, don't get me wrong, but they're saying 2, 3 jobs. They're the ones that are leading the charge. Don't just focus on race. I want to make that very clear. But there is a correlation, I must say. Even I can admit that. There's definitely, when we talking about the collective, here you go. That's the representation here. So, I'm not saying that there aren't black men out there who do that. Let's be clear. I want to make that very clear. But at least here, what I'm hearing is that the men are the ones who are taking charge of this whole financial FIRE movement. And the women are on board supporting them and contributing, of course. But the men are the ones doing all the labor.
For just delaying, if you want to have kids or have pets or any dependents.
Oh, let's go back. This is very important. Okay, let's go back to the tips. If you're in the U.S., here we go. That's for you. We don't have Roth IRA. We have RRSP. Anyways, they're talking about tax shelter and retirement accounts. That's what they're talking about. Maxing them out. Okay, let's continue.
Dependent on your job. The most impactful decisions early on were just saving and investing as much as I possibly could. Starting out, I was maxing out my 401k and maxing out my Roth IRA because I could.
Low housing expenses is number one.
All right, low housing. All right, I'm listening, taking notes.
Number two, we've always shared one used car between us.
Yep.
Even now, we only own one.
We only have one vehicle.
The other
Same.
piece has been willing to work and work a lot. I worked at 2 to 3 jobs at any given time.
Number three, just cooking at home, avoiding dining out.
Okay.
And number four, just delaying if you want to have kids or have pets or any dependents.
So they ain't got no kids or pets. There you go. Delaying. So he's basically on the same train that I'm on. It's like it's not off the table, but when it makes sense, if they are able to, they will do it. But then if they can't, then they won't. It's not going to be a make or break for them. Because they realize that they have to live the rest of their life. So do you want to live your life comfortably, or do you want to just pile on to the debt? I have to be realistic, y'all.
Of any kind, just delaying that a little bit further down the line in life.
I went to an inexpensive, church-sponsored Brigham Young University school. That was very critical. So no debt when I graduated, and had been working all through college at various jobs.
I went to college.
It wasn't until later that I really found out about brokerage account investing and how powerful just simple index fund investing is. So instead of trying to pick the hot stock, you just pick an index fund that essentially tracks an index with the market. And for most within the FIRE community, that's VTSAX, or the total stock market index. And for
What is it? Hold on, I'm writing this down for real, y'all. I'm not joking. VTSAX. What he said? VTSAX. Let me write that down. I gotta research this. VTSAX. Index funds. Okay, we get into it. Thank you, brother.
For others, it's the S&P 500, and that's the one that I primarily do.
Sometimes those early years were hard because it was like, man, I'd only make a few grand this month, but I'm putting 500 away or 1,000 away this month.
I was investing and saving, 30% of my income and putting that towards my future, which was extremely important and really set me up for that path on fire.
We chose a slightly different path. We did real estate or house hacking specifically. We eliminated our biggest expense, which was housing. And it really depends on how comfortable they are with living with roommates or basements or making sacrifices to.
I wouldn't recommend it if you know how you are. If you know how you are, I know how I can't have roommates, y'all. I just know how I am. I'd rather live in a studio. So if you know your ways, you know how you are, you nitpicky, we need less of y'all having roommates. Please do not do it. Stop it. Do us all a favor. I know how I am, so I knew I could never have a roommate. That's just me. I cannot do that. That's not my life, my personality. However, for those who can do. So to circumvent this, I highly recommend you look into studio apartments or those. I wouldn't live with the shared housing, me personally speaking, but that's just my personality. If you're okay living with other folks, at least live with folks you know, is what I would say.
You maximize your return.
And 2-bed, 1-bed, 2-bed, 2-bath up here, 2-bed, 1-bath down here.
We purchased a fourplex in August 2017 for $630,000. We rented out their other units, and we were able to save up that $18,000 for that second one. It's like a savings account for number 2 without having to change your job or ask for raises or.
This might be difficult if you're in Canada. Our housing prices are way too high. However, if you're in a city, even in California, I know some of you guys are on the West Coast, this might not work for you right now, but maybe you can look into other alternatives. I'm actually looking into buying vacation homes, cottages, stuff like that. You could look into different things, renting things out. I mean, sky's the limit. There are different type of housing options, right? But real estate might not be. I like the fact that they're diversifying these people's experiences. Like the one before, he did the stock market. This one's doing real estate, so we're going to hear the rest of them.
Reduce your other expenses. We wanted to enjoy life. We didn't want to just minimize everything and try to scrape by.
Eating like ramen noodles every night or something. We didn't want to do that. We did cut back on a lot of things. Jeff ended up selling his beautiful sports car, and he ended up using a lot of public transportation, and I would drive him to and from work sometimes too. I was willing to live in one house with 7 other dudes sharing one bathroom.
Hell no, red flag. Oh, no, sis, Sis, you better than me. You see, she's the Lord's strongest soldiers. She was gonna live with 7 other dudes in one bathroom. Sis, nah. See, you don't have to go through this extent, y'all. You can circumvent around it. Please don't do that. I wouldn't even live with seven other women. I wouldn't do it. I'm not living with 7 other people. Not willingly anyway.
I was fine with that. But there are certain things that, feminine things that you just want to do, want to have.
Did you have any? Yeah, that's why I stopped getting my eyebrows threaded. You see, y'all see, they're a little wild, but I just, I kind of cut them a little bit. But I'm overdue for an appointment. I do have to get them done soon because they're out of control now. But yeah, that's why I got locks too. It's just simpler, cheaper.
Challenges at all along the way?
I'd say that very first one, everything that could go wrong with the place went wrong in that place. Okay, we have 8 people living in the basement unit with no lease, paying the old owner cash, mold issues, cockroaches, bed bugs. The faucet was broken off.
I was working so hard in my job, but I was worried that
Did you have any challenges at all along the way?
I'd say that very first one, everything that could go wrong with the place went wrong in that place. Okay, we have 8 people living in the basement unit with no lease.
Red flag!
Paying the old owner cash.
Red flag!
Mold issues.
Red flag!
Cockroaches.
Red flag! Cockroaches and bed bugs. Red flag. So you got bloodsuckers and you have critters. Oh, hell nah. Wait, y'all inherited that property? Nah. But you know what? They learned from it. It couldn't be me, though. Who was living that? Wait, they said they lived there? Hold up. I gotta go run this back. Run it back.
Did you have any challenges at all along the way?
He did all that to get to the million. Nah, get me up. I'm gonna do what the first guy did. All he did was invest in index funds, put in his Roth IRA, 401k. I'll find the Canadian equivalent. We not struggling, y'all. What is this?
I'd say that very first one, everything that could go wrong with the place went wrong in that place. Okay, we have 8 people living in the basement unit with no lease, paying the old owner cash, mold issues, cockroaches, bed bugs. The faucet was broke.
Oh, okay. They bought the house in that condition. I thought they lived through that. I was about to say, nah, no ma'am. I'm not doing all that. Oh, so they inherited a slum house. Is that what they're saying? That guy was I have a feeling I know. I know exactly what this is. I'm going to shut my mouth. Let me be quiet. But I know exactly who was living in there. I'm just going to leave it that way. Y'all better not say nothing in them comments. I don't want people coming after me. I know who was living in that basement. I have a feeling. Paying the rent to the previous owner, bed bugs and roaches, 8 people. Yeah, I already know. But if they had to live in that condition, you already know. Times are rough, man. I can't even laugh about that. Times are tough. So they had to make it work. That's how they do.
Getting off.
I was working so hard in my job, but I was worried that I wasn't really enjoying myself and my life now.
We didn't really know how much things cost. We didn't know like the steps to go through an eviction. Like we had to find a property.
Oh, they had, they bought the house and they didn't realize that those folks was living down there. They probably was just too excited. It was their first home. This usually happens with the first home. When people buy a first home, they always have experiences of things they should have done, could have done. They had to evict them people. Oh man, dang. But bed bugs and roaches? 8 people in a basement suite? This is illegal. This is a hazard, y'all. Not demolition time. What they call it? They need to get forcefully evicted. This is a public health issue. They needed to tent that whole house.
Manager for a lease, we had to go through all these extra like learning curve moments where it was such a big hurdle mentally, and it was just an overwhelming amount of effort. And
oh yeah, I knew it. I knew it. I had a feeling. I already know. Anyways, I'm gonna keep my mouth shut. But to be honest with you, that's why it was so cheap. That's why. Because I was wondering, $600,000 for that type of house is because they had all those issues and the guy probably just wanted to sell the house.
Time invested and mental stress, I would say, just to get over that hurdle.
I think the thing that turned out to be harder about retiring early is your sense of identity. It's who you really are. You have a lot more time to think about those things. And, for most people, your job is a big part of your identity.
I like this guy. He's so sweet. Come and garden for me. I need somebody to come help me with my garden. My husband gave up on me. He just does the plants in the house. But I need to take his tips. I hope he has a YouTube channel for gardening. I need gardening tips. There was one of you guys in the chat that said you were gardening. I couldn't talk to you more in depth because I was on a time crunch. We need to talk about that.
It does bring a sense of fulfillment and purpose. It's not just the money, but it's the interaction, it's the leadership, it's watching and enjoying other people grow.
I do miss my coworkers. I miss spending time with them.
No, I'm
and
good.
I miss the adventures that we would have and the laughs that we would share.
It's a lot easier to like see your friends every day at work. Now I have to like, okay, when are you free? When can you get like a sitter for the kids? And like, you know, it's a whole coordinated thing. You at least get that FaceTime with them that I do feel like it's a little harder to coordinate nowadays with most people still working.
If today you had to start over again, what are the things that you would do differently?
We would probably get a divorce. We would actually be able to reach financial independence quicker, and then we would both buy a house once a year separately, and then...
Wait, what? What did sis just say? Hold up. Sorry, I know I keep rewinding. This one is pretty interesting.
Most people still working.
If today you...
This couple has a lot of interesting things going on. What is going on? First, they done had to evict people, had the whole slumlord situation. And then now, what did she say?
You had to start over again. What are the things that you would do differently?
We would probably get a divorce.
Get a divorce?
Actually be able to reach financial independence quicker, and then we would both buy a house once a year separately.
What? We would get a divorce. Reach financial... What did she say? Hold up.
Most people still working.
If today you had to start over again, what are the things that you would do differently?
We would probably get a divorce.
Okay.
We would actually be able to reach financial independence quicker.
How is that possible? Something ain't right here. Did they both have a lot of debt? They must have had a lot of debt. Ain't no way. How can you reach financial independence quicker being single than married? Somebody had debt, y'all. Somebody had debt. That's why they had to go and live with the roommates. Yeah. In their situation, it probably would have made more sense for them to be single and reach financial independence. But that doesn't make sense.
And then we would both buy a house once.
How could you buy? You can't. Where do they live? That's what I need to know. You can't buy a house in Canada by yourself. It's almost nearly impossible. You buy a condo. Yes. Not a house, sis. In the U.S., in many states, you cannot buy a house alone. Unless you make a lot of income or you have time to save. But I think I understand what she's saying. So I'm assuming that he had some debt, or one of them, whoever, somebody had a lot of debt and they couldn't save as much as they wanted to.
Once a year separately, and then remarry. So we would actually make it a lot faster.
Yeah,
One of the mistakes I
that doesn't make sense. Somebody had debt.
made really early on was trusting the wrong people with our investment choices. That is, we went to the bank and spoke to an investment advisor there, who we later learned was motivated only by making a commission on the investments that they sold to us. And so rather than giving us unbiased advice, they gave us slanted advice and sold us into a mutual fund that we had no business being in at age 22
He's
at
right.
the time, had very high fees on it. Luckily, we undid that mistake pretty quickly.
You need to have financial literacy. And again, I play those things in my videos, but maybe next week I'll do something. I don't know. I'll figure out in a future stream. Please start smartening, wisening up, and learning different things.
Or to go back and do it again, I probably would invest a lot more heavily in my brokerage account versus my traditional retirement accounts.
I always have regrets of maybe not saving more because I've seen what that has turned into 15 and 20 years later now in my life. But you live and you learn and you try to make the best decisions you can at the time.
That's something I'm trying to spread awareness on because most people only know about investing for retirement. They don't know about investing for early retirement or just financial independence.
What would be your advice for other couples considering this journey together?
Just start on this finance stuff early.
I would definitely advise them to talk about their non-negotiables, to talk about what they are willing to sacrifice.
Oh, sis, yeah. Something ain't right about this couple. I think he has something going on. That's why she said what she said, because that doesn't make sense logically. So that's letting me know that it took him a while to get to where they need to be.
Honest with themselves and each other is super important.
I think it's really important to have a really good plan of what you're going to retire to. And maybe that isn't working at all. Maybe it is hobbies, volunteering, other things that you've always wanted to do, traveling. Maybe it does include starting up a small business.
And you know what? He's single. It looks like he doesn't have a partner. So it's possible, y'all. It is very possible. That's why he was saying he had to work 2 to 3 jobs and do all that stuff. I get it now.
That business or something you can do from your house or wherever you are in the world. But I think having that plan in place is really important. You think you're going to have all these friends and people are going to be just as available as you are. And most of the time, at least if you're in your 30s, that's not the case. Everybody still is kind of plugging away. I retired.
Oh, he has kids. Oh, my bad. Yeah, never mind. I thought he was single. But still, I think it is quite possible. In my opinion, you're gonna have to make a lot of sacrifices is all. You have to make a lot of sacrifices.
And decided to go back to work to stay busy and engaged. I'm a goer, a doer, and I work and function much better in that environment than I do in an environment where my calendar is completely cleared. I don't long for the day anymore at all that I can go say that I'm retired again. I also didn't want my kids to think that this was what life was.
The crazy thing about reaching early retirement is you find that you're still making money just doing little things for fun here and there. We decided to start a company with a business partner. It's a college tutoring company, and that's now bringing in this whole new wave of money toward us.
Yeah, you have more time to be creative. That's what it is.
For me, the time and energy that I have now to focus on what matters most to me is worth it all.
We're still bringing in, between a few different side hustles, over $100,000 a year combined.
We own 9 properties and 16 units total. We're collecting about $14,000 per month, or $168,000.
Notice they all together with somebody. They all partnered up. I thought the guy was single, but he's not. And he has children. So it's possible with children too.
$1 per year.
Right now, my 401k and Roth IRA is around $500,000. It's going to continue to grow and compound on its own. So that's a very freeing feeling.
We live in a paid off house. Our spending's a little higher than it used to be. It's probably in like the $30,000 to $40,000 a year range. So that's still good for our investments to support on their own.
Our houses are our children, our kids.
Sometimes they act up and we got to discipline them, but overall, it's been a fun journey.
What does the future hold for you now?
One of the great things about having the time that we have now in early retirement is choosing what new adventure we're going to be on.
Now we're able to have a lot more time to focus on travel and getting out and exploring the world, both internationally as well as within the US.
We're probably traveling about 3 to 6 months every year nowadays. We were in Australia for 3 months. We were in Iceland for a month. We go to...
Again, this was published 5 days ago. Let that sink in.
To Canada a bunch in our camper van.
We want to see all of the national parks, and we want to go to all 7 continents.
We still take time to set other goals like learning a new language together or starting a business or, whatever it may be. And that keeps us going, keeps us having fun and doing something new and interesting and challenging every day.
When you don't have anything on your calendar, you can wake up at any time you want. You can do whatever you want. We can go on a bike ride. We can take a nap. We can watch the Tour de France.
I'm happy to be outside the matrix and just enjoying this other life.
The world becomes the oyster in the sense of trying to figure out what you want to do and at what time you're going to do it.
Not a day goes by that we don't go take a hour-long walk on the beach.
It's one of my favorite purposes is getting our story out or telling them about our story, telling them that it's possible. I don't have a real estate background. I don't come from, wealth. I don't come from that mindset where you can retire early or where you're a landlord or just anything like that. And the fact that what I wanted was a better life for myself and I was able to earn that, then it's awesome.
At the end of the day, worst case scenario, I go back to working a traditional job, but that's not what I plan on doing.
I forgot to include Jen.
All right, that's it, y'all. They done gave us some tips. It's a wrap. So even with like all of the uncertainty that's going on, even with all of that, there's still people out there making it. I'm going to read a few comments and then we're out for today. Today was a long day. Look at my hair. My hair is Today was very eventful. It started off tragically, but I'm glad we did this palate cleanse, y'all. The palate cleanser. It cheered me right up. Okay. Ooh, let me read a few. Okay, I'm going to start here. Sylvie said the financial diet is women run and she has an interesting critique about the FIRE movement. Oh, okay. Financial diet. Does she have a video? Okay, so you know what? I love these type of conversations because let me research the financial diet. And then we're going to talk about that next Sunday. What is it? Women run. Okay. Let's figure this out. We going to watch it. And then I'm going to talk about parasocial relationships next Saturday. So at least I got some new topics. Yeah, keep these conversations coming. That is it does cause bad health, mold. Being a landlord is hard work. Do the end. Exactly. Thank you, Sylvie. That's what I'm saying. It depends on what works for you. That's why I was saying some people, they can do the real estate thing. I personally can't. I don't have time to be going around looking for. I'd rather invest in real estate than to have too many properties. I just want a home. That's it. Home for us. And then maybe a vacation home or something. I like vacation homes too, home away from home. But other than that, I don't really need that many houses. I don't like the control stuff. It's very exhausting, y'all. Tenants are not that great. Tenants are not that great. You love Chelsea? Okay. We'll do the financial diet next Sunday because I don't know who that is. I've never heard of her. So y'all are giving me content to do. I need to review it. There are actual programs for single first-time home buyers to get grants. Yes, Mocha Island, please let them know. In Canada, they got rid of all the programs. We don't have it anymore. At least in my province. And the country we used to have the first-time home buyer plan. They got rid of it. They scrapped it. I don't even know if they replaced it with something else. It's really sad. BC used to have a first-time home buyer thing too. Gone. Everything's gone. They used to help you with your down payment. Gone. Yeah, in Canada it's a little different for us. We're struggling. But in the US, if you guys have, or wherever you are, Mocha Island, if you guys have the first time home buyer program, please take advantage of it. 100%. 100%. Okay, Chelsea. Okay, y'all letting me know. Okay, next Sunday let's dig into financial diet cuz I have no idea who she is. I have no clue who she is. So I'm gonna figure out who she is now. 2000 to 2010 economy was pretty easy to have a loan at a low interest. Yes, it was. 100%. That was a golden time. I'd have missed it. I missed it. You see, when King Richards was talking about, you miss, what about all those men that you miss? You know what I miss? You know what I regret? Not investing at that time. That's what I regret. I don't care about no damn boyfriend or husband, whatever. I didn't care about that at that time. In 2010, I was how old? I was 24. Still okay. I could have made something shake. But I didn't have that knowledge. I didn't know. Now that I'm older, I know, but I got to start from where I'm at, right? But if you're younger and you know now, you can start little by little. They don't have the same difficulties with banks and institutions. Yeah, that is a barrier too. Yep, you have to lock in 100%, Rosa. That girl from yonder, you said, this shit ain't for me. Life's too short. I would love to have all the recreational time and free time to live my life and have a generous passive income. But through this way, no. Yeah, and it doesn't work for everyone. It's very restrictive. But everything doesn't work for everyone. But I will say that you have to be highly disciplined to do this type of system, like you said. It's like the Dave Ramsey program, too. Like, he's very, like, get rid of everything. Like, no free, you can't have fun. Like, you gotta really lock in to get debt free. So it really depends on your level of comfortability. But there's other ways. It'll probably just take you a little bit more time, depending, but you can still get there. You don't have to follow that route. So it's definitely a-okay. Just a difference of opinion. At the Dep Studio, you said it's interesting how the other side of the aisle thinks about life and relationships and money and the things that they focus on. Thank you for this palate cleanser, Romy, because it really highlights the differences between the communities. I personally like investing. Slow and steady diversified investments win the race. Being debt free helps a lot. Yes, sis. 100%. Debt free is what we should say right now. So let me leave this. We're going to leave this off on a high note because I'm about to end everything. And thank you guys so much for watching the stream. If you watched it all the way through, thank you. For those who are catching a replay, thank you, thank you, thank you. Thank you so much for supporting me. I love y'all. That's why I do this. I want this channel to be as educational for you as it is for me too. And now I'm learning new things. I didn't even know about the financial diet. So we're going to go through that next week. And I will say this though, like, take care of your body, your mind, your mental, take care of your pockets, and start taking care of yourselves. Get to where you need to be. And I promise you, you're going to be in a much better position later on. I can almost guarantee that. So on that note, I appreciate you all. Love you all the long way. And I will be back next week with some more educational content. Bye, y'all. Until next time. See you next week. Thank you, guys. Bye.